All set.
Yes, and for your information, Dan will be joining us later. He's at a school somewhere, so, okay. Well, all right then, we welcome and good morning, everyone. Today is Friday, March 4th. And today the committee will be have public hearings for 4 of them, followed by 2 work sessions. And I will introduce myself. I am Senator Susan DeChambeau from, where am I? District 32. And I represent the city of Biddeford and the towns of Dayton, Lyman, Alfred, Kennebunk, and Arundel. I forget now after a while. And now I will have other members introduce themselves, and I'll begin with the House co-chair. I almost called you Elizabeth Warren. Wow. Oh. Representative Warren. Right ahead.
Thank you, Senator. My name is Charlotte Warren, and I represent the towns of Manchester and West Gardner and the city of Hollowell in the House.
Thank you. And Senator Searway.
Good morning. I'm Senator Scott Searway and represent District 16, which covers Waterville, Winslow, Fairfield, Benton, Albion, Clinton, and Unity Township.
And Representative Pickett.
Good morning, Senator. Good morning, everyone. My name is Dick Pickett. I represent House District 116, the towns of Mexico, Dixfield, Peru, Canton, and Hartford. And today is a wonderful day. It's my wife's birthday.
Oh, happy birthday.
She'll be celebrating it alone, probably. Okay.
She just saw it. Thank you.
Okay, that's a reason to finish by 4 today. It's very important.
Representative Morales.
Good morning, everyone. My name is Victoria Morales, and I represent House District 33, the west end of South Portland.
And Representative Costain.
Good morning, Madam Chair. Dan Costain, District 100, which is part of Etna, Dixmont, Newport, Plymouth, and Corunna. Thank you.
Thank you. Representative Pluker.
Thank you, Madam Chair. I'm Bill Pluker. I represent Warren, Hope, Appleton, and part of Union, House District 95. Glad to be back with the committee. I was out with a bum back for most of the week, but I'm back. Thank you.
Boy, we all have aches and pains and illnesses here. That's what work does. Anyways, Representative Reckitt.
Thank you, Madam Chair. My name is Lois Reckitt. Occasionally mixed up with Dick Pickett, but really it's Lois Reckitt. And I represent the east end of South Portland, District 31.
Thank you. Representative Luckner.
Thank you, Madam Chair. Good morning. My name is Grayson Luckner, occasionally confused with Bill Pluker. I represent District 37 as part of Portland. Thanks.
And Representative Renicki.
Thank you, Madam Chair. I don't think anybody confuses me with anybody at this point. I am Shelley Rudnicki, and I represent House District 108, which is Fairfield, Mercer, and Smithfield. And I don't know about the rest of you, but I am ready for some warmer weather.
Well, you're not in Prescal today at 17 below, but anyways. And that is our committee. I would also introduce our committee clerk, Deb Fahey, who, for those of you who are new to doing this, she will be putting the numbers of the bills that we are discussing in her frame, so you can know which one it is. And we have 2 policy analysts with us today, Dan Tatakoff and Jane Overton. So we can begin. I will tell you the bills that we will be hearing today. I want to remind everyone that the first 4 are public hearings. And there are, the heavier bills are saved towards the end. They're very involved. Let's have a public hearing where we ask appropriate questions. And as far as sharing how we feel about these, let's wait till the work session because we've just got to keep this moving. So this is for the public to tell us if they're for or against these bills. So I hope we stick with that for today. The first bill we're gonna hear from is 756, and that's an act regarding criminal services for juveniles, followed by 1654, and that is an act to stabilize state funding for county corrections. Third bill this morning, and maybe this afternoon, let's hope not, LD 1988, an act to establish the provisions of emergency medical services by an ambulance service is an essential service, and to ask for a blue ribbon commission. 1999 is the fourth bill, an act to require civil rights officers at law enforcement agencies. And the work sessions will be 1552, an act to provide re-entry services for persons re-entering the community after incarceration, followed by 1862, which is our last bill of the day, an act to strengthen Maine's Good Samaritan law concerning drug-related medical assistance. So that's it. So we can begin, and this is a public hearing. I should have asked, let's see. We have with us, let me see. This is an act regarding criminal services for juveniles, and the sponsor is our own Representative Morales, and I will turn it over to Representative Morales.
Thank you, Madam Chair. Good morning, friends and colleagues on the criminal justice and public safety on this beautiful sunny day. I am proud to present LD 756, an act regarding criminal services for juveniles. At the outset, I want to acknowledge the fast pace of the legislature at this time to do our important work and to express my deep gratitude to everyone who has come together, all of the young people, advocates, service providers across all sectors, policy experts, friends, and colleagues to work on this important policy. What I promise today to everyone listening is that I will work with you all in good faith over the next 2 months of this session as we discuss this policy all the way through this committee, other committees, and to the floors of the House and Senate. What I can assure you is that none of the policies in this bill are new. They were all discussed in the year-long Juvenile Justice Systems Assessment Task Force that I participated in, along with the chairs of this committee, Representative Patrick Corey, the Department of Corrections, Education, Children's Cabinet, Departments of Labor and Health and Human Services, and the Judicial Branch, Justice Involved People, community service providers, advocates, the recovery community, and many, many others. And these policies continue to be discussed with every bill before this committee, every report presented by the department, every budget discussion, etc. As members of that task force, we learned about examples from other states that have proven to be successful at preventing young people from entering systems through oversight, accountability, and resourcing the community continuum of care. What I am presenting to you today is in line with our state's collaborative and inclusive learning process through the task force and other processes, and is consistent with best practices in juvenile justice reform. Last year, and this, I'm getting into the details of the bill here. Last year, we removed a provision from Title 15 with the support of the Department of Corrections that allowed judges to sentence young people to the department for their care. Sections 1 and 2 of this bill are additional sections in the code that align with that policy by removing the provisions in the code that allow incarceration to protect children from harming themselves and to provide treatment. Section 3 of the bill is critically important. It requires that children sentenced to detention or commitment under Department of Corrections custody must have a needs assessment, an individualized needs assessment completed once they are incarcerated. For decades, we have heard over and over from the judicial system, from prosecutors, from the Department of Corrections, from practitioners and service providers and individuals that we incarcerate children because there is no other place for them to go. We do not currently conduct an individualized needs assessment, which is different from a public safety risk assessment. A needs assessment determines what the child needs on a foundational level to improve their behavior in the community, whether the child or family is housing insecure, food insecure, has medical needs, whether the child has experienced trauma, has a parent in prison or jail, needs additional educational support or behavioral health support, needs job training, supportive housing, etc. Conducting a needs assessment is in line with best practices and will individualize the approach to creating the best rehabilitation plan for each child. This approach is similar to how the regional care teams assess the needs of each child they seek to divert from the system in the 3 Department of Corrections regions currently. The data from this approach shows that these teams are over 80% successful in diverting young people from the system and dramatically reducing recidivism. This approach is also very similar to how Maine's current education system utilizes an individualized education plan, an IEP, for each child in need of special education services in Maine. And as we know, nearly 90% of the children in Department of Corrections custody have an IEP. Sections 4 and 6 provide the resources to meet the needs of the children identified in each plan, and I'll discuss those now. Section 4 of the bill provides that the Governor's Office of Policy, Innovation and the Future, GOPIF, through their existing connections with providers in the continuum of care and through their work with the Children's Cabinet, will create a pilot program to be administered by a nonprofit entity to invest $1 million to fund small community-based services statewide for young people. Section 5 of the bill provides that OPEGA will, by March 2023, recommend an appropriate oversight plan for juvenile services. There are many models to review, including recommendations made by the Children's Center for Law and Policy, the Juvenile Justice Research and Reform Lab at Drexel University, and the Center for the Study of Social Policy, as well as the approaches taken in other states in providing oversight of each state's juvenile justice system, including but not limited to implementations in Connecticut, New Hampshire, Kansas, Kentucky, and Utah, and the ombudsman model that we use here in the Department of Corrections here in Maine. Section 6 of the bill establishes an ongoing general fund appropriations of $7 million, beginning in fiscal year 2022 to 2023, to the Department of Health and Human Services, the Department of Education, and the Department of Labor to expand child and juvenile services in the following areas: youth development, crisis response, mental health, peer support, restorative justice services, trauma responsive services, and services for victims of gender-based violence. It also establishes an ongoing general fund appropriation of $4 million, beginning in the year 2022 to 2023, to the Department of Health and Human Services to expand housing and related resources for children and juveniles and their caregivers in a manner that prioritizes investment in service models and resources accessible to children and juveniles, including but not limited to transitional housing, emergency shelter, and mobile respite beds, host homes, and rental assistance. For context, in terms of the investment this bill envisions, in 2021, the Department of Corrections received a total of 2,757 referrals of youth, 200 detention admissions to Long Creek, and 19 commitments to Long Creek. Though the majority of the referrals to the Department of Corrections are dismissed or diverted, these numbers of referrals can be used as one indicator to estimate the baseline population of youth in need of preventative, community-based programming and diversion services. In reality, by focusing on resourcing the Department of Education, the Department of Health and Human Services, and the Department of Labor, the number of youth who will be served the positive net widening effect will be greater, because these investments will also benefit youth who are at risk of referral to the legal system and provide preventative services to avoid their involvement with the criminal legal system. Given these numbers and the appropriations this bill seeks, the average investment in each child under this bill is approximately $4,352 a year. This amount is comparable to program costs of many of the most common diversion programs per youth, and far less than the cost of hospitalization or incarceration. Some youth will have service needs that cost less than this amount, such as a referral to a mentoring program, which could cost $2,500 per year per youth, whereas others may have more needs and could exceed those costs, such as functional family therapy, which is upwards of $7,500 per year per youth. So I thank you so much for the opportunity to present this important policy. There are many folks with experience and expertise who will be able to answer questions, who are here to testify, but I'm happy to take any questions. Thank you.
Very well, thank you. Any questions for Representative Morales from the committee members? Senator Seaway, please.
Thank you, Madam Chair. And thank you, Representative Morales, for bringing this forward. I can see where this might be helpful on deferred dispositions, on referrals, and how this could, enhance that. Is that basically what you're trying to do, is enhance that piece?
Yes, I would say the answer to that is yes, is to really provide the resources necessary so that there are places that young people can be referred to. Absolutely.
The question I have is two places where it's crossed out. It says to protect the juvenile from an immediate threat of bodily harm. And also the juvenile is in need of correctional treatment that can be provided most effectively by the juvenile's commitment to an institution. Sometimes, I hear you on the deferred dispositions. There's a lot of them. They try to help juveniles. The system is different than adult system. The juvenile system is mostly trying to get them back in the community, like you're talking. But there are safety issues, and for public safety and also for themselves. And so when they cross this out, I kind of wonder why this was crossed out.
Thank you for that question, Senator. And to the exact reason that you just pointed out, these two sections that are crossed out have nothing to do with public safety. They have to do with the safety of the child. And what this policy envisions is that by resourcing the community, that the safety of the child and the needs of the child can be better met outside of an incarceration facility. And so to no longer recognize that incarcerating young people does not protect them, and it does not provide them with treatment. And so that's sort of the intent of crossing out these two sections, if that makes sense to you.
Well, the problem is on law enforcement, they have to contact the probation officer for juveniles if there's a serious issue, and they kind of take it from there as far as making any decisions. And it looks like you're taking out the say of the probation officer and the courts, and that's kind of I just don't know how this works.
Senator Seaway, I believe she did answer your question, and that's her position. And
Okay.
I know your argument can be the other way. And
Well, I'm not arguing. I'm just trying to figure it out.
yeah, we can bring that up and have a long discussion on that. I
Oh, yeah,
understand.
thank you.
That's all
Well, if
right.
I may respond very briefly, Madam Chair, I think to your point, Senator, these two sections are talking only about detention decisions, and we acknowledge that probation officers play a very important role and in the referral process. And so this does not in any way limit their ability to refer children to other services and needs that they have. in fact, we're seeking to resource those so that they can they're better able to meet those needs. Thank you.
Thank you.
Okay, anyone else have any questions? I will state, Representative Morales, I'm glad you had me come back to the thinking that this is on detained individuals, because on section 3, I underlined, why would you have a service provider independent of the department? But again, this is to conduct individual needs assessment for the juveniles detained in the custody, correct? They're not sentenced there. Okay, is that, am I
Detention
correct?
and commitment, in the same way that we have individual assessments regarding competency hearings. Those are all independently conducted. It's very similar to that, but it would be detention and commitments.
Okay, thank you. All right, I don't see anyone else from the committee asking a question. I will ask of the attendees, those who are in support, are there any legislators who wish to speak? Or I don't know if there's anyone here from the Department of Corrections either. So I will turn it over. Anyone in support, please raise your hand and we'll have you come in. And we begin with, well, he's almost a member of this committee, Michael Cabetta. Appreciate having you here. Craig Marley and Atlee Riley. We'll begin with those three. Welcome, Mr. Cabetta.
Thank you very much, Senator DeChambeau, for bestowing on me the highest honor of my life, which is almost membership to this.
Before the session's over, we'll have a seat for you. Go right ahead.
I don't deserve it, but I would gratefully accept. You all ran for elections, and I did not. My name is Michael Cabetta, and Senator DeChambeau, Representative Warren, and distinguished members of this committee, good morning to you all. I'm Policy Counsel for the ACLU of Maine, a statewide organization committed to advancing and preserving the civil liberties guaranteed by our state and federal constitutions. And on behalf of our members, we urge you to support the amended version of LD 756. As you all know, for too many Maine children, the juvenile justice system has become a place where children who need expert and specialized care do not receive appropriate behavioral and mental health services. 2 years ago, the Center for Children's Law and Policy found in a report that, quote, in 53% of cases, the reason for detention at Long Creek was to, quote, provide care for youth, and that 72.7% of detention stays lasting longer than 30 days at Long Creek were for youth awaiting placement in more appropriate settings. Moreover, the report showed that public safety is often not the primary reason for detention. The report stated that in 47% of cases, youth were held in detention for 3 days or less, suggesting there were not significant public safety risks, and, quote, low-risk youth staying substantially longer than high-risk youth at Long Creek. In short, we knew 2 years ago that we are sending kids to prison because of the lack of community-based programs and services to provide supervision or housing. Another major finding from the CCLP's last report is that an overwhelming proportion of incarcerated youth have a recent history of mental or behavioral health difficulties. The report found that 69% of youth who were committed to Long Creek received behavioral health services through Maine Care the year before they were committed, with 55% having experienced residential stays and 16% psychiatric hospital stays. Then and now, the juvenile justice system has become the system expected to provide behavioral and mental health services for Maine's youth. However, the justice system is not equipped or intended to be a healthcare provider. To remedy this problem, the CCLP itself recommended strengthening the continuum of community health programs. This bill would do exactly that. You've heard from Representative Morales about the precise appropriations that this bill would make, and they're in my written testimony as well, so I won't recite them here. I'll conclude by repeating that the juvenile justice system has not provided necessary health care for Maine's children, and it's time to try a new way. Each of the investments proposed in this bill will pay dividends in youth health and healing and avoid traumatization and entrenchment in the criminal legal system. We urge you to vote ought to pass, and I'm happy to try to answer your questions.
Thank you. Any questions for Mr. Capetta? Seeing none, again, thank you for coming.
Thank you, Senator.
I will now recognize Greg Marley. Welcome.
Thank you very much, Senator DeChambeau, Representative Warren, and members of the Criminal Justice and Public Safety Committee. My name is Greg Marley. I'm the Clinical Director and the Director of Suicide Prevention for NAMI Maine. And NAMI Maine is strongly in support of the development and carrying forward of LD 756 as a bill to support alternatives to incarceration. We are committed to creating and supporting a system of juvenile justice that supports and prioritizes recovery and rehabilitation. And that recovery and rehabilitation for many of these youth is from trauma, from mental illness, and substance use. And all these I see are very needed alternatives to incarceration. Certainly the cost of treatment has been laid out. Cost of treatment and support is far less in most situations than the per person cost of incarceration. So we see that the elements of the bill as laid out by Representative Morales, and I appreciate her work on this, is to create and support systems of intervention that prioritize recovery care, that prioritize housing, and supports for developing skills for education and skills for work to avoid as an alternative to incarceration where it is not needed. It feels like all too often, as has been described by Senator Morales and others, that we have a problem and we have too few solutions. And if the hammer is the incarceration, and that's the only one we can swing at the nail, we're making mistakes. So in that respect, creating community services, increasing crisis supports, that data of 88 crisis clinicians and 2,500 law enforcement officers in the state of Maine tells you where, the hammer too easily swings. And the law enforcement will agree with that. Supporting for housing and housing options are needed. So again, strongly support this as a direction, and we're putting in written testimony that'll put in more data, and appreciate your work. I'm happy to answer any questions from NAMI Maine's point of view.
Very good. Questions for Mr. Miley? Thank you very much, Mr. Miley, for coming.
You're certainly welcome.
I will bring in a few more people, Lindsay Rosenthal and Jill Ward. And I will recognize Atlee Riley.
Thank you very much, Senator DeChambeau, Representative Warren, members of the Committee on Criminal Justice and Public Safety. My name is Atlee Riley. I'm the Legal Director at Disability Rights Maine, which is Maine's protection and advocacy agency for people with disabilities. I'm also a member of the Juvenile Justice Advisory Group, and I served on the 2020 Juvenile Justice System Assessment Task Force. Thank you for the opportunity to testify in support of LD 756. As this committee knows, the final recommendation in the 2020 system assessment was to achieve removal of all youth from Long Creek. While I understand that there's disagreement within this committee and beyond about the amount and type of secure placement options that Maine may need, there's a general consensus that Maine doesn't need anything close to the capacity it currently has available at Long Creek. Using this consensus as a starting point, LD 756 would help Maine take the next step in the process of moving beyond that institution. LD 756 would bring Maine's juvenile code into alignment with national best practice by removing authority to incarcerate children to protect them from bodily harm or to provide treatment. We should certainly ensure that children are protected from harm and that they have access to treatment. But we must abandon the notion that incarceration is an appropriate means of achieving either of those goals. LD 756 would also require individualized needs assessments of all young people in the custody of Department of Corrections over a 6-month period. These individualized assessments would be designed to identify the services and supports needed to safely and effectively meet the needs of children who have been detained or committed to Long Creek. This is based on an understanding that public safety goals are most likely to be achieved when we meet the needs of Maine's children and families. And to address these needs, they must first be identified. LD 756 would accomplish this and result in an aggregate report that outlines the services and supports needed, whether or not they currently exist in Maine, to avoid the unnecessary institutionalization of Maine children. LD 756 also calls for an initial investment of $12 million to support the development of resources to meet the identified needs of these youth. The lack of adequate and appropriate community-based behavioral health services for Maine children and families is well documented. And given the clear harms associated with institutional placements and Maine's legal duty to avoid unnecessary institutionalization of children, investments like those outlined in LD 756 are necessary. Thank you again for the opportunity, and I'm happy to answer any questions that members may have. And thank you, Representative Morales, for bringing this forward.
I have Representative Pluker has a question for you.
Thank you, Madam Chair, and thank you, Mr. Riley, for being here. When we're looking at Section 3 in particular, do you see the individualized needs assessment as being a one-time thing or an ongoing thing? What's the intent of that part?
Well, I can't necessarily speak to the intent. My understanding of the way that it's written is that this is a 6-month process to look at the youth that over that time period are there, so that we can get a real good sense of what their individualized needs are and try to meet them. I think the second piece of it's also important to aggregate the learning from those individualized assessments into some more general report so that we can identify the services that may not exist in this state, or may exist on paper but not actually be available, or may be available but not available with the sufficient intensity and duration to actually meet the child's needs. Some families that get services, they only get a portion of what the child actually needs, and people may consider that as a failure of treatment when the youth doesn't respond to those services. But we haven't actually delivered. We often deliver services based on the provider's capacity at that time for that youth and that family to provide them. And so my understanding of the idea behind these assessments is to really step back and not say, what do we have and which box can we put this child, but what does this child need? And if we don't have it, we need a plan to develop it. And then that flows into the resources piece. Was that responsive enough? I might have wandered.
I think it was good. Can I have one follow-up, Madam Chair?
Yes, go right ahead.
And how do you see that as being, so you're saying right now you feel like we're fitting children into boxes as opposed to developing the programming that's necessary for them? And is that, could you just say, what do you see changing as a result of this bill versus what we're currently doing?
Well, honestly, I think what this bill does, and building off of a lot of the work that's been done, the broad stakeholder work, is it allows for kind of a proof of concept. Because I've been a part of, some discussions in this committee that, I understand everybody has everybody's coming at this, I think, in good faith, and there are competing concerns. And I think we talk about these youth sometimes in ways that don't really fully capture kind of their needs, their humanity, their experiences. And so it's to really look on an individual level and try to meet those individual needs and decide, identify through a collection of these individual assessments where we have significant gaps that really need to be closed, and then also to move the resources and the efforts to address those identified needs to entities within the state that have existing obligations already to do that, and away from the Department of Corrections for youth who, and I think people can disagree about the number, but I think everyone would agree that there are youth who we are asking the Department of Corrections to serve that nobody thinks should be there, and that's wholly inappropriate. And so this is to help us really understand, so we don't talk about these youth in the abstract, but we really understand what they need, and we take real affirmative, clear steps based on data and an identification of needs to develop programs to meet those needs.
Thank you. Appreciate it.
I then have Representative Warren, followed by Representative Pickett.
Thank you, Madam Chair, and thank you, Mr. Riley, for being here. And just a big thanks to Disability Rights Maine and yourself for all the work you do for the children currently in Maine. My question is, what do you see as the overall goal of this proposal in regards to children who become involved in the legal system in Maine? Kind of a broad question, but could you give me what you see as the goals of this bill?
Well, again, I don't want to I don't want to put words in Representative Morales's mouth, but what I see this bill potentially accomplishing is a couple things. Youth are going to become involved in the juvenile justice system. Right now, I think there are a lot of people that are involved in that system, judges, prosecutors, defense attorneys, that all find themselves in positions again and again, wishing that they had different options, different alternatives. And so I think what this bill will do is really force us to roll up our sleeves, looking at individual children and their individual circumstances, and begin to develop those alternatives. And I think the effect of that will be that we'll have structures in place that will allow for diversion earlier from this system. And ideally, once we get something more approaching a functioning children's behavioral health system, will prevent the occurrence and the involvement in the first place, right? But that's down the road. But I think this is a very ambitious proposal. But it's based, I think, on a lot of the work that's been done over the past several years. And I think that adequately resourced and supported, it will put Maine on a path to really meet the needs of these youth early and prevent involvement. But right now, I think its immediate goal in the 6 months is to develop some off-ramps for the youth that we can develop some off-ramps for. And in doing so, prove that we don't really need to do what we're doing right now, and we can achieve public safety goals and other goals in a much more appropriate way.
Thank you. That's very helpful.
Representative Pickett.
Yes, thank you, Madam Chair. Thank you, sir, for being here. Question I have for you is when we talk about the assessment that is had, or as far as that goes, any part of the bill as the transition goes through, as the juvenile is being worked with. My question is, what role? Because something we don't hear about, and at least I haven't heard mentioned in many of these issues we're dealing with juveniles, is what role does the parent have in this process? How are they involved in it? Is it if their child is put into a facility like Long Creek or whatever, or if it goes into a community base, what role do they have to play? Because obviously they should have a major role to play in it. You would think, even if they have a problem child, it may not be their problem. But so how does that all work? Because I'm a real advocate of parents taking the responsibility for their children, but when their children have issues that need to be addressed in other ways, they still need to be involved in it. So can you just give me a little bit of idea on how that would work, at least how you see it? Sure.
I'm trying to think how best to answer that concisely. I think the role of the family will be central in most of these instances. I think the idea of an individual assessment is to be just that, individual. So I don't think these things will look the same for any two youth. But I would hope, and there's information in there about a multidisciplinary team, that someone with a social work lens or something really is looking at what are the strengths of this family. And a lot of times we look at deficits, but we don't do the work to identify strengths. And a good assessment like this would really look at trying to identify maybe not just the immediate family, maybe looking a little broader. Where are the people in this youth's life who are already in their life, who can be supported to provide the sorts of natural supports that we all probably needed and got as we were growing up, as we were making mistakes and learning from them. And so I think a good assessment is going to, well, a good assessment has to take a look at what are the resources and the family resources available. A lot of these youth, my guess is that people will find that the families have been asking not just for a week or a month or a year, but for a very long time in various ways, explicitly or just, by the nature of the behaviors that are coming. They've been asking or presenting as in need of services. And in many cases, I think these assessments will determine that they haven't been provided, or if they've been provided, they haven't been provided with the type of intensity that family needed and that youth needed at that time. So yes, I share your desire to involve the families, and I think any good individualized assessment, like the one I understand is proposed here, would have to do that.
Thank you, sir.
Seeing no other members with questions, thank you, Mr. Riley.
Thank you.
And now I will recognize Jill Ward. Welcome.
There, I'm unmuted. Thank you, Senator DeChambeau, and thank you, Representative Warren and distinguished members of the committee. It's good to be here with you this morning. My name is Jill Ward, and I'm a resident of South Portland, Maine, and I currently direct the Maine Center for Juvenile Policy and Law at Maine Law, and recently served as one of 3 co-chairs of the esteemed Maine Juvenile Justice System Assessment and Reinvestment Task Force. I'm happy to have served alongside of several of you on that committee. And I want to touch upon 2 things here. I'm going to divert a little bit from my testimony prepared to answer some of the questions and address some of the issues that have come up so far in the public testimony. I did submit extensive written testimony that I would refer you to for resource and reference on other aspects of the bill. But I want to speak to 2 things primarily. One, the funding in the bill is critical to strengthen the continuum of care. And I think it's important for the committee to understand that the rationale for that funding came in part from the work that the Department of Corrections is doing along with myself and other members of Cutler Institute's public policy program to facilitate these regional care teams across the 3 regions of the state. And we have identified through this work housing as one of the top needs, as more than half of the young people that we have tried to meet the needs through these regional care teams have needed housing assistance over the last 18 months of this initiative. And the other needs identified, which have been enumerated by Representative Morales, have included things like mobile crisis services, substance use treatment, technology supports, and access to case management, counseling, and mental and actually primary health care. So the funding proposed would address these gaps, and I think would also allow for them to be addressed in rural areas. The second thing I just want to speak to is the system assessment. Part of the work that the Department of Corrections is doing is setting up 2 work groups to deal with the provision that was approved in the governor's budget to look at small therapeutic alternative residences that are being called for, and to determine how additional community services budget monies can be spent. And these system assessments will provide really important data around what youth's needs are in order to ensure that public dollars aren't wasted, and that we are, as Mr. Riley explained, really matching youth needs with what is needed to be developed in the community if it isn't already there. And so those assessments too are being proposed to be done on a one-time basis to provide this information. But I would suggest to you that there are other jurisdictions that are adopting this as a regular practice to meet kids' needs and keep them out of the system, or once they are in the system, to most appropriately respond to what their needs are. Because we know if we meet the unmet need, we mitigate the risk. And so really focusing on needs and not so much on risk is, I think, an overall goal of this, and a part of the shift away from relying on incarceration to meet children's needs. And I'm happy to answer questions or provide any information on additional models or resources relative to the proposals included in the bill. Thank you.
Thank you, Ms. Ward. I have, excuse me. Representative Lookner has a question for you.
Thank you, Madam Chair, and thank you, Ms. Ward. I'm just looking at section 5 of the bill, and which directs OPEGA to look at oversight models for juvenile corrections. The other states have oversight structures for juvenile corrections, and how is this different from the role that JJAG plays? What's the difference there?
Yeah, so thank you for that question. So the Juvenile Justice Advisory Group is a federally constructed advisory group and does not have any authority to oversee state agencies whatsoever. So what states traditionally have done, and Representative Morales alluded to this in her opening remarks, is that they have a committee or a council that oversees implementation of reform efforts, and it's usually a multidisciplinary body that's authorized by statute to oversee both the system and potential reforms that might have come out of something like what we just completed with the system assessment process. Additionally, a majority of states provide oversight, like standing oversight, of child serving systems through either an ombudsman office or an office of the child advocate. Our neighbors in New Hampshire, Massachusetts, and Connecticut all have an office of the child advocate that actually does oversee and monitor youth in all youth serving agencies, not just child protection and child welfare. Maine's ombudsman only has authority over the child welfare protection system. And my hope would be in asking OPEGA to do a review of these options, assess what would be the best option for Maine to ensure that all of the children who are being served by state agencies have some kind of oversight and guarantee of protection, whether it's expanding the role of the ombudsman, whether it's in establishing an oversight council. I don't know, I don't have that answer, but this process would set Maine up to meet that standard and have that in place.
Great, I appreciate that. Thank you.
Sure.
Anyone else have questions of Ms. Ward? Seeing none, thank you for your testimony, Ms. Ward.
Thank you.
I now will, I'm sorry, I should have welcomed Whitney, okay, Rosenthal, all right. And I will bring in Whitney Parrish and Al Cleveland. Ms. Rosenthal, you have testimony in support?
Yes.
Okay.
Good morning. My name is Lindsay Rosenthal, and I'm the director at the Bureau Institute of Justice's initiative to end girls' incarceration. Thank you, Chair Senator DeChambeau and Representative Warren for holding this important hearing, and Representative Morales for introducing LD 756. I'm here today to testify in support of the bill. The Bureau Institute is a national criminal justice reform organization. From 2018 to 2020, we worked with the Maine Department of Corrections to end incarceration of girls. We commend the progress the state has made in reducing its youth incarceration rate, but in order to protect this progress and take it further, Maine must invest in its continuum of care to support youth throughout the state. Incarcerating children in the absence of a public safety risk is not an evidence-based practice. The evidence shows incarceration is harmful, does not build safety, and is very costly. We strongly support the bill for three reasons. First, the bill will revise Maine's juvenile code to bring it in line with national best practice by removing authority to detain young people, to protect their own safety from bodily harm, or to incarcerate them for treatment-based reasons. Incarceration is dangerous, and it's no place to protect or treat youth who are experiencing trauma and in need of care. The Department of Corrections is not a service provider, and incarceration is not an acceptable response to child abuse. Young people should receive treatment in the community provided by agencies with a mandate to ensure safety, well-being, and healthy development of Maine's youth. Second, the bill invests $12 million in a down payment on the community-based continuum of care that Maine needs excuse me, to serve young people safely and effectively in their community. Third, by making this resource available to the community, the bill ensures that the youth are not referred to the legal system to receive support, as is currently the case for many young people. A fully funded continuum of care will reduce reliance on law enforcement, emergency rooms, and out-of-state institutional settings. Through investment in prevention, Maine can build a continuum of care that prevents crisis rather than one that's organized around putting out fires for those who are struggling most. or reacting to violence instead of preventing it, and actively fostering safety. By ensuring young people are no longer referred to the legal system because of service needs, the bill will allow the legal system to focus on effectively responding to the small number of youth who may cause serious harm. It will provide the resources to hold youth accountable, help them heal from harm they have suffered, since nearly all are victims long before they ever cause harm, and offer meaningful supports to those who they have harmed. It's time for Maine to invest the dollars necessary to end reliance on incarceration and ensure all youth have the opportunity to thrive. LD 756 provides a framework to accomplish these goals, and we stand ready to work with the committee and agencies to ensure the safety and well-being of Maine's youth. Thank you.
Right on the button, 3 minutes, Ms. Rosenthal. Ms. Rosenthal, I missed at the beginning if you're associated or affiliated with any organization. Could you tell me after you said your name? I didn't pick it up afterwards.
Yes, I'm with the Vera Institute of Justice. We're a 60-year-old nonprofit that provides criminal justice reform services across the country. And I'm the director of our initiative to end girls' incarceration. We had a technical assistance partnership with the Department of Corrections from 2018 to 2020.
Great, thank you. I have Representative Warren.
Thank you, Madam Chair. Thank you, Ms. Rosenthal, for being here. You mentioned the continuum of care. Can you talk a little bit to the committee about what you mean by that?
Sure. So the research shows that there's a variety of needs that are driving youth incarceration. We've talked about some of them today, family challenges, housing needs, things like that, mental health needs that bring young people into the system. So there isn't one program or one resource that can meet all of the individualized needs of kids. So one thing is just making sure that there is a range of services available in the community that are matched to the different needs we see among youth in the legal system. And then the other thing that we mean by a continuum of care is ensuring that there's not just responses to crisis when youth are already struggling and have been for a long time, but there are preventive resources that are specifically targeted to disrupt pathways into the legal system before a young person is ever arrested. And that is an evidence-based way to promote public safety. We know what causes crisis. We know what families and children are struggling with, and the earlier that we can provide holistic support to families in need, the better. But there are many communities in Maine that just simply lack the services they need, especially in rural areas, and lots of gaps in Maine's continuum of care.
Thank you. Just a quick follow-up.
Yes, go ahead.
So what I heard you say is a continuum of care is really about creating prevention programs, that public safety is really about prevention. And the way we're currently responding is just to crisis as opposed to prevention. Is that, do I have that kind of correct?
That is part of it. So prevention resources are one piece of a continuum. There also needs to be intervention services for young people. So who have fallen through the cracks and who have been arrested and are being referred to the legal system, making sure that there's diversion programs that we know are more effective than incarceration for young people. And there's plenty of evidence to show what those programs are, and we can provide more data on that. And then lastly, for kids who have already been in the legal system, part of the continuum is community reintegration services to make sure that once they leave custody of the Department of Corrections, they receive the support they need to be successful in the community. So they're not cut off from services once they're released from the Department of Corrections custody. And one thing it's important to note is that because so many of these services are only available provided by DOC, in Maine's current continuum, kids often need to be connected to the Department of Corrections in order to access services. And when they're released, they can experience disruption in important supports.
Thank you for that. I'll take you up on the offer of getting us more of that data before the work session. Thank you.
And that's it. Thank you, Ms. Rosenthal, for coming. Thank you. I will recognize to come into the room Miles Villalobos. And so I will begin with Whitney Parrish, followed by Al Cleveland.
Thank you, Madam Chair, and it's wonderful to see all of you. It's been too long as the Permanent Commission is building our emerging agency, and so I am very pleased to be here. So my name is Whitney Parrish. I am the Acting Executive Director of the Permanent Commission on the Status of Racial, Indigenous, and Tribal Populations, but today I am delivering the testimony of Commissioner Bruce King, who could not be here to deliver it. So I'm going to do my best to be Commissioner King this morning, and I will get started. Senator DeChambeau, Representative Warren, and honorable members of the committee. My name is Bruce King. I live in Brunswick, and I am the co-executive director of Maine Inside Out, a nonprofit organization dedicated to building a movement for transformative justice in which communities acknowledge and attend to the social, structural, and systemic roots of crime and harm. Today, I am representing the Permanent Commission as a commissioner representing a historically disadvantaged racial population of the state. I'm honored to offer testimony in support of the amended version of LD 756, and we extend deep gratitude to Representative Morales for introducing this bill. There's more about the Permanent Commission in the written testimony. Most of us believe that every child, whatever their color, background, or zip code, has the right to grow, learn, and exist in supportive environments that respect their humanity, upholds their dignity, and responds fairly to mistakes and missteps. The current institutional system is damaging to young people, as we have seen in recent well-documented incidents. People are ready to move toward a proven evidence-based solution that sets our kids up for fulfilling lives in their communities. This will not be possible without investment in individualized care. LD 756 invests in the resources and processes needed to meet that end. As a member of the Permanent Commission and a historically disadvantaged population, it's important that I point out that juvenile justice is an issue that does disproportionately impact Black and African American, Indigenous, and Latino kids. The reasons, of course, are varied. Lack of resources for all communities and individuals, and disproportionately these communities, and siloed, disconnected systems all result in greater contact with the justice system and poorer outcomes for youth of color. Additionally, cultural competency around the norms of their communities needs to be factored in when talking about this issue. The mandate of individualized service plans may create a pathway to address these factors and support all Maine youth who experience challenges that contribute to their contact with the justice system, as well as eventually mitigating involvement with systems in the first place. The research is vast and reinforces the hypothesis that individual engagement helps change minds and relationships in ways that system structures fail to do. It is my hope that with the passage of this bill, we can encourage and support the deepening of humanization of system-impacted young people and offer options in the continuum of care mentioned that will be responsive to the needs of youth from diverse backgrounds in ways that treat them as the people they are. Thank you for your time and consideration of this bill, and we respectfully urge you to support LD 756. Thank you.
Thank you, Ms. Parrish. Any questions of Ms. Parrish? Seeing none, again, thank you for coming.
Thank you.
I now will recognize Al Cleveland. Welcome.
Thank you, Senator Shambo. Thank you, Representative Warren. Thank you to Representative Morales for proposing this bill and to all members of this committee. My name is Al Cleveland, and I'm the campaign manager for Maine Youth Justice. Maine Youth Justice is a campaign made up of young people whose communities are impacted by state dollars that are poured into policing and incarceration instead of our futures. We are calling for a plan to close Long Creek, reinvest the operating costs of the prison into community programs, and repurpose the youth prison into housing and a community center. You all know that too well. We are also here today in support of LD 756. This bill takes a critical step towards the investment, care, and support that Maine young people deserve. It will not end youth criminalization or reinvest the operating costs of Long Creek, but is an important step for getting us to a place where this committee can support full closure of Long Creek. This bill will appropriate $1 million to fund a pilot program for community investment. And this model is really similar to the Colorado Wages program that MYJ brought to this committee in 2020. We support this program and we encourage this committee to consider additional investments into this pilot program to support community programs for young people. We know that even with the $42 million per year that the Department of Corrections receives to run the Division of Juvenile Services, they are still experiencing ongoing staffing shortages and have been unable to meet their staffing responsibilities. We've seen from the Center for Children's Law and Policy report in 2020 and the most recent report that came out this winter that Long Creek and the lack of staffing that has happened in the facility has led to harm and poor conditions from young people. We know that continuing to not fund community programs at the same level that state agencies are funded, but expecting different results is a bad idea. Mainers have a responsibility to care for all of our young people and children, and this responsibility means moving away from the outdated and expensive youth incarceration program and investing in transformative initiatives. This bill calls for a $12 million investment into housing, restorative justice, and healing services that Maine's young people need. We know right now with a recent report this January from South Portland that 308 students in the district are housing insecure and without homes. We urge the STIC committee to consider additional investments into housing supports for young people and ultimately to think about the 60 acres of land that is on Long Creek that could be used to build supportive housing into community center for young people. We support the investment into youth safety outside of the Department of Corrections control and would love to talk to this committee about how we can expand youth safety outside of Department of Corrections control through investing in community-based supports for young people. I'm happy to answer any questions. Thank you all so much.
Thank you. I have Representative Pluker has a question for you.
Thank you, Madam Chair, and thank you, Al, for being here. I'm looking at section 4 of the bill, exactly what you were talking about, the pilot program for community-led funding. And has this been tried in other states? And I think maybe in Colorado, could you give us some details around what you've seen or what you know about the program?
Absolutely. We testified about the Colorado WAGES model that I will send the full report again to this committee in our written testimony, and about how that model took funding away from the Department of Corrections into a community-led program that was made up of leadership of directly impacted people, as well as service providers in that area. This program led to investment into 3 different reentry programs for people who are leaving facilities, as well as developing peer support models that were incredibly effective. We've repeatedly seen across the country when state agencies move funding away from typical youth incarceration programs into programs that support young people and the needs they have, that there is less recidivism rates and an ability to support young people recovering from the trauma, the harm, and the conditions that led to them getting involved in the juvenile justice system.
Thank you.
Thank you. Seeing none, again, thank you, Ms. Woodland. We're still in the testimony in support, and I will bring in Mary Bonato and recognize Miles Villalobos. Welcome, Miles.
Good morning, Senator. Thank you. I apologize. I don't have any prepared comments for LD 756. I was actually here for LD 1988. But in hearing the conversation, just wanted to add my support and appreciation for this committee and everybody that's been working on this bill, Senator Morales and all the organizations. My name is Miles Villalobos. I am a paramedic, the paramedic chief currently for Pleasant Point EMS, serving the Passamaquoddy tribe in what is now Down East Maine, Washington County. So my support comes, one, as a community member for this bill, but also from an EMS perspective as a paramedic. And in addition to that, I, for the past few years, have been working intermittently with the Maine Prisoner Reentry Network on a variety of other projects, specifically aimed at creative housing solutions for folks in recovery and reentry. As well as a program stemming from EMS called Community Paramedicine, which I'm certain most folks on this committee and everybody involved in this aspect of things is not terribly familiar with, which is actually, I believe, to be one of the links, and that's what I've been advocating for with Maine Prisoner Reentry Network. So this bill specifically aimed at juvenile services and bolstering the continuum of care that we currently have in Maine and trying to adjust that system. Community paramedics can be very beneficial in those efforts. I'm happy to talk with anybody that's involved in this process another time. I'll stop here. Honestly, I just wanted to show my support, one, again, as a community member, as a paramedic, somebody in the EMS. We deal with crisis intervention on a regular basis. We are ill-equipped, ill-trained to adequately and effectively deal with these situations, whether they're behavioral health crises, for anybody of any age, substance abuse issues, overdose, et cetera. And community paramedicine model that we have actually is very much in line with what's being talked here about the individual plans, the education learning plans. We have something that's called a CHNA, a community health needs assessment. And basically what that does is exactly what you folks have done with a systemic assessment and then this individual assessment of needs. And what we call our social determinants of health. In this case, I believe these would be social determinants of successful prevention or reintegration of a juvenile. And we look at every aspect: housing, food security, education, counseling needs, so on and so forth. So we're fully in favor of everything that's happening here. Thank you again for everybody that's been working on it.
Thank you. We have a question from Representative Pluker.
Thank you, Madam Chair. Mr. Villalobos, would you mind sharing your email and a copy of your testimony with the committee? We'd appreciate that.
I'd be happy to. I don't know the mechanism for that. Representative Rachel Talbot Ross has every means to contact me, but I can share it any other way.
Great. Thank you.
Thank you.
I have a question. You mentioned, and you used the term "we" and about the community health assessment. Who's the "we"? Is that just what you're doing at Pleasant Point, or is this universal with other paramedics? Who's the "we"?
I apologize. It's a complicated answer. Right now is primarily I, to be perfectly honest, in this particular initiative. This is something that I personally have been working on for ever since I've been in EMS for 6 years. But for 3 years, especially with Maine Prisoner Reentry Network and the integration of EMS and community paramedicine and all of these services that we can provide, but are not currently providing. It doesn't currently exist, Senator. There are a number of groups, number of organizations, a number of concerted efforts in a variety of regions all throughout the state that are working towards this. But as of right now, there is no, I have an organization. It's nothing but a shell right now until all of these pieces come together. So that's why it's very, very important for this legislation and all of the other efforts. We need to come at these issues from every possible angle. And my concern has been, and that's why I've been so vocal and so passionate about it, because we see it on a daily basis, where the holes in the system and the safety net are. We see it constantly, and we don't have a mechanism to do anything about it, to respond better. Case in point, I apologize, there's so many things to talk about, but one of the things that's being talked about is creating essentially an alternative destination. So if I have a person in crisis, I have to take them to the hospital or facilitate them going to jail, basically. Those are my only two options as a paramedic in EMS, as the system is. But if you create an alternative destination that is better suited to meet this individual's needs at that moment and beyond, we can get them there. But if you don't have somebody to get that individual from point A to that better treatment facility, we'll call it, that's a gap in that continuum of care. And that's why EMS, especially with community paramedicine, we should be involved in these discussions, because there's so much that we can do that I guarantee everybody on this panel is not familiar with.
I'm smiling because I applaud your ingenuity, especially you're at the ground level and you took the initiative to do this. It's got a great title, Community Health Assessment. So I wish you luck with that. Thank you. So seeing no one else right now, I will close this, the support. Oh, I'm sorry, Mary, I missed you. Mary Bonato, please, go right ahead.
Thank you very much, Senator Deschambeau, Representative Warren, distinguished members of the committee. You've heard phenomenal testimony today, so I'm going to keep it brief here. I also really want to thank Representative Morales for bringing forth this bill, and I'm here today on behalf of GLBTQ legal advocates and defenders where I work, as well as Equality Maine and Maine Transnet.
Everything was fine until you showed up.
I wanted to focus on Section 2 for a quick minute, because the law that it amends, 15 MRS Section 3313, is actually a law that says we are not going to incarcerate young people in a secure facility unless other factors apply. And one of those other factors is that for public safety reasons, the young person needs to receive correctional treatment in an institution, and that's the most efficient way to do it. So this bill, and I think countless bills and hearings you've had already, says we are going to provide the care that people need outside of facilities and in the community. And of course, you know, I also served on the Juvenile Justice Reinvestment Task Force. Again, you've heard all of this before, how much more effective, how much more life-saving, how it builds young people to be successful members of the community. It is when we provide services in the community and not in these institutions. And again, just to quote the CCLP report super quickly here, many youth at Long Creek are there because of unaddressed or underaddressed behavioral health problems, or because of the belief that young people have nowhere else to go. This bill is proposing concrete steps based on all the things you've heard over these many years now to move us out of the status quo and into a much more robust community-based system. I also want to say, as somebody who also practices in other states, that I agree with Ms. Ward about the importance of the OPEGA element here, and that the child advocates in many states have been extremely helpful in identifying a whole range of issues and best practices and concerns about making sure children receive quality services. And I will just say we also support the funding pieces of the bill, each of them, those that are directed to the young people themselves who are in adolescence and growing and really can be contributing members of our adult communities, as well as the family piece, because we need to see young people in the lens of their families. And housing instability was identified as a cross-cutting issue in the CCLP report, as well as poverty. And then thirdly, the small community organizations, the subject of the pilot, those organizations have stepped into the breach and provided essential and life-saving services for people, and we would not want them to be left behind here. Thank you very much. And we hope you will vote to pass. Thank you.
Thank you very much, Mary. I'm sorry we had a little spill of water on the table, so we all panicked. So thank you. Any questions for Ms. Bonato? Great. Thank you for your service. You've been around for a while. Thank you. We will close this. I will now ask those who are in opposition of this bill, please raise your hand and I'll let you in. I've got Tanya Pearson, followed by Christine Tebow. So, okay. Tanya, welcome, and you may begin your testimony.
Thank you. Thank you, Senator Deschambeau and Representative Warren, excuse me, and distinguished members of the committee. My name is Tanya Pearson. I'm an assistant district attorney for York County, Maine. I have spent approximately the past 20 years of my career focused on handling the juvenile docket in York County and being actively involved in various groups committed to improving juvenile justice in the state of Maine. I will be speaking in opposition specifically only to sections 1 and 2 of the bill. Because we just learned of the bill late yesterday, I've not had the opportunity to thoroughly review the other sections. But as a side note, I absolutely support funding to increase services in the community for youth and families and to continue to reduce the need for secure detention. I've worked with many of the presenters this morning, and I have the utmost respect for their positions. I am speaking on behalf of myself as a juvenile prosecutor and for a consensus of the Maine Prosecutors Association. I am not speaking on behalf of the Department of Corrections Juvenile Services, but I will be mentioning the Department of Corrections in my remarks, and I will be submitting written testimony to the committee. I may actually only be speaking on section 1 as I was unaware of the 3-minute limit. So I will, any comments that I don't reach, I will certainly submit to the committee. And thank you for hearing me today. I do believe it's critically important for this committee to hear from the players in the trenches, the boots on the ground. I'm here precisely because I and many others are passionate about juvenile justice in Maine and the young people who are in that system. Section 1 of LD 676. Section 1 of LD 676, if passed, would eliminate the one few remaining provisions of detention, purposes of detention, which is to protect the juvenile from an immediate threat of harm. If you are not already aware, most states have what's known as a CHINS or a PIN system, a child in need of services. This system functions in between the juvenile justice system and the child protective system. In a CHIN system, youth and their families who are struggling are overseen by a sort of family court. Maine has no such system. The Maine Department of Health and Human Services operates on a legal standard of abuse and neglect, a very high standard. The unfortunate truth is that adolescents in Maine are often not served in the DHHS system, primarily because of this high standard for DHHS involvement. And because we have no CHIN system, the juvenile justice system in Maine functions as both a JJ system and a quasi-CHIN system. Recently, this same section of the law was amended to eliminate another purpose for detention, Section 2, which was previously permitted a youth to be detained to provide physical care for a juvenile who cannot return home because there's no parent or other suitable person willing and able to supervise and care for the juvenile adequately. It stripped out an incredibly important tool for JCCOs, for prosecutors and judges to keep high-risk youth safe when their families were unable to do so. Now, if LD 756 is passed, it would eliminate Section 5 of the purposes of detention to protect the juvenile from immediate threat of harm. A young person only ends up in the juvenile justice system if they have been charged with an offense. The criteria for detention is already incredibly limited. In order for a youth to be detained, they must have committed a felony level offense or have previously already been placed on a conditional release and failed to follow that conditional release or refused to abide by those conditions.
Could you wrap up, Tanya? I'm sorry.
No, that's okay. Once a youth is detained, a judge must review that detention within 48 hours. A judge oversees the youth case from that point forward. The elimination of Purpose 5 strips JCCOs, prosecutors, and judges with an extremely important tool to keep high-risk youth safe.
Good. Thank you. Thank you very much for that. And I have Representative Lookner has a question, followed by Senator Seaway. And thank you for coming, Ms. Pearson.
Thank you, Madam Chair. Thank you, Ms. Pearson. So I'm not familiar with this CHINS program, but it sounds like if Maine had safe placements, safe alternative placements for youth to protect them from bodily harm, that maybe you wouldn't have opposition to that section of this bill. Is that fair to say?
I think if we're talking about purely safety for a youth as opposed to public safety, then yes, that's correct.
Okay, thanks.
I'm gonna follow up on that. Ms. Pearson, did we not in the state of Maine have CHINs before?
I I have been a prosecutor for over 30 years, and we have never had a chin system as long as I have worked for the state of Maine.
Okay.
I don't know prior to that.
I think so. Okay, yes, thank you. Just wanted to clarify that. I really don't know why it failed either, but that's okay. Thank you.
It's a great discussion for another day.
Senator Seaway.
Thank you, Madam Chair. I know this bill covers a lot. I just, my concern on this section 1 that you mentioned about number 5, when it says to protect the juvenile from an immediate threat of bodily harm, I mean, I can think of many cases of arson or rape or murder or hard crimes that maybe a juvenile could commit that could cause a family member or a friend or people that get very upset of the victim and want to do harm to the juvenile. Is that one instance where this could actually be bad news to cut that out?
That's not what I'm thinking of in my opposition, our opposition, I should say. I would hope that the DHHS in that situation, that would be an appropriate time for, and the criteria would be established for the department to become involved in that scenario. In theory, I think it's certainly possible. I think it's more about a juvenile's harm to themselves or harm to them by other people in the community. For example, as we know, we're beginning to grapple with sex trafficking, with trafficking of youth in general. And so there are a lot of concerns for, we deal with this on a daily basis. The juvenile community corrections officers and ourselves deal with this constantly, and the concern for a child's safety. And I don't disagree with the concept that simply for a child's safety, it is inappropriate to be holding them at a detention facility. I fully agree with most of the points that have been made this morning. The difficulty is that we don't have any other safety network for those youth now. And they are in the system because we've met a certain criteria to have them in the system. And until we have a better system, they are not safe. They are not safe without us having this tool to keep them safe. I understand that none of us want to detain youth, myself included, obviously, for their safety, that philosophically is an issue for the state of Maine. And I agree with that. But what I'm telling everyone is at this moment in time, we don't have another tool. I think it's incredible that we're working to develop those tools, and I support that fully. But right now, youth are not safe in the community without that provision, is my position.
And just to follow up on this, if you don't mind, Madam Chair, just a follow-up question.
Go right ahead.
So in your way of looking at this, I think this is great as far as maybe for deferred dispositions and whatever, trying to find resources. But what I'm trying to figure out is on this assessment process, if it's taken out of the courts, how do they deal with that on the crime aspect of it?
And I unfortunately cannot answer that question because I haven't read it thoroughly. I got it last night.
Yeah.
I specifically, section 1 and 2 are at the heart of what I do. I think we are always in a better place by providing a needs assessment for youth, but I haven't thoroughly read section 2. So I apologize. I really can't answer that accurately.
Okay. Thank you.
Representative Warren.
Thank you, Madam Chair, and thank you, Assistant District Attorney Pearson, for being here. I appreciate your testimony. And what I'm hearing you say, and I just want to make sure that I'm hearing you properly say it, you're saying you are only opposed to section 1 and 2 because we don't currently have the supports that youth need in Maine to protect them. And because we don't have the supports that youth in Maine need, we have to sometimes incarcerate them to protect them.
I think when we're talking about under section 1, eliminating that purpose, that's accurate. Section 2 of the bill is different. That's a bigger conversation, and I will submit written testimony on that. And I believe the Department of Corrections will be submitting written testimony on that. Section 2 of the bill is a bigger discussion, because we have youth who, from the state's perspective, are dangerous and need to be served in the facility. And we can agree to disagree how we get there. So section 2 is different than section 1. I absolutely, what you are saying about section 1 is why my position is that we should not eliminate that provision at this time. There may be a point in time, as we all hope, that we can get services in place in the community to serve youth and families so that we don't need secure detention for the bulk of the individuals we're talking about under section 1, the youth.
Great, thank you. That's helpful for me. And I just want to follow up with, because I think one of the things that we're both talking about and that all of us talk about, but we don't actually say it, is the amount of youth that are involved in trafficking in Maine. And I'm not talking about drug trafficking. I'm talking about their being trafficked. They are victims of sex trafficking. That's actually why we have this in there. That's why we incarcerate some youth, to protect them, because they are being trafficked. So don't you think that with the services that are considered in this proposal, the services of the 12 million, that would protect these victims of sex trafficking that we all sort of know is part of what's happening, but we don't talk about a lot? Do you think that, I'm trying to get a sense of, you are on the front lines, you are there dealing with youth, you obviously care very much about youth. Is this something that might give some assistance to these youth who need to be protected?
Absolutely. I'm thrilled that we are looking at this globally. I am thrilled that Representative Morales is bringing this to the legislature and we're having these conversations. I think it's really hard to predict in theory how it will protect youth. And all I'm saying is, at this moment in time, we need this purpose left in the code for the court to have the ability, and the JCCOs, but it is overseen by the court, to have the ability to hold a youth on that basis. I'm not saying it's best practices, but I'm saying it's what we have at the moment. And you're right. I mean, that is I deal with that type of case on a regular basis, both trafficking and also, unfortunately, using youth for drug trafficking as well. We just had a very significant case this week that involves youth being used to traffic for adults in drug trafficking. So absolutely.
Thank you. I really appreciate your perspective here. And like I said, somebody that's really on the ground. Jane, or Dan, whoever has this bill specifically for the work session, I would really like to hear from the Office of Child and Family Services. This is the second bill where we're talking about children in Maine, and I don't understand why they're not here. When we're talking about the chins and pins system, why are we not hearing testimony from Health and Human Services? So if we could please ask them to be here for the work session. Thank you.
That's mine. I'll do it.
Thank you, Dan.
Representative Pickett.
Yes, thank you, Madam Chair. Thank you, ADA Pearson, for being here today. My question is simply this. It was brought up a while ago about the closing of our Long Creek facility right now. If I'm understanding you correctly in your objections to 1 and 2, and I think I am, than for to just take and close that facility down immediately without having a place in already there and ready to go for them to go to get to the kind to be in the same protection that we're showing right now, and to protect the juvenile from immediate threat of bodily harm and all of the other things. And some of these that we do know that are there for a reason, and they are dangerous. So in order to make this all work, there still needs to be a place for them to be housed until we have something up and running and ready to go before we can just take and close that facility down. Do you agree with that statement or not? And if you don't want to answer, you don't have to.
No, I'm happy to answer. Thank you for asking it. I do agree with that statement. I think ultimately everyone who you've heard from today and will continue to hear from on this bill probably won't have consensus on whether we need a secure detention facility or not. I, as a juvenile prosecutor, believe that we will always need a secure juvenile facility for public safety and potentially for youth safety. But we probably won't agree on that. But we will agree, I would assume and hope and suggest that we should, that we absolutely want to be working to reduce youth who are held in a secure facility to the lowest numbers possible. And right now, actually, they are the lowest numbers possible for the state of Maine that we've seen in decades. And Maine has worked very hard, the Department of Corrections and the court system and everyone who works in the JJ system has worked very hard to reach those goals. But we still need to address youth safety, which is what I am saying Section 1 would not be adequately, we would not have adequate tools to address that. And then Section 2 is a separate issue of the authority of the court in sentencing high-risk youth.
Okay. Follow up, Madam Chair.
Yes, go right ahead.
And just the other thing I would ask is, it still is a judge's discretion that there are some times where a person is put into the juvenile facility there at Long Creek that is over the age of 18, sometimes up to 21, correct?
That is correct.
So we're not just talking about children here. We're talking about, in some cases, young adults that are in there, and a lot of those young adults that are in there are I'm thinking that are probably in there for more serious crimes. I'm not saying they are, but I know personally of some that are. But so that I appreciate that answer, because I think that's important for us to get out there, that we do need a place until we can find something better, like you said. And the answer is not just closing down what we have. We need to have something ready before we do that. And I appreciate that answer. Thank you.
You're welcome. Thank you.
Very good. Oh, all right. Your hand is still up, Representative Pickett. I now will thank you, Ms. Pearson. It was great seeing you, and thank you.
Thank you.
Christine Tebow. Welcome.
Welcome. Thank you. Senator DeChambeau, Representative Warren, members of the Criminal Justice and Public Safety Committee. My name is Christine Tebow. I am Associate Commissioner of Corrections, and I oversee the Juvenile Services Division. And I am here on behalf of the department this morning to testify in opposition to LD 759. I'm going to focus my comments to sections 2 and 3. Like ADA Pearson, we received this bill late yesterday afternoon. Haven't had a lot of time to really look at it in great detail, but certainly will be prepared for the work session. So with regard to Section 2, which would eliminate the court's authority to place a youth in commitment for the purpose of getting treatment, we oppose that provision because it essentially tears out the heart of the juvenile justice system. The court in Maine is charged with a very serious obligation to ensure that every youth that comes before it who's been adjudicated an offense gets the proper care and treatment. And I know that we all want to hope that youth and families would willingly engage in treatment and that treatment would always be available. That is not true. And I want to point out as well that the courts have the authority to place a youth who's been adjudicated in the custody of the Department of Health and Human Services or the Department of Corrections. Oftentimes, there are many efforts to avoid incarceration, and youth are given opportunities to have treatment in the community. And for a whole host of reasons, we are not successful in having them engage in treatment. Often these are the youth that have the most dangerous and difficult to treat issues, such as fire settings, sexual behavior treatment, sexual behavior issues, or extreme violence. So if a youth is in the community on probation, not in confinement, and refuses to undergo treatment and engage in treatment, what is the court to do to ensure that that youth gets the proper treatment if they are not able to be confined at Long Creek? Similarly, as you've heard, and this is, I think we all agree, this is an unfortunate reality of our current system. There often is not enough treatment available. Every program in Maine, and frankly, in most of the country, can reject certain youth. And those are often the youth with the most difficult, intractable behaviors. So eliminating the court's authority to order that youth confined so that treatment can be received essentially says, if treatment's not available or the youth doesn't want it, it's not going to happen. That is contrary to the very purposes of the juvenile justice system. I see that my time is up. May I continue?
If you could wrap it up towards that, but I know it's hard to do that, but go right ahead, please.
Yes, if I may just make a couple of comments, please, about section 3, the assessments. That is a section that directly impacts the department, as we would be mandated without funding, mind you, to create a system for assessments. Needs assessments are very complex issues. They occur on an individual basis, often ordered by the court, by psychologists, to be very specific. The department also does risk assessments and needs assessments for youth who are in the community. These are being done. And to say that an assessment is done by a multidisciplinary team within 24 hours, we don't see the value in having that mandate and how that is going to serve the court or serve the youth, frankly, to have an assessment within 24 hours when it really warrants much more thorough assessment. And, you know, the bottom line here is this is a bill that presupposes that if we take the responsibility away from the government, these services will occur. My experience in the juvenile justice system is over 25 years. And I have seen many, many good intentions fail because people believe if we just want it to happen, it will. That is not the experience of those of us that have struggled to get the best services for youth. We agree, prevention, early intervention, not confining youth, that is the best way to go. But simply supposing that these intractable problems will be solved overnight if we turn over all of the responsibility to independent agencies is contrary to the experiences some of us have had. So thank you.
Thank you very much, Ms. Tebow. I just want to make a comment which reminded me about needs and risk assessments. The need can be identified as a high need. Then when you have the assessment on the risk, many times the risk is higher than the need. Risk to return to the community, and that's where you're stuck. So thank you. I want to say I've got Representative Pickett followed by Representative Warren.
Thank you, Madam Chair. Thank you, Christine, for being here today and for your years of service in this very important topic. And what I what I wanted to ask you is this, because it is so important and because we all are very concerned and want to do what we can to provide the very best services we can for our youth and stuff. Is there anything else, anything else in the bill whatsoever that you haven't had a chance to just address that you'd like to bring to our attention? Because I think it's really important that we understand where the DOC is coming from in this, because it's a very important issue and a very important matter.
Thank you, Representative Pickett. You know, I haven't had an opportunity, frankly, to even discuss this bill at length with my own team members. So I'm going to give you some of my personal thoughts as a representative of the department, but please understand that others may add to or augment my comments.
I just want to interject here, Ms. Tebow, that maybe, and Representative Pickett, and in all fairness to Ms. Tebow, this just came out. I don't know if there was anyone else from the Department of Corrections coming to speak, but that if we could wait till the work session, is that okay? She would be best prepared, and I would give that option.
I would leave that up to her if it's okay.
Yeah,
Senator,
all right.
She would rather wait and bring
You
those.
can always do it at the work session, but Ms. Tebow, if you feel like you want to continue, please go.
Thank you. I really would prefer, frankly, to wait until the work session and have an opportunity to frankly go back through some of the earlier testimony, which I was not here for some of the proponents' testimony. I had another obligation. I do not expect anyone else from the department to testify, but we will certainly be prepared for the work session.
Okay.
Thank you.
Thank you. Can I have a follow-up,
yes,
please?
Go right ahead.
I guess lastly, what I would ask you is, you said about if the treatment, if a judge was not able to put a juvenile in a position for court-ordered treatment where they could get treatment, and they went into the community and the community-based for treatment, that they would not, if they decided they didn't want to be involved or interact or whatever in the treatment, that would be the end of it. If I understood you correctly, is that right?
That would be the end result. Yes. Let's assume for a moment a youth is adjudicated of a crime that involves serious risk to the public, whether that's fire setting or sexualized behavior or aggression. And that youth is ordered to undergo treatment as a condition of probation, and yet that youth refuses. And that is a reality. Some youth do not willingly engage in treatment. And again, I don't mean to be disrespectful of those youth. There are good reasons, trauma histories, family issues, etc., that contribute to a youth's resistance to treatment. But if that youth is returned to court and the violation of probation is that the youth didn't engage in treatment, well, if that Section 2 is enacted, then the court is sort of stuck, right? I cannot order this youth to be confined to Long Creek where he or she will receive their proper treatment. That's the end of it.
Thank you. I just wanted to be clear on that. Thank you.
Thank you. I'll recognize Representative Warren.
Thank you, Madam Chair. Thank you for being here. Just three really quick things. It's funny how you can spend so many years focused on juvenile justice and then you learn new things. I did not, just because I haven't maybe looked at that part of the statute before, this idea of correctional treatment being at the heart of the juvenile code. And I think what you shared is some of us, and I don't know if you were talking about me, but some of us just wish good things will happen, but they don't always. But I do sometimes wish good things would happen. And I think you said, we want parents to get their kids this treatment. But sometimes parents don't agree. And so I heard you say that that's the role, that you said this bill would cut at the heart of juvenile justice. And I didn't ever see juvenile justice as like taking a kid away from their parents because their parents aren't agreeing to the treatment that the state thinks they need. Is that what correctional treatment is? That a family doesn't follow through with this treatment, and so sometimes there has to be correctional treatment. I want to use the right word. Could you say more about that?
I'm sorry, I don't think I really understand the question, Representative Warren. Would you
Let me try
repeat that,
again.
please?
Let me try again. What you shared was that sometimes we wish that things will happen and they don't. For instance, there are youth that we say need treatment. We, being the state, says need treatment. And unfortunately, the family, the parents, don't agree. The youth doesn't agree. We can't get them to take the child to treatment. We can't get that to happen. That's when we take them into custody because they need correctional treatment. Sorry, I keep looking at the term. It's in the statute.
I'm not sure that I'm not sure how to respond to your question, to be honest with you. What I'm saying is that there are youth who do not have access to treatment, will not get treatment in the community, either because the youth is not willing and all treatment programs are voluntary, right? For programming in the community. So sometimes the youth will refuse to have treatment, or sometimes they'll say, I don't need treatment. That's one of the hallmarks of adolescence, right? And then there are times when youth are rejected by every treatment provider in the state and oftentimes in many other states. And the court is left with the unenviable task of deciding, do I allow this youth to remain in the community and not get treatment, or do I order this youth committed to ensure that he or she gets treatment? I don't believe I said anything about taking youth from children, taking children from their parents. I did say that the court has the authority to place a youth in DHHS custody. And to your point about whether when a parent is refusing to get treatment for a youth when it's needed, I have seen courts place that youth in the custody of the Department of Health and Human Services to ensure that that youth has proper treatment. Yes, I've seen that happen.
That's very helpful. Thank you. So I could think of correctional treatment as forced treatment.
If that's how you define correctional treatment, I guess. I would look at it as a different type of treatment. I'm not even sure I understand what the definition of correctional treatment is.
That's what I'm wondering too. It's in here and it's crossed out and it's actually the piece you're opposed to. So that's why I was asking, because in your testimony, you said you're opposed to this section. And it's the part that's crossed out. They cross out correctional treatment, but let's talk about that more at the work session. The second question I had for you was, is it true that if youth are dealt with by the Department of Corrections, the Office of HHS is no longer involved with those youth?
No, that is not true.
Okay, why do you suppose? So we've had two bills. One had to do with youth and, mace being used on youth, etc. We didn't hear from the Office of Child and Family Services. Are there like turf issues that you don't show up on their bills and they don't show up on yours? Or why are we not hearing from them? Because this is about youth.
I am not going to speak for the Department of Health and Human Services.
Okay, but there are no rules. I just was wondering because in Commissioner Liberty's in Commissioner Liberty's testimony, it talks about that we're asking, or Representative Talbot Rosk is asking the governor's Office of Policy Innovation and Future to provide things that the sole responsibility are within the Department of Corrections. So you can see how that led me to go, oh, maybe that's why I'm not hearing from HHS. But I mean, yeah, from the department, but I'll ask that at the work session. Thank you.
Before I recognize Representative Lookner, Representative Warren, I just sent you a note. I have to step out for a few minutes. And after Representative Lookner, I don't know if Sheriff Kane might want to speak. So I shall return in a few. Thank you.
Thank you, Senator. Representative Lookner.
Thank you, Madam Chair. Thank you, Ms. Tebow. One of the things that struck me when I toured Long Creek is that it seemed, and all the staff and all the folks that I talked to and the interim director there, they all agreed that Long Creek seemed to be where youth end up when all the systems around them fail, and that there need to be, everybody was in agreement that there needs to be more investment in the community, in prevention, in diversion, in treatment. And so this bill, at least, I understand that you haven't had, a chance to digest it fully. And so maybe just for the work session, what is, if it's not your position or the DO, what would the DOC like to see as far as community services, as far as wraparound services? Because I think that kind of gets to this point where, why isn't DHS here? Why isn't, all these other departments, why aren't they working together to figure this out? So that's just kind of my thinking. And I would like, to hear from the DOC, what's their position about building services in the community, if that is indeed DOC's position, to keep youth eventually, to the extent possible, out of these secure settings. Because when I toured that Long Creek, that seemed to be what all the staff said. Everybody there seemed to be on board with that. So
thank you, Representative Lookner. Yes, I want to emphasize the Department of Corrections is much more than Long Creek, much, much more. We do support programming in the community. We do support functional family therapy, multi-systemic therapy, restorative justice programs. Many of the people that you heard from today receive money from the Department of Corrections. We do build out prevention resources. We do work with the Office of Child and Family Services. We do try to coordinate systems. These are very difficult problems that are not easily solved despite everyone's best intentions. I mean, these are issues. We have very few youth at Long Creek, right? We are at an all-time low on the number of youth at Long Creek. And those are youth who courts have made a decision. It's not the state that decides, unless you consider the judges, the state. A judge has decided that that youth needs to be at Long Creek for reasons that are set forth in the juvenile code. The department is going to continue to do everything in our power to serve both the youth that are not at Long Creek, who have had contact with the system, and those youth at Long Creek in the best possible way. We work every single day to identify more resources, to try to coordinate people together. We have team meetings that go on for hours. We have discussions with nonprofits as well as other state agencies. So what I'm saying is the Department of Corrections is indeed committed to the full continuum of care that everybody wants. And it would be fabulous if we had a lot of collaboration around that here in this state. Unfortunately, sometimes it does not feel like the collaboration is as strong as it could be. But thank you.
I appreciate that. And I'd like to see more of that collaboration as well.
I appreciate that. I'd like to see that collaboration as well. I would love to see collaboration between the Office of Child and Family Services and the DOC so that all of Maine's children are protected by the Office of Child and Family Services. So I hope that we'll see you folks in partnership at the work session. It's still something we failed to see here. So I hope we'll see that. And thank you, Deputy Commissioner Tebow, for being here. We appreciate you taking the time.
Thank you, Representative Warren.
And next up, we have Sheriff Kane. Welcome. It's good to see you, sir. Oh, whoops, you're on mute, sir.
Thank you. I apologize. Thank you for the opportunity to speak on behalf of the Maine Sheriff's Association. And I just take a moment to read the statement that we have. Senator DeChambeau, Representative Warren, and distinguished members of the Joint Standing Committee on Criminal Justice. My name is Scott Kane. I am the Sheriff of Hancock County and here on behalf of the Maine Sheriff's Association. Maine sheriffs discussed this bill and voted unanimously opposed to LD 756, an act regarding criminal services for juveniles. The topic of juvenile incarceration in this committee is one that we feel is often completely misunderstood. Maine sheriffs are parents or grandparents. We are family members who feel deep empathy towards young adults. We understand that young minds are not fully developed, and we agree that appropriate facilities and programs are essential for those who make devastating choices. We're all on the same page with everyone in this committee. With 563 years of collaborative experience, Maine sheriffs feel highly qualified to speak to the circumstances surrounding egregious choices made by the youth you're trying to serve in LD 756. These are children or young adults that commit murder. There are young adults who commit arson. There are young adults who irreparably destroy the lives of others. These individuals are not the norm, but the state has a responsibility not only to those youth who commit serious crimes, but to others that they potentially could harm. Long Creek Youth Development Center not only meets the needs of these youth who reside there, but their programs enhance the lives of those they serve. The facility is licensed to house up to 164 youth. Not all juvenile offenders require this level of security, and Long Creek has reduced its population to less than 20% of its capacity. This bill is yet another effort to close this vital facility. Just last week, we heard from a member of this esteemed committee that shared a resident of Long Creek met with him and told him that Long Creek saved his life. This is the kind of success story you need to take into consideration when contemplating your vote on this bill. Long Creek provides education, behavioral health, medical, worship services, and recreational services in a secure environment. If I were to ask this committee how many youth are currently committed in Long Creek today, would you know the decision makers that have that answer? As of this morning, 22 male and 2 female youth are committed at Long Creek. These 22 youth have one-on-one attention from caring, invested professionals. To mandate that the state scrap this facility and spend millions to recreate another system is disappointing, at least. When Maine sheriffs discuss bills such as LD 756, the common recurring question that remains unanswered is, what about the victims? Has this committee taken the time to speak to the family who witnessed a brutal attack on their mother, while a youth who broke into the home and viciously attacked the parent in front of young children may have mental health or substance abuse challenges, and we're not discounting those facts? The criminal act has broken the lives of those harmed in its wake. The lettering on the door of this room reads, the Joint Standing Committee of Criminal Justice and Public Safety. We urge all members of this committee to remember that you're responsible for safety of the public and justice for those who have fallen victim to criminal activity. Respectfully, reducing accountability and eliminating a facility that ensures public safety is, in the opinion of Maine sheriffs, is not in the best interest of Maine citizens. We strongly urge this committee to keep the doors of Long Creek open by voting ought not to pass on LD 756. Maine sheriffs graciously appreciate the time to share our observation and position with this committee. Thank you.
Thank you, Sheriff Kane. Any questions for Sheriff Kane? Representative Lookner?
Thank you, Madam Chair, and thank you, Sheriff Kane, for joining us today. So I'm just wondering, you know, in the CCLP 2022 report, the experts' assessment is that our state is lacking a lot of crucial services for youth in the community to keep them out of incarceral settings. So what's your response? What's the Maine Sheriff's Association response to these experts saying our state is lacking these crucial services? That's one question I have.
Well, I'll speak, if I may, Representative Lookner, I'll speak on behalf of myself, and I agree. I've been in law enforcement 30 years, and 25 of those years I spent working in schools, working with young people. I spent working with developing programs such as the Maine Sheriffs have with Camp Postcard. And if you're not familiar with that, that's police officers striving to create and reinforce dreams. This program is for at-risk youth, where they go to camp, where they interact with law enforcement, where they interact with other people that, quite frankly, are not in their circle of friends. So I agree personally that we do need more services. As I say, I've worked with hundreds and hundreds and probably thousands of young people over the years I've been in law enforcement, and I've seen too many of them fall through the cracks. And I agree that we need more of those services, but we also have to have that, I guess, the bottom line that if some of these crimes that are being committed occasionally from young people, we need a place to put them, and where they're safe and when the people around them are safe. We don't want anybody to get hurt. We certainly don't want victims to continue to be victimized, and we don't want the young people who've committed these. We want them to realize, you made a mistake here. We're willing to help you. What can we do to help you? And let's offer some of those services. So I think, as I said, I haven't spoken to all the other sheriffs today, but in my opinion, yes, we need some more of these services, more counseling, more education. But we also have to have, just like to have a safe society, we have to have a program in place that those who break the rules, serious crimes, or continue to break the rules with serious crimes, where we can put them and keep them and work with them to help everybody in the situation.
Thank you for that response, Sheriff Kane. And so I'm glad to hear that, everybody seems to think is on board with, creating these services in the community as alternatives in some cases. This bill before us right now, nowhere does it say we're closing Long Creek. I've made my position pretty clear, but this bill that we're talking about right here isn't about closure. It's about creating some alternatives, and it's about, keeping youth out of Long Creek, in my opinion, that don't need to be there. And so just another question. So, what's your response to a judge that says, I wish I had more options for youth, like besides sending them to Long Creek? What would you say to that judge?
My response to the judge would be, let's make sure that we have exhausted all the resources that are in our community. Let's make sure that we've exhausted all the resources at the state level. And if we don't have them, then we need to come back to you folks in the legislature and say, we need this. We need this more mental health workers. We need more services to make sure that we don't have someone that may have committed a small crime graduates up to a more serious crime, and it's necessary to be housed in a secure facility.
Yep, I appreciate that. And I think that's what we're trying to do here. And, I'm very concerned with public safety. And I think in my mind, when I think of public safety, I'm thinking, let's prevent recidivism. Let's keep youth from becoming more traumatized, from becoming more likely to act out and becoming incarcerated in adulthood. It's all one and the same. Nobody's saying, let's just not have any secure confinement when it's needed. Nobody's saying that. But we need alternatives. And I think that's what we're trying to accomplish here with this bill. So thank you.
May I speak?
Please, Sheriff, please.
I say we're doing this with the adult population. Let's refer to the opiate problem. We're looking for all the possible alternatives that we can to solve that. But we also know that there are certain people that are involved in drug trafficking, human trafficking, et cetera, that need to be held responsible and taken away from everybody else. we owe that to the young people as well. We owe to exhaust as many possible choices and avenues that we have so that we don't get to that place. But again, I just need to stress on my behalf is that I do know that there are times where there are some young people that need to be taken somewhere to get a little more help than is available on the street or in other facilities.
Thank you, Sheriff Kane.
Thank you, Representative Lookner, and thank you, Sheriff. I really think you actually support this bill. I'd love it if I know that the amendment came in late. That's the speed of the legislature right now. But everything that I heard you say is exactly what this bill is asking for, is creating alternative programs. It's thank you for all of the work that you do with Camp Postcard and other works that you do to support our youth. I'd love it if you'd be willing, when you have time, to take a look at the bill, the amendment of the bill, because as Representative Lookner just said, nowhere in this bill does it talk about closing Long Creek. That's not what this bill is about. So would you be willing to take a look at the amendment and maybe taking a look at the testimony of the Sheriff's Association and maybe coming to the work session to chat with us about how we could work together on getting the services that I think we both want for our youth?
Absolutely, I would. I've dedicated a large portion of my law enforcement career working with young people, and two members of this committee I know very, very well, and proud to say that I have worked with them on projects with juveniles. So absolutely, I would. And thank you for the invitation.
Absolutely, Sheriff. Thank you. And again, thank you so much for all the work that you've done. We really appreciate it. Seeing no more questions for Sheriff Kane, anyone else here to testify in opposition to LD 756? Please raise your hand. Seeing no one here, anyone here to testify neither for nor against LD 756? Please raise your electronic hand. And I'm not seeing anyone. So anything that folks need for the work session, in addition to what has already been requested? Okay, we'll close the public hearing on LD 756. Thank you all, and thank you, Representative Morales, for bringing the bill. Senator D, what do you think? Should we keep on trucking or take a quick break? What are you thinking?
I would think LD 1654 is probably going to be fairly lengthy. It might be a good idea to take a half an hour for lunch and then work through, because it's almost 12:30 right now.
I'm open. What do you think, Senator, and other folks?
I think Representative Pickett's assessment is correct. And I think you agree that I don't know how we can talk about this in a half hour when you have spent almost 3 years on this bill. So yes, why don't we take a break, and about 10 of 1 would be good.
Great.
Okay. All right. Thank you.
See you then. Thank you.
Well, if I start talking, everybody will start showing up, okay? I'll wait till I get more people, but I think I want to announce to the public who are waiting, and there's a number of them. Just a reminder, we completed 7:56. We will begin the afternoon with 1654, which is stabilized state funding for county jails. After that will be EMS. I see a lot of people from EMS here. That's 1988, so that is after jail funding. And the last public hearing of the day is 1999, requiring civil rights officers for law enforcement agencies. We conclude the day with work session 1552 and 1862. So, 1, 2, 3, 4, 5, 6. We are it. We can begin. So, welcome everyone. And thank you for letting me have my only lunch a couple of days. So we shall begin. Deb, 1654. So the bill is an act to stabilize state funding for county corrections, and the sponsor is, I'm going to call you Elizabeth. I'm so sorry. Representative Warren, it's coming. I don't know. I haven't said her name ever, and here I am calling you that. So, okay, so this is a public hearing, and for those of you who are just joining us, we have a 3-minute clock. So please watch that, and we'll begin with the sponsor, Representative Warren.
Thank you, Madam Chair, and thank you, esteemed members of the best committee under the dome. Well, on the screen, Criminal Justice and Public Safety Committee. I'm pleased to present to you LD 1654, which is an act to stabilize funding for county corrections. I'm Charlotte Warren, and I represent House District 84. And the bill I'm presenting today is actually a proposal that belongs to this committee. That's because during the 129th session, we were presented with numerous bills aimed at fixing the very long-standing issues with funding our county jails. And that's, I just really want to emphasize, we all know, we all understand the funding mechanism for our county jails is broken. And that's why when we together were presented all of those bills, we knew it was an issue that would take a lot of focus and a lot of time. So we, in that session, tabled all of the county jail funding bills and created our own working group. Together, this committee, including Senator DeChambeau, Representatives Costain, Galgay-Reckitt, Morales, Pickett, and myself, unanimously supported a joint order requiring the Joint Standing Committee on Criminal Justice and Public Safety to study the stabilization of funding for the county jails and the regional jail. In between the short and the long session of the 129th, we met and worked together in our committee room with all of the stakeholders and crafted a proposal that received unanimous support. That day in December 2019, that we voted out our committee bill is lodged in my memory. Because of the sheer number of stakeholders involved in the process, both the Criminal Justice and Public Safety Committee room and the Judiciary room were full, and we had the door open in between. And when the committee took the vote to approve the bill, everyone stood and clapped. Those of us on the committee at the time were clapping for the stakeholders who had stuck it out with us as we made our way through each and every detail. It was a slow and painstaking process, but it was an important process. When dealing with the funding structure of the county jails, each proposed change ripples outward. It affects state, county, municipality, taxpayer, and back again. And I like to think of this process as akin to my task each time I arrive home from the market, organizing my kitchen pantry as I put away the week's groceries. With each new food item shelved, another has to be moved to accommodate it. A can of black beans is slid left to make room for diced tomatoes, and a bag of brown sugar is shifted forward, ceding its space for a box of brown rice to stand behind it. Although not quite as visually pleasing as a cook's well-stocked pantry, the puzzle of county jail funding is actually quite similar in its complication. Each time you shift a responsibility and create a new definition, you affect a stakeholder's budget. And when you try to accommodate their resource share for that entity, you create another ripple. State, county, municipality, taxpayer, and back again. Thankfully, those stakeholders have stayed at the table. We have been meeting weekly, sometimes twice weekly, to iron out all of the details and come together again. You will hear stakeholders today, each doing their job, representing their constituencies, overseeing their own budgets, and working in consensus toward finding a solution for an issue that desperately needs a fix. You'll hear from many of those stakeholders today. They're going to bring to you the details of this proposal. But before you hear from them, I just want to take the opportunity on behalf of all of us on the committee who's been part of this work for so long to thank all of those stakeholders for doing all of the work to get this bill to a place where it is supported by the Maine Sheriff's Association, the Maine Municipal Association, the Maine County Commissioners Association, and the Maine Association of County Managers, Administrators, and Clerks. And thank you for the opportunity. I've attached the amendment to my testimony, but also Jane sent the amendment out a couple of weeks ago to the committee and also to the interested parties list. I'm happy to answer any questions. Thank you.
I will defer any questions right now. I think what you just testified is pretty factual. It's things we did. I think we want to get into the meat of the whole bill. So I don't see anyone asking a question regarding your testimony. So we will, I will ask, so no one, okay. Is there anyone else, any legislator who wishes to provide testimony on this bill? Okay, I don't see anybody. Okay, so I will ask, in support, would you please raise your hand and I will arrange to let you come in and give your testimony. We will have Steve Gordon to begin with, Ryan Pelletier, and Rebecca Graham.
Madam Chair, I apologize. This bill was written on behalf of also the Maine Sheriff's Association. Would you be so kind as to allow Sheriff Brackett to go first after me? And I should have said that.
Okay. Sheriff Brackett, you are number 4. We are bringing you up to number 1.
Thank you.
Hi, Sheriff Brackett. Welcome.
Greetings. Thank you, Senator, for the quick invite. I went into Zoom limbo there for a minute. It scared me.
Scared you.
Well, Senator DeChambeau, Representative Warren, distinguished members of the Criminal Justice and Public Safety Committee. My name is Todd Brackett. I'm the sheriff in Lincoln County. And I'm pleased to appear before you today representing the Maine Sheriff's Association in majority support of this amended version of LD 1654. This amendment for your consideration represents months of collaborative work between Maine Sheriffs, county commissioners, managers, Maine Municipal Association, and members of this committee. It represents consensus amongst these groups, which is not often easily accomplished. The amendment also includes input from the Maine Department of Corrections and other correctional stakeholder groups, as well as the governor's office. 15 of Maine sheriffs. This is truly a monumental piece of legislation that forms what we hope is a lasting relationship between state and county government. A relationship that not only stabilizes jail funding into the future, but prioritizes best practice approaches to county correctional services and programs, data collection, and creates equity in the delivery of these programs and services statewide. The bill has 3 main parts: state funding, county funding, and correctional best practices. However, its focus is repairing the areas of law that hinder both the state and counties from providing adequate funds in support of county jail operations. The bill recognizes and acknowledges that both the state and counties have a vested financial interest in county jail funding, the lion's share of which falls upon the counties. However, relevant actions of the state do in fact directly affect the cost of operations of the jail. For example, our courts can and do impose sentences that exceed 9 months limits, as you know, is set in statute. I recently had an individual at Two Bridges Regional Jail who was sentenced to 2 consecutive 9-month sentences, followed by a consecutive 6-month sentence, right? 24 months in the county jail. Other examples include individuals sentenced to the Department of Corrections and then released on probation who violate their conditions and are subsequently held at the county jail. Individuals who are held for a court-ordered psychiatric evaluation held at the county jail until admission to Riverview or other facilities is possible. And we all know that that can be difficult and time-consuming at times. Individuals held in contempt of court due to civil procedure rules. And lastly, folks who are arrested for Class A murder, Class A, B, and C crimes, most serious felonies before the state that pose a serious threat to public safety, from which the entire state benefits from a period of incarceration in the local county jail. Crimes that often take more than 9 months to make their way through the court system while our defendants are held in pretrial status. The bill asks the state of Maine to acknowledge these important and often justified actions that directly impact the cost of jails by identifying them as state-sanctioned prisoners, state-county prisoners. Providing funding directly related to the number of those individuals housed at the county jail is a new concept, one that's modeled after Maryland and Virginia law, and one that we hope that you'll consider seriously. The bill acknowledges the roles that the county's role and responsibility in providing the majority of that funding by allowing the counties to adjust tax caps when the bill becomes effective. It also allows for periodic adjustments, allowing the counties to keep pace with either rising or falling cost of corrections that requires also legislative approval. Lastly, the bill creates a council of key stakeholders to focus on and establish rules for county jails in the areas of state and national correctional best practice, efficiency in operations, data collections, and compliance moving forward. It's a comprehensive bill that was painstakingly developed over a 2-year period. Maine sheriffs understand LD 1654 proposes a paradigm shift from the traditional state funding methodology, as it requires the state to acknowledge its responsibility and the ongoing cost to operate Maine's county jails. I do thank you for your thoughtful support of this important and long overdue legislation. I'll be glad to answer any questions that I can.
Thank you, Sheriff Brackett. I see Representative Pickett, followed by Representative Morales.
Yes, thank you, Madam Chair. Thank you, Sheriff Brackett, for being here today on this very important piece of legislation. As I mentioned the other day in a conference that you were a part of, it's very important for me to understand that the Maine Sheriff's Association, after going through and working on this bill, as far as they are concerned, are in complete 100% support of it. And I think when you say 15 or 16 sheriffs, does that mean there's only 15 county jails? Is that what you're talking about there?
No, I mean that there are only 15 county jails. You're correct. But there are only 15 sheriffs who are completely in support of the bill.
And there's one that is not.
That's right.
Okay.
I don't mean to put him on the spot, but Sheriff Nichols has some concerns around the council language.
Yeah, and I've been in contact with Sheriff Nichols, and hopefully he'll be here to discuss that. The other thing I would ask, sir, if you I know where you were on that call the other day, I know there are some concerns from the administration regarding the bill, and we had a little discussion on that the other day. Has there been any progress in that at all, to your knowledge?
Well, I think it's safe to say the governor very graciously met with a couple of us yesterday, gave us 30 minutes to talk about the bill. She does have some concerns. I think she has a little better understanding of what some of the bill was trying to accomplish. But there are still some concerns out there. I'm sure we'll hear some of those today.
Okay. And Madam, could I have one more follow-up, please?
Yes, go ahead.
And Sheriff, would you agree with me that the bill, though it may not be, it may not, and more than likely is not the perfect solution, but it's imperative, having come in many, many times, even in the time I've been in the legislature for 8 years, and especially the time I've been in the Criminal Justice Committee, but it's imperative to get something done rather than just continue to take and put a bill together and then and then just say, well, no, that doesn't do the trick, and get rid of it and start from square one. We need this to be able to build on. And just like anything, we may find things in it that we can do better on. We may find things to add, take away, whatever, but it's imperative to get something like this off the ground in order to get everybody paying their fair share. Would you agree with that assessment?
I would. The current statute kind of ties our hands on both parts, right? The state is tied to a certain dollar figure. It's I think it's 15 million, aside from any supplemental funding that's in current statute. The county's caps are tied in the statute, other than the minor increases that have been allowed year to year. So then our only, as correctional costs increase, our only mechanism is to come back through the legislative process and seek supplemental funding year after year with no particular end in sight. I think you'll hear more about the details of that from some of my peers to come, but that, you know, under the current formula, the funding system is really broken, and in fact, it's caused some counties to have to reach outside of the cap language to survive in operating their jails, which is a difficult position to be in.
Thank you, sir.
I see Representative Morales.
Thank you, Madam Chair, and thank you, Sheriff, for this work. I too commend the work that you've done cross sectors. As Representative Warren said, it really is. I was struck by, you know, state, county, municipal, taxpayer, repeat, you know, so I really appreciate this work. Wondering if through all of this, you've had discussions around how this impacts county taxpayers and sort of that, you know, on that local level. Has that related to any piece of these discussions?
There's been again, you'll hear some more of that, I'm sure, from some of my peers. But there's been a significant amount of discussion around the impact on county taxpayers, right? Which is really why we're just trying to stabilize the state's contribution, to county funding, so we can then be less dependent on the local property taxpayer for funding, a lot of these increases that are outside of our control at the county level. It's a little more complicated than that. In fact, it could easily, and it was designed to potentially certainly control, but potentially reduce the impact on property tax, right? It looks like at face value, when you look at the numbers from 2003 in the bill to the cap numbers that are proposed now, it looks like a significant jump. When in reality, and you'll see from, I think from some testimony coming up behind me, that those caps have gradually increased and actually represent more closely what's actually being spent on county corrections today, and would impact local taxes very minimally, as compared to what it appears when it jumps from one number to a significantly larger number in the bill, if that makes sense.
It does, and I just appreciate that perspective. I don't know if we have ever had the chance to really take a look at how our laws could impact our taxpayers at the local level, and I think this piece of legislation really shows us that, so thank you.
Excuse me. Representative Lookner, followed by Representative Beckett.
Thank you, Madam Chair. Thank you, Sheriff Brackett. Excuse me. There was a part in your testimony you were talking about data collection, and that sounds complicated. How exactly will you go about implementing that? Won't be? Tell me about that piece.
Sure. So there are a couple of, well, there are really three different portions of the bill that talk about data, right? Two are really crucial to the bill, and they're attached to funding. One of those would be budget data, right, which would need to be collected through the current CRAS system, which would need to be updated, or a similar system, because the state would need to be aware of what county jails are spending on a quarterly basis, because part of the funding request, or the baseline funding request, is 20% of the total operating budgets of the county jails for the previous year, right? So that's one of the mechanisms. The other mechanism, and the one that I think is really the most interesting, and I would think would be the most interesting to the state, because it really shifts the control back to the state around these state-sanctioned, so-called state-sanctioned prisoners, right? So we would have to enter data on a daily basis now for this to work, that would track those definitions, so that those totals could be reported off to the Department of Corrections, or wherever the legislature feels appropriate. I say Department of Corrections because that's where we report data to now. Other than, it's collecting the data is, I don't want to minimize it, right? It's data collection, but it's really not as complicated to us as it sounds, and certainly a piece that the county is willing to take. The counties, I think, are willing to talk about taking ownership of. Because it's as simple as asking 6 different questions on a daily basis, answering those 6 different questions, and forwarding that data off to where it can be tallied. Not a lot of work hopefully on the DOC end. It wasn't intended to create more work that way. So yes, it's complicated, but I don't think it's overwhelming, Representative. I hope that answers your question.
Yeah, makes sense. Seems like important information that we should have.
Thank you.
Representative Beckett. Oh,
I can't hear her, Madam Chair. I'm
That's
sorry.
right. No, it's my fault. Anyway, I had a lovely, I just paid you a lovely compliment, so you can just imagine it. I do want to thank everybody who was involved in this, because I think there's a unanimity of purpose that I think drove this initiative. I do think that there has to be a combination of data collection and trust among the parties for this to work. And I think that's, so on that topic, I know you said that some or all of the systems use a craft system for data collection. Is that true of everybody in the county jails, or is it a spotty? Some do and some use something else.
So there are two data systems that are kind of left over from the Board of Corrections data. One is CRAS, C-R-A-S. Don't ask me what it stands for. And the other one is BARS, right? BARS is one where we report daily to the Department of Corrections what our populations are. We use that now.
Okay.
And we still use CRAS to some extent, although it's not a requirement under the current statute, so it hasn't been followed as closely as it was. But if I'm following your point is very key about trust and the data system, and that's why we've shifted some of those discussions hopefully to the council that's in the bill, and will allow them to establish rules specific to this narrow focus around data collection, trust, and accountability. So we as counties can hold each other accountable to make sure we get that data in, and that it's verifiable, and that the state, in fact, trusts the data and where it comes from.
Thank you.
I'd like us to explain a little further. I think we who have been involved or read about 4 inches of paperwork for the past year have heard the term state-sanctioned prisoner, which is a term that came out of this legislation, and that is divided into individuals who are sentenced for a class A, B, or C crime are really state prisoners, state-sanctioned prisoners. They're not, when I said they are arrested for an A, B, C, they reside still in the county jail, but they're now labeled the new term, state-sanctioned prisoner. Is that correct?
Yes, that's I'm not sure I like the term, but it's what we came up with.
Okay. And this bill also requires that state-sanctioned prisoners, that the Department of Corrections or the state would pay the counties $50 a day per person per day. Is that part of your formula?
That's one of the 2 funding options, yes.
One of the 2. So currently the counties are getting like $18, $19 million a year. And it seems like that's what I've been reading. The state or the governor may have some opposition to that $50. You want to tell me about the other funding formula that you've got?
Sure. I wonder if I could do 2 pieces.
Okay.
To that without, I don't want to take too much time, but first we acknowledge that the concept of a state-sanctioned prisoner, maybe we should call it a state/county prisoner. These are narrowly focused. It's modeled after the state of Maryland and the state of Virginia. It's a new concept to us here in Maine, but we didn't reinvent the wheel there completely. The concept is that these are areas where, like, for example, you heard me give an example about somebody who was sentenced 24 months to the county jail. We're not trying to say I don't object to that. That sentence made perfect sense. The person was involved in our medication-assisted treatment program. They had other services in place at the county jail, and the judge and the defense put that through, and they felt it made sense for that person to stay at the county jail rather than go off to the Department of Corrections. Right? I support that, and I think all the sheriffs do. It's just using that definition. It's one of those pieces like folks who, it takes a long time to do a murder trial or serious felony trials, right? There are a lot of reasons for that. Again, not a criticism, but when folks end up staying at the county jail for a period of time, which is where that murder class A, B, and C definition comes from, we're just asking for some support to do that. $50 a day is about half what it's costing us at the county jail. Even less than half, probably for most of us. If you look across what our actual per diem rates are, it seemed like a reasonable fee. And when we did a snapshot of those back in FY19, that equated to about 40% of our population. And that was a 3-month study that the counties went through. It wasn't just thrown together. It's far from I mean, it was just a study, but certainly we have some examples there that we could share. So the concept isn't that we're opposed to these kind of things, and we're just asking. These are things that the state controls completely. When somebody's sentenced to the Department of Corrections, and then is placed on probation and then commits a new crime, they don't go back to the Department of Corrections. They come to us, and that's okay. But they're already sentenced to the commissioner. Just help us pay for it is all we're saying. It may make sense for them to stay at the county jail for a couple of months or whatever it takes to get that revocation taken care of. So it's not necessarily an objection to those. I just want to make sure that that was clear. And that did equate to about 40%. The other funding mechanism is based on county jail budgets. So currently, for example, if you were to look at our total operating budgets for the 15 county jails, and this year, currently, it's about $100 million. Please, that's an approximation, right? So 20% of that is what we're trying to set is the bar, right? Here is the least amount that the state would be obligated to under this proposal would be 20% of the total operating cost, which is about $20 million, which I think is the number that the governor has mentioned, and seems to be willing to talk about in that particular aspect. So I don't know if that answers your question, but and the way that the bill is designed, it's 20% as the baseline or state sanctioned, whichever is greater. Now, this is a perfect year to say that because of COVID, our populations are down. It's true. Populations statewide are down. When we did the snapshot back in FY18, there were about 1,600 inmates in the county jail system that year. This year, we're down around 1,200, give or take, right? Averaging, largely because of COVID restrictions and curtailments of arrests and cooperation and so on and so forth. We anticipate that those numbers have started to tip back. They're going to tip back in that direction to where we've seen them previously. So that's kind of why we put the checks and balances in there, or the 20% formula, because we know that there may be circumstances like COVID that may cause those state sanctioned prisoner numbers to go down, or the state may change some sentencing practices. I mean, all those things are in the complete control of the state entities that are behind those, if that makes sense.
It makes sense, but I still have questions, but I won't ask them today. So thank you. I think Representative Morales did not lower her hand. And how about you, Representative Reckett?
I just want to quickly make sure I heard the sheriff correctly about one of the things he just said. Would that be possible?
Yes, go right ahead.
I understand the 20%. I understand the 40% of costs with the state sanctioned prisoners. What I thought I heard you say is that the jails would be paid, reimbursed, whatever word you use, by the state for one or the other method of calculation, whichever is, then I can't.
Greater.
Whichever is greater. Okay.
Whichever is greater.
That's
Yeah.
what I
And
missed.
that's the way the bill is written right now.
All right.
Yes.
Right. I just didn't catch that, and I had it backwards. So, thank you.
Thank you.
Anyone else have a question for Sheriff Brackett? Did you have more to say, Sheriff Brackett? I didn't mean to cut you off.
No. There's a lot of there's truly a paradigm shift here in this bill from the way we've traditionally partnered with the state for county jail funding. So it's a lot to swallow. I appreciate your time, and we'll be right here if you have more questions.
Okay. So I will go to the next person, and I apologize. It was like 15 minutes ago. I don't know if Mr. Pelletier or Ms. Graham is first. I think it was Mr. Pelletier. Welcome, Mr. Pelletier.
Good afternoon, everyone. My name is Ryan Pelletier. I'm the county administrator in Aroostook County, and I also serve as president of the Maine Association of County Clerks, Administrators, and Managers. Thank you, Senators DeChambeau and Warren and members of the committee for hearing me today. I'm actually testifying on behalf of the Board of County Commissioners in Aroostook County and the role I play in working for them. This legislation has been developed by bringing the key stakeholders together for the first time that we can remember to tackle this extremely important and fundamentally challenging issue. These stakeholders have included, as you've heard earlier, representatives from the Department of Corrections, the Maine Municipal Association, the Maine Sheriff's Association, the Maine County Commissioners Association, and the Maine Association of County Managers and Administrators. LD 1654 addresses several important policy issues currently affecting county jail operations. These include addressing the need to provide predictability and stability regarding state support for county jails. This is accomplished by setting the reimbursement rate provided by the state at the greater of 20% of jail operating costs, or $50 per day for state prisoners that are housed in our county jail facilities. It brings consistency and reliability to the current funding process. It right-sizes the amount of the local property taxes that can be raised by county jails to meet the current needs of our incarceration facilities. As the data indicates in a spreadsheet that I believe was provided to the committee, most counties in Maine are forced into deficit spending each year because the current tax caps are too low and are not keeping pace with the rising costs faced by Maine counties to operate their jails. Thirdly, a new council would be established to bring all stakeholders to the table to help guide the development of the various programs and services that must be offered in county jails currently and moving forward. These stakeholders will include representatives from county and local government authorities. And finally, LD 1654 will define current jail standards in a more robust way to ensure the health and safety of prisoners is not as broad and more succinct for the requirements surrounding inmate transportation, medical assisted treatment, mental health, and other community support programs. For all of these reasons, the Aroostook County Board of Commissioners asks for your favorable and strong support of LD 1654 and an ought to pass report out of committee. Thank you for your time and consideration.
Thank you, Mr. Pelletier. Any questions for Mr. Pelletier? I heard the weather report in Aroostook County. I'm surprised I'm not seeing you in a fur coat. It's awfully cold up there today.
It's Can-Am weekend in Fort Kent, so you know it's always going to be
Yes,
cold.
it is. That's right. A lot of people I know are there right now. So thank you. And I now will recognize Rebecca Graham. Welcome.
Thank you, Senator DeChambeau, Representative Warren, and distinguished members of Criminal Justice and Public Safety Committee. My name is Rebecca Graham, and I'm here testifying in support of LD 1654 at the behest of our 70-member Legislative Policy Committee, who have unanimously supported the efforts that we've put into this bill with our county colleagues over the past 2 years, as you've heard. We tried to work cohesively to solve a problem that's been facing county corrections, and each section of this bill represents a compromise and equal pain amongst all of our groups to address the costs and to try to create a system moving forward that would stop the starvation and Maslow's hierarchy of needs response that counties have to face, and actually create a system that allows them to be proactive and forward thinking. County jails are the emergency rooms of the criminal justice system. And like emergency rooms, jails are triage centers and a revolving door of patrons. But they're established to stabilize a public safety threat and house individuals until they receive their due process. It's the court who are the specialists that decide how best to address the situations in the long term, hopefully with a balance of the rights of victims central to that process. However, increasingly, as many bills are heard in this particular committee, county jails are being asked to provide significantly more specialist treatments with structures and staffing and available services built for emergency stabilization and not necessarily wraparound care. And those are statewide priorities, but they don't all have statewide resources dedicated to that task, nor ubiquitous availability in community services or providers in every single county. So it was with that in mind that we approached this bill and tried to find some sort of cohesive solution that would allow us to balance proportionally our equal pain amongst the institutions and give voice to the people that are paying for this, that have no ability to actually have any sort of input into that system. Neither do the counties have any ability to shape the individuals that are placed in that system. So in my testimony, I approached this in what we see are three different themes. And one is transparency, the other is opportunity, and the third is agency. The council creation allows there to be a municipal seat and a municipal voice. So it's going to actually bring local officials into the structure and pressures that are happening at the county level, allow them to have more input into that process and to be better advocates for county government. And also to understand how to communicate better within their communities, those pressures, and maybe seek alternate local resources on their behalf. The opportunity that's there is that it allows the stabilization of the funding so that the sheriffs can actually focus on what is most important, which is trying to provide these services and build those relationships in their community rather than trying to constantly negotiate with this committee for funding on an annual basis, which has, since the Board of Corrections collapse, been around 20% that the state has put into those systems. So the 20% floor means that counties will understand that's the minimum that they can count on in order to function. And then the pressures can be responded to once we shift into the state sanctioned inmate model. And those pressures can be more transparent and there will be more data and it'll be a view of a system rather than 15 individual systems with 15 individual needs and responses. It also provides some transparency for the local tax burden by placing those requirements to do those budgetary reporting pieces. And it makes sure that counties come forward with that information and allows them one single place for that. And it also allows those local municipal voices to have some sort of input into that process. They're not able to come into the committee and ask for a raise on that cap unless they've gone to their local budget committee, made their case, and communicated all the alternatives that they've already explored before they come before you. And hopefully they'll be coming before you with their local partners in tow, supporting that initiative as well. And then the last is that it provides agency so that all full paying, delivering, and responsible stakeholders are part of the correctional standards conversations and bringing those ideas on how to approach this in a system-wide level. And each piece of this is vitally important to move forward in step. To lose any of that means to lose the good work that each one of us have put in and the commitment to shoulder some of this pain to try to actually find a system solution and create the opportunity for a system view that I think is really important, particularly as we keep pressing these mandates down on the counties. So to that end, MMA and our Legislative Policy Committee and municipal officials ask you to move forward with all parts of this proposed legislation intact and fully support the state's share of those costs so that sheriffs can focus on the jobs at hand and rather than annually begging at the Criminal Justice Committee for this funding. I will also be happy to provide some historic data on that state share and how that has increased or decreased rather over time and has kind of stayed at that 20% level for the work session if the committee desires that.
Thank you. I have Representative Rednicki, followed by Representative Pickett and Representative Morales.
Thank you, Madam Chair. Ms. Graham, you talked a little bit about the tax cap. How much of the tax cap will increase property tax? Will increase property taxes? Do you have an idea what we're looking at if we use that, of what it will do?
Representative Nikki, thank you very much for that question. The amounts that are listed in the bill are actually tied to the actual costs currently, and it kind of right sizes that cap. So in statute, those numbers haven't been raised since 2008. And it's my understanding that in 2008, MMA really wanted counties to establish an appropriate sized tax cap, but folks, because that number was going to be in statute, really kind of made it low. And those have increased for either the LD1, the growth limiting factor, or the 4%, whichever was greater or lesser, I believe, annually since then. So the numbers in that statute actually reflect current reality and current budgets and processes. The change in the tax cap is going to be more responsive in the same ways that municipalities do. So it allows them a 5% annual increase, which is tied more to actual costs, or LD1, which is whichever is greater. So that is a shift, but it is a defined, clear shift. And proportionally, that will also increase that 20% number for the state. So there is almost kind of a motivating factor for counties to not do that if possible, because the state is also, that 20% will increase that number for the state as well. And presumably, once we've established the centralized data system and it moves to the state sanctioned inmate models, it's going to allow the sharing of bed space amongst facilities without having to figure out which costs more. So that original facility that may have to board out an incarcerated individual to another facility is going to get a part of that cost back. Right now, it's kind of a negotiated cost between communities as to how much that is. It's never going to be $50. It's probably always going to be more, but it also depends on the capital of the capital costs for those communities, or for those counties in particular. And those costs between boarding inmates are more actual costs. The state sanctioned inmate cost is actually kind of a lower cost, and it only focuses on operation. It doesn't focus on the capital costs. And that's a little bit different than the federal funding, I believe, inmate funds that are received now by many of the facilities. But I think that the sheriffs and the county commissioners can speak better to that, those operational costs.
Thank you.
Representative Pickett.
Well, I'm going to take my hand down because that answered my question in detail.
Representative Morales.
Thank you, Madam Chair, and thank you, Rebecca. And you may have answered it, but I just want to be very clear. I think what you are saying is that MMA does not believe that this legislation will in any way raise municipal taxes. Am I stating that correctly as far as MMA's position?
Thank you, Representative Morales. We know that annually, municipal property tax is directly raised by the funding of jails, because annually those costs are going up. So this is a continuation of current law, essentially, and current reality of running the jails and the facilities, as well as all of the bills that impact that operation that happen throughout the year. What this does, however, is create an opportunity for that to slow down and be more right-sized in the future. So the centralized data and the state sanctioned inmate piece that we could roll to might actually reduce those costs on the municipalities in the future. And that's something that we've sought for a really long time, to actually collect the information that proportionally illustrates the impact of some statewide priorities on those individual counties. So it gives some real agency to the people that are paying those bills to be able to actually advocate for themselves and grow the programs that might be necessary to prevent people from even actually getting into those facilities. We know that one of the definitions of state sanctioned inmate are individuals that are seeking behavioral health that pose a risk. They might not necessarily be charged, but we know that that's currently an important function because we don't have those alternatives. And those are not necessarily local property taxpayer able to be solved issues. That is a statewide necessary issue to be solved. So this would actually kind of return some of those funds in the state sanctioned inmate model back to those communities, and also highlight where there may need to be a statewide investment in those services more robustly, or at least incentivization for privatization of services to happen there. So it gives data that I think is going to actually look at some of the issues, is clearly illustrate some of the issues that we don't have right now. We just know anecdotally.
That's very helpful. Thank you.
Ms. Graham, I know my question's probably been answered, and it has to do with the money. You said that every county has it's not a cap, I don't want to use the word, but, and you mentioned the date, I think 2005. I'm going to give and illustrate an example. In my county, the county commissioners had to raise, or had to put in with every community. York County, it's $8.7 million, and it has been like that for the past 10, 15 years since that. Was that around the State Board of Corrections time? I think they're the ones who did that. Okay. And above that, the state currently is paying $18 million to the various sheriffs, is it not?
Thank you, Senator
That's
Shem.
the state share, is it not?
Yeah.
And if you're going to answer one more thing is, if there are extraordinary expenses, and I think there was one time there was a mass arrest and there was a lot of people in one particular jail. And I think last year there was only one jail that had to ask for money above and beyond what they were getting. So if you could touch upon that a little as far as the funding, I'd appreciate it.
Thank you, Senator DeChambeau. Commissioner Gordon from Cumberland County is in the waiting room to follow up, and I'm going to be able to talk about that in detail. But it can and it has incrementally changed either by the growth limiting factor or 4%, whichever is lower in statutes since that was established. And what is in law was that number that was set after the Board of Corrections collapsed.
Okay.
So it has grown since then, and those are the numbers that are reflected in the current bill.
I didn't ask the question to sound like I know what I'm asking, but I wanted to make sure. Okay. I like nodding with those answers. Thank you.
Thank you.
I don't see any other questions with Ms. Graham. And as always, thank you. I always like that local touch. I appreciate that. I should have asked for some people to come in. I don't see. So I have Christopher DiCapua, Steve Gordon, Joel Mary. Thank you. Christopher, there he is. Christopher, did you come on in? There you are. Thank you. Welcome.
Welcome. Good afternoon, Senator DeChambeau, Representative Warren, distinguished members of the Criminal Justice and Public Safety Committee. My name is Chris DiCapua, and I've worked at the Cumberland County Sheriff's Office in the Jail Division for the last 15 years. And I serve as a member of the National Correctional Employees Union in capacity as the National Secretary, and I am the local Vice President for the Corrections Officers here at Cumberland County. The NCU represents 9 of the county correctional units in the state of Maine, comprising of approximately 400 members from York County all the way to Aroostook County. And we have been advocating for correctional officer salaries and benefits since 2010 in the state of Maine. The NCEU Regional Director William Doyle spoke in favor on a similar bill in the last legislative session. The NCEU wholeheartedly supports this legislation and increasing the funding cap for individual counties. Our organization believes the increase in the cap and subsequent ability to petition the legislature to increase the cap every 4 years will help the individual counties appropriately operate their jails. However, I would be remiss in my duties if we didn't share our concern over the staffing shortages in the correctional profession overall. This is both here in Maine and nationally. With the abundance of employment options paying similarly, the Maine Criminal Justice Academy standards, and the general lack of stable scheduling, it's become increasingly more difficult to attract and retain correctional personnel. While LD 1654 will increase the cap and provide for a 4% per year increase in the jail budget, the NCU asks if the legislature is considering salaries and increasing goods and services If the 4% or growth increase is absorbed by increases in fuel, food, and ancillary goods and services, there will be little remaining for salaries and benefits. Regardless of linear or direct supervision, the correctional personnel are imperative towards the care, custody, and control of inmates. When you look at other professions in the same departments or offices, the communications and patrol bargaining units are not barred by the funding caps of the jails. This dynamic alone causes the NCU and myself many difficult conversations with other staff when confronted with a 12% increase in salaries for patrol, but only a 3% increase towards corrections. Due to the governor's continuous veto and the legislator's inability to override the veto of binding arbitration legislation in the last 2 sessions, correctional professionals are at a severe disadvantage when it comes to collective bargaining. The counties use this current base assessment limit and the 4% increase as a tool to limit the increases in wages, which is why so many jails have correctional professional vacancies. For example, Cumberland County, where I work, has 65 vacancies, and York County, just to the south of us, has 36 vacancies. Why focus on those counties, you may be asking yourself? Our answer is because Southern Maine has a very competitive market for wages, benefits, and opportunities. And in closing, the NCU would like to reiterate our support for LD 1654 and urge the committee and full legislature pass this important piece of legislation. And I thank you for your time, and we'll answer any questions you may have.
Any questions? DeCapua? Could you?
DeCapua.
DeCapua. Okay.
Senator DeChambeau, you may remember me as Cappy at the pre-release center over at on our campus when you were doing the state releasing of
what a good man. You've been there a long time to remember me.
Yeah. And I remember Representative Pickett too, from his time as the chief up in Dixfield and his time as a state trooper.
Now you really stated your age. Okay. Thank you. And I thank you for your service. I've got to tell you, that was the most, I know your issues and your problems, but it was the most enjoyable jail I ever worked in. So I was very well respected, and I appreciate that. And I thank you for your service too. Thanks.
Thank you.
And so no questions. And thank you for speaking about the officers and the pay. Thank you.
Thank you.
Now I will, Steve Gordon was next, followed by Joe Mary. So Steve.
Well, thank you very much. Senator DeChambeau, Representative Warren, members of the Criminal Justice Committee, I thank you for your time. And I wish to again thank Representative Warren for presenting this bill. I am a commissioner and president of the Maine County Commissioners Association. Before you, you have my written testimony, and I will try to encapsulate it. But first, I draw your attention to my spreadsheet, which apparently the people are interested in figures, that was presented with my testimony. And if you go to it, you will see that numbers have actually increased year by year as the tax cap has been utilized by counties, and now you can see what the surplus and the deficits are, and where this $20 million is coming from. The actual current jail budget total for the state is a little over $100 million, it's 102. So that's why the ask for the $20 million, it fits with that 20%. To continue on, from the 30,000 foot level, your counties are struggling with operational costs versus capital. This bill only addresses operational costs. And the operational costs are, or county jail costs, are better than 50% of a county's budget. That's why it's so important to us and how it affects the property tax. As our state cultural requirements change and how the state wishes to assist incarcerates, more and more health requirements are being recognized and required of jail incarceration systems, which is fundamentally, again, supported by property tax. As these requirements are authorized, the complementary state funding has not been adequately provided, in our opinion. Thus, yearly, counties and sheriffs are before this committee pleading for assistance. This bill alleviates that and creates a better methodology. The common areas of assistance which are being expanded are those within the area of mental health, homelessness, substance abuse, human trafficking, domestic abuse, and also more broadly, please recognize that when communities identify individuals which they do not know how to deal with, the jail is the solution. Thus, jails have become the service provider of last resort for communities. And that is one of the major problems we have. And then another anecdotal issue here that I will say is that jails have, please recognize that the approximate 80% of those incarcerated are prescribed psychotropic medication. All these need to have an answer for the future. It's just I'm losing my place here. This bill has the effective works, and it's been spoken of many times here, of all those that have participated: the Sheriff's Association, Maine Municipal, the county clerks, but also I think it should be recognized that we had the assistance of the Department of Corrections. They greatly assisted us in this area because they put forth their position. And thus, the bill is very comprehensive, which I think you should appreciate. It took a long time, and we're looking almost at months. And I will end up by indicating, how does LD 1654 help? And it's in several key ways. One is local expenditures. LD 1654 right sizes the hard cap on county expenditures in jail, including county by county expenditure limits, with a permissible growth factor of 4% or the growth factor set forth in LD1. Second, it increases the amount of state support for county jails by setting the state reimbursement rate for counties at the greater of 20% or of costs, or $50 a day for state prisoners housed in county jails. And then the local government input into the operations establishes a professional standards council charged with governing the programs and the services that must be offered in county jails pursuant to the law. I thank you for this time and opportunity to present this information. I'm sorry that I got messed up a little bit in my communication there, but as you can see, we in this coalition that we have developed really put a lot of effort into it, and it's well thought out, and it will assist a new methodology by which the state and the counties and the sheriff's departments and Maine Municipal will become partners in this program.
Thank you. I'm going to recognize Representative Lookner, who has a question.
Thank you, Madam Chair, and thank you, Commissioner Gordon. I'm just kind of thinking, I know the counties are sort of flush with money after ARPA and everything like that. And, so why is this bill needed, and why can't we use just, ARPA funds or whatever else is left over from that?
Good. That's an excellent question. The short answer is yes, counties do have APRA funds, and we are using them. But I got to remind you that this bill, again, only addresses operational funding and not capital maintenance, repairs, or expansion. And that county APRA rules, as promulgated by U.S. Treasury, are different from those of state and municipalities. Our relationship with APRA is directly with the federal government. It does not go through the state, nor does it as do the municipalities. Presently, most counties are using APRA funds for jails. And that what they're doing is they're addressing those capital issues that have been relegated to the bottom of the line of the heap as far as getting handled in the as they necessarily need. I know, for example, one of the things that Cumberland is doing is we're looking at a new air handling system. It's ancient, it needs to be replaced, and that's an expense. We have roofs that need to be repaired, et cetera. So that's where how counties are handling what we refer to as generational funds. We know that there's an end to them. So we're really reticent to put them into programming that's going to require ongoing funding, knowing that if it does occur, then we're to keep that funding going, we're going to have to go back to the property owner and property tax owner and say, hey, we need to raise the taxes so that we can keep these new programs working.
I see. Thanks. And do you see counties working together to, make this all work?
Well, I do, and it's probably, and I think Sheriff Brackett alluded to it. They work together. The sheriffs, more times than not, are sharing issues, sharing prisoners, trying to make their jails function at an optimum way. I think more can be done. I know that we'll have to do more. And this may be one area, as Sheriff Brackett mentioned with the governor, this may be one area that the administration would give some consideration to, should it be considered.
Thank you.
Okay. All right. I will recognize Representative Pickett.
Thank you, Madam Chair. Thank you, Mr. Gordon, for being here. I just want to make the comment that I appreciate your answer to Representative Lookner in response to his question, because you hit the nail right on the head. You're talking about one-time money coming in to deal with something that's an ongoing problem. So you hit it right on. And as also as a member of the town council in the town that I live in, I appreciate that comment as well. Thank you, sir.
Thank you.
Mr. Gordon, I just want to make sure the spreadsheet, it doesn't have your name or anything, and I know I carried it around with me. So is this the one that talks with every sheriff? It says the current statutory cap, the current one with 4%.
Right, and it says attachment A just above it.
Nope.
Nope.
But I think it's okay. It gives a lot of information. I appreciate that.
Yeah, it's got the the jails listed, and then it shows the current statutory cap in 2008.
Yeah.
And then the next to the last column shows the current jail budgets for 2022.
Wow. Well, just to take Cumberland, your cap in 2008 was 11.5 mil. The
Right.
current budget is 21.5. Yeah. As a former member of the York County Budget Committee, I lived on these figures also, so thank you. And if no one else has a question for, I keep moving my mask down. I think it's Monday, Monday we don't have to wear the mask. So Joel, Mary, go right ahead. Welcome. Thank you, Mr. Gordon. Thank you very much. Welcome, Sheriff Mary.
Yes. Senator DeChambeau, Representative Warren, and distinguished members of the Joint Standing Committee on Criminal Justice and Public Safety. My name is Joel Mary, and I'm the Sheriff of Saginaw County. And I'm here to provide testimony today in support of 1654, LD 1654. As you know, for more than a decade now, the county jail system in Maine has struggled to effectively and efficiently meet its purpose and mission as an integral part of our criminal justice system due to a lack of sufficient financial resources. The current funding system is fragmented, and it leaves the counties in a position to continually having to come back before the legislature and seek funding. A funding plan was put into place some 14 years ago that is not sufficient to meet the current needs of the system today. While previous legislatures have attempted to remedy the system, the basic shortcomings have not been corrected. LD 1654 attempts to fix the issues, and just as the title will suggest, it will stabilize state funding for county corrections. Work on this bill began nearly 3 years ago, and it's been worked through in a collaborative process that has included a wide and varied group of stakeholders, including members of this committee, sheriffs, county commissioners, county managers, administrators, and representatives from Maine Municipal Association that you've heard from today. In addition, this process has earnestly worked with the Department of Corrections to include aspects beyond the funding that are important to making our correctional system more effective and rehabilitative. LD 1654 would create a funding system whereby the state and local taxpayers would share the cost of running county jails. The state's obligation would be limited to a fixed per day fee for certain residents, or 20% of the true operational cost of running the jail. The idea of the state paying a per diem for residents is not unique, as a number of states have similar funding systems. Tax caps are left in place, but adjusted to help meet the current needs and the true cost of corrections at the county level. The bill creates a balanced funding system between the state and the counties. LD 1654 is more than just funding. It creates a county correctional professional standards council to evaluate and advise the commissioner in regards to programs and services within the county jails. The bill requires coordination of transportation, access to substance use disorder screening, assessment, medication treatment, recovery, and reentry services. Jails will be required to provide mental health services, community programs, and services will include pretrial or conditional release, as well as alternative sentencing programs. These programs are vital, but they come with a cost. The funding necessary to provide these essential programs must be established and be predictable. LD 1654 may not be perfect, but it's the most comprehensive attempt to adequately fund a crucial component of our overall criminal justice system in the state of Maine. And I would urge you to pass LD 1654. Thank you, and I'll answer any questions you may have.
Great. Anyone wish to ask Sheriff Mary a question? Thank you. It's kind of tough when you're like the 8th person and we're hearing the same thing, but thank you very much.
I do realize that, and I respect that.
Okay.
And so I appreciate that.
Thank you. So I have one more person who wishes to testify in support coming in. Jan Collins, please. Oh, there she is. Welcome, Ms. Collins. Go right ahead.
Thank you so much. Greetings, Senator DeChambeau, Representative Warren, and honorable members of the Criminal Justice and Public Safety. My name is Jan Collins. I'm a resident of Wilton and a member of the Franklin County Board of Visitors. I'm here to support LD 1654, an act to stabilize state funding for county corrections. I'm speaking for myself as a citizen and not representing any organization. In my several years as a member of the Franklin County Board of Visitors, it has become obvious that the corrections facilities in Franklin County were in dangerous disrepair and that the current funding system would not allow for the necessary repairs and upgrades, despite all the efforts of Franklin County Sheriff Scott Nichols. Unsurprisingly, recent news from Penobscot and Washington County have confirmed that we are not alone in having unmet structural needs. Although I understand that this bill is not meant for structural needs, it does relieve some of the financial pressures. I am grateful for the long hours and great efforts by all those working on this bill. I also recognize the compromise that all sides made in order to come to a consensus. I and other members of the Franklin County Board of Visitors are especially appreciative of the emphasis in this bill on rehabilitation and reentry. In Franklin County, where we are without any homeless shelter, any rehabilitative housing, or any inpatient mental health facilities, a lack of support services has hampered the efforts to overcome both mental health and substance use disorder issues for those who are struggling to successfully re-enter their community. I am sure it has also led to unnecessary suffering and, in some cases, death. I'm hopeful that this emphasis will lead to successful collaboration with community partners to meet those needs. We have a large group of providers and interested citizens who are ready and waiting to move forward as soon as we can locate funding sources to do so. The bill will assist us in moving in a positive direction in partnership with the Sheriff's Department. I ask your support of LD 1654, an act to stabilize state funding for county corrections. Thank you so much.
Thank you. Any questions for Ms. Collins? Seeing none, thank you again. And I shall now turn it over to anyone who wishes to testify in opposition.
Madam Chair, I
please
think
raise-
there's one more for.
Oh, is there another one coming in?
That hand just went up. I'll bring her over.
Kipfer, Carrie Kipfer?
Yes.
Ms. Kipfer, is in support?
Yes, in support.
Okay, yes, go right ahead, Ms. Kipfer.
Thank you. Sorry for the late hand. My name is Carrie Kipfer, and I'd like to thank Senator DeChambeau, Representative Warren, and the members of the Joint Standing Committee on Criminal Justice and Public Safety for allowing me to testify today. I am the County Administrator for Lincoln County, and I'm here to testify in support of LD 1654. As you know, the key stakeholders in county corrections have spent countless hours to come to you with this proposal that we can all support. And we're all grateful for Representative Warren's steadfast leadership in this process. It would not have happened without her. This bill is not extravagant in its appeal, yet it allows the counties to operate the jails in a manner that is stable and will expand statewide jail services to address the current needs of those incarcerated. Lincoln County has been at the forefront of providing services to those detained at Two Bridges Regional Jail. In the past, our programs have been so successful that the beds at Two Bridges are typically occupied by individuals from other counties. Last year, and I know this was an anomaly because of COVID, but our county's average bed count was less than 13 people per day. And prior to COVID, it was around 20 to 25. When we compared the 13 people a day to our tax cap of $2.7 million, our taxpayers are spending over $560 per day per inmate. We are reaping the rewards of decreased recidivism, and we're doing our best to reintegrate folks back into a positive lifestyle, but it comes with a tremendous cost. We simply don't have enough money to keep subsidizing Two Bridges for the state and the other counties and continue the programs that our citizens have come to rely upon. In November 2021, some of the leading mental health agencies in the state held a mental health summit and presented their findings to this committee last month. They found that there are only 87 mental health crisis workers for the entire state compared to 2,500 law enforcement officers, leading to saturated involvement of the criminal justice system instead of the healthcare system. And why do I share this with you? Because our jails are filled with people who need mental health services and substance use treatment, and there simply are not enough resources available. When an individual goes into crisis, the first call that's made is to 911 and not to a mental health provider. The dispatchers have no other option but to send law enforcement. And if there's no medical beds available, many times the person ends up in the county jail. The most disturbing statement from the mental health summit for me was this: local county jails have become the holding tanks for adults experiencing a mental health crisis, leading to further decompensation for many. In addition to providing daily care for these folks, county jails are also tasked with providing mental health treatment and medical treatment for their addictions. If the resources simply don't exist in the community, where are the jails going to find the providers? The county jails are doing their best to provide care for those who need it, but it all costs money. LD 1654 has a funding mechanism that'll share the costs to operate the jails, 20% from the general fund, 80% from the property taxpayers. And in this bill, the daily rate for state sanctioned prisoners is $50 a day, far less than the true cost per person when a jail is at full capacity. Even at that daily rate, it's not the full daily cost for that prisoner, it's a fraction. The counties still pay the remainder of the cost for their tax caps. And to give you a comparison, in 2017, Maine Housing, another state agency, was paying about $70 a day for the Preble Street Homeless Shelter in Portland to provide housing and programming, a portion of their true costs. How could it possibly cost less to house a person in a secure facility 24/7 on less money? The county jails are a pillar of the security in our communities and not just for law enforcement, and failure is not an option. Without a funding formula that all counties can use to meet their financial needs, it's just a matter of time before the stability is in jeopardy. The counties are operating the jails as lean as possible, but we need your help to change the funding formula. We can't keep operating like this. I urge you to support LD 1654, and I thank you for your time.
Thank you very much for your testimony. Is there any questions for County Administrator Kipfer? Yes, Representative Morales.
Thank you, Madam Chair. Thank you. I don't have a question, but I just really appreciate you bringing it all into perspective for us on just the failures in our systems and how that plays out for counties at the disadvantage of our county. So I really appreciate that testimony. And have you submitted it in writing?
I have. Thank you.
Thank you.
Thank you, Representative. Great. Thank you. Seeing no more questions. Thank you. Next up, we'll do those here to testify in opposition to the bill, LD 1654. If you're here in opposition, please raise your hand. And I don't see anyone here in opposition. Now calling for testimony for those neither for nor against. And I see we have Commissioner Liberty.
Sorry, his hand went down and I lost him. Thank you.
Good afternoon, Commissioner.
Good afternoon. One moment, please.
Sure.
Good afternoon, Representative Warren, distinguished members of the Criminal Justice Public Safety Committee. I'm Randall Liberty. I'm the Commissioner of the Maine Department of Corrections. For several months, the Maine Department of Corrections and the Governor's Office have been working collaboratively with a large group of stakeholders on the intricacies associated with LD 1675 and act to stabilize funding for the county corrections. Members of this extensive work group include those representing Maine Municipal Association, Maine Sheriff's Association, county government, lobbyist firms, legislators, including Representative Warren, who chaired many of these meetings. We're proud to be part of this group, of which we've enjoyed spirited debate, engaged in thoughtful discourse, and worked in good faith to find commonality and understanding. There's much work to be done still, but there have been small wins for all stakeholders, and we hope that you'll hear all parties appear prepared for further discussions for additional meetings before the session wraps up. The Department of Corrections and the Governor support several sections of this bill, which include required reporting outlined in Section A3(6), formation of County Corrections Council as outlined in Section A4, county proposed tax assessment outlined in Part B, Section 2C, and requirements for the county jail behavioral health program outlined in Part C. Additionally, the administration supports an increase in funding in county jails from 18.5 million to 20.4 million. Provided the legislature finds the funding and approves the 1.9 million fiscal allocation. In doing so, the county jails would be funded at 20% of their proposed FY 2022 $102 million jail operating budgets, reflecting the 20% funding level at the county jail at their current budget. Disagreements still exist in a few areas. The governor and the DOC are opposed to the $50 a day rate or any other per diem cost for housing state sanctioned residents, whichever is higher, as well as the definition in the proposed bill of state sanctioned resident. As of 3/4/22, there are 962 vacant beds in the county jails out of the 2,305 available beds, operating at about a 58% capacity. Based on those facts, the administration has questions regarding the need for additional funding. However, the administration remains supportive of the 1.9 million additional resources if funded and allocated by the legislature. While the counties would certainly like their proposed level of funding might provide, that same funding mechanism leads to uncertainty in the state budget, as the cost to be determined and allocated by the legislature as it reflects 20% level of funding at the state currently provides to the county jails. The governor fully supports and welcomes more collaboration between the county jails and her administration. The County Corrections Council is the forum to discuss issues such as ongoing funding, statewide contracts for food service and medical care, and the potential for jails to work with DOC on providing specialized services for residents. The administration remains committed to the process and would like to continue our work with stakeholders to get to a final agreement on this legislation. I'd be glad to take questions. Thank you.
Thank you, Commissioner Liberty. Any questions for Commissioner Liberty? Representative Morales.
Thank you, Madam Chair. Hello, Commissioner Liberty. Happy Friday afternoon.
Thank you. We finally got here.
I feel that very much. I just wanted to, I think I know the answer to this, but I just wanted to make 2 points. And one of them, I think, is there is no person in jail, any jail in Maine today that is in there because they violated a county law, right?
There are no county laws.
Right. Okay. And then the second question, and you told me this, and I can't remember the exact number of empty beds that we have in the Department of Corrections right now, but I believe it was over 1,000. Is that right?
Sure,
Can you share
that's
that
correct.
number with us?
Yes, I don't have it in front of me, but you're correct. We have a high number of vacancies at the Maine Department of Corrections.
Okay. Thank you.
Sure.
Any other questions for Commissioner Liberty? Yes, Representative Pickett.
Yes, thank you, Madam Chair. Thank you for being here, Commissioner. Just one quick question. I've got the email that came from the governor's office through Mary Ann, and I'm looking at this, but I wanted to know one of the issues, and to me was a very important issue in this bill in the beginning when we first started on this a long time ago, and that is a definition. And what is the definition from the state's viewpoint? What is the definition of a state sanctioned resident? Because there is a question with that. It says the governor is opposed to the $50 a day rate or any other daily per diem cost for housing state sanctioned residents, as well as the definition in the proposed bill of state sanctioned resident. So from the administration's standpoint, what is a state sanctioned resident if it's not what it is in the bill, outlined in the bill?
Thank you, Representative. There's no such definition. This is a new term that's been coined by, I guess, this bill. So there's no such thing as a state sanctioned inmate at this point. We've never used that term before. I'm not sure where that came from, but I would offer this. When Sheriff Brackett indicated that the counties have no influence over who's incarcerated in their facilities and it's a state issue, I would say that that is partially true in that we have no, as you look at the definition by this bill, who a state sanctioned inmate is, the arresting officer makes that determination of which charge what they're charged with, the level of crime. If they are charged with an A, B, or C, that becomes a state sanctioned inmate by definition. If they're charged with a class D, that becomes a county inmate. And so that's determined by the law enforcement officer that makes the initial arrest, regardless of what the actual conviction is. As you know, most of these charges will be negotiated down to a lesser charge, regardless if they're convicted of a class D or an E. The state would still be on the hook to pay for that misdemeanor, which would be a county charge. There's much work to be done here. And so to answer your question, we have no definition of that yet. This bill introduces that term, and we've never used that in our industry in the last 40 years I've been involved.
Are any of the parts of the definition here, as you look at the bill, if you have it in front of you, are any of those parts, would you consider to be prisoners that should be responsible by the state?
I would say that when there's talk about the state acknowledging their obligation to fund county jails, I think we do that with the 18.4 million that we fund now, and the governor's willing to assist with or go along with the 1.9 additional. I would say one of my major observations throughout this negotiation has been, if it's the goal of the legislature or the county organizations to stabilize their budgets and achieve a 20% contribution by the state, so be it. The challenge that I have is the state sanction piece and all of the work that it would take and the additional FTEs. I would have to bring on additional people. We would have to RFP and purchase additional software to collect all of this data, when if the goal is to stabilize the budget at 20%, why would we go through that exercise of all the additional? We're talking about 20,000 intakes a year, 20,000 people being tracked annually by the counties and then by the state in order to justify a 20% increase or greater. And so that's been my argument from the beginning. If we want to stabilize that number, and how could we ever anticipate at the state level? How could the legislature ever anticipate a fiscal note? We don't know what a state sanctioned fiscal note would look like. We have no idea. And so 20% would assure what it would cost in the legislature, what we have to appropriate there, what the state can count on, what the counties can count on. That 20% is the best way to get there, I believe, without having to go through the bureaucratic exercise. And quite frankly, I believe growing state and county government with additional bodies to do those counts. It becomes complex. If the person's arrested on a Class C, that's when the billing starts for the state under this bill. If they're in the county jail, if they bail out at day 30, that's when the clock stops. If they're out on bail and they have they come on a new charge, a Class D, the county picks that up. If they're bailed out from there and they come back 10 months later, it's a Class C, the state picks it back up. So the complexities of that, not to mention if there was a probation revocation. And so we have this very difficult, the bars and craft system, as I've mentioned in many of these work sessions, they're spreadsheets. This would require a whole new purchase of software for 15 county jails and for the state to have to develop software that will be operated, data input from the county jails, audited by the state to try to justify a funding mechanism where if the goal is 20% funding, let's get there.
Thank you, sir.
Thank you, Representative.
With leave of the committee, I'm going to ask for permission to ask one question of the commissioner. Although I'm the sponsor, you notice I have not asked any questions. Does my committee support me asking one question of the commissioner that just came up that I think is important? Okay.
In light of the fact that we did that yesterday, and we've been trying to do that as long as it doesn't get out of hand, I would think that I certainly don't have any objection to one question.
Thank you so much. Commissioner Liberty, you in your testimony sort of try to make a case about the number of vacant beds, and I think we all kind of know the message that's trying to be sent there. There are over 1,000 empty beds in the DOC.
I don't have the number in front of me. Right.
You and I both know there's about 1,026 empty beds in the DOC. Have we decreased the funding that goes to your facilities?
We have not.
Thank you. Senator Searway, do you have a question?
Thank you, Madam Chair. How would it work when the class gets lowered? How would that work from the court standpoint? Would they have to be part of this to put those factors in, or would it be totally up to, I don't know who, when it comes to figuring this thing out?
Thank you, Senator. I think that becomes the complexity of tracking these individuals over, it could be several years as they navigate the judicial system. And again, the complexity of tracking 20,000 individuals at intake, when, as you know, you worked intake, as did I, very busy, as previous testimony indicated. It's the emergency room of corrections. It's chaotic, it's full. People are there arriving drunk, high, withdrawing, assaulted. The world just changed for them. It's very chaotic. And to try to manage accurate data input in those environments, or add additional bodies, I guess, to do that, seems to me to be adding bureaucracy, adding another level of growing government at the county and state level. When as if the attempt is, again, for a 20% funding from the state, let's do that. Thank you.
Any other questions for Commissioner Liberty? Seeing none, thank you, Commissioner Liberty, for being here. Anyone else here to speak neither for, were you neither for nor against, or were you opposed? Neither for nor against, thank you. I apologize. Anyone else here to testify neither for nor against this bill? And I'm seeing no more hands. Therefore, I will close the public hearing on LD 1654 and thank all of those who came to testify today. Thank you. And next up, we have LD 1988, which is the year I graduated high school, in case anybody's interested. And I don't have the title in front of me, and I don't know where my co-chair went. Give me just a moment to get to it. Next up, we have LD 1988, an act to establish the provision of emergency medical services by an ambulance service is an essential service, and to establish the Blue Ribbon Commission to study emergency medical services in the state, with Representative Talbot Ross, and I believe she is here.
I don't see her yet, Representative.
Okay, great, thank you. I know she also has bills in HHS, so let me see if I can send her a message and let her know she's up.
I was going to say we could go to the next bill, but she's a sponsor on the next bill too, so I guess it won't do us any good.
Right, thank you. How about we give ourselves 2 minutes to get ourselves a cup of tea or a cup of coffee, and I'm sure she'll be right here.
I like that idea.
Me too. I've been wanting a cup of tea for about 2 hours, so I'm gonna run to the kitchen.
Thank you, Representative Warren, for taking over.
Sure thing.
Oh. That's what happens when you sit down too long.
It's really true. Sitting is the new smoking. I don't know if you heard that.
Really?
Yeah, it's bad for you.
Oh, it's bad for, oh, okay.
I'm gonna get a cup of tea. I'll be right back.
Friday afternoon. How long we gonna wait?
Plus, she has what, 2 bills? Which one are we doing? We're doing 1988, 1999?
Senator,
88.
she's here. She's in the waiting room. I just looked.
Oh, she is? Oh, okay. Yep. She's there.
Sorry about that. I was taking a call.
Okay, good. She's right. She's coming right now. Hello.
Hello. So I agree with you, Representative Pickett. It's Friday afternoon. Let's move on.
That's great.
Are we all set to begin?
Welcome, Representative.
Thank you kindly, Madam Chair. Senator DeChambeau, Representative Warren, and the distinguished members of the Joint Standing Committee on Criminal Justice and Public Safety. My name is Rachel Talbot Ross. I represent House District 40, which is part of Portland. I want to thank you for this opportunity to present LD 1988, which is an act to establish that the provision of emergency medical services by an ambulance service is an essential service, and to establish the Blue Ribbon Commission to study emergency medical services in the state. Emergency medical services, sometimes known as ambulance or paramedic services, provide urgent pre-hospital treatment and stabilization for serious illness and injuries and transport to definitive care. It is a system of seamless and coordinated care, response, and emergency medical care. It is a comprehensive service that responds to every kind of emergency in our state. Maine's emergency medical service providers have faced unprecedented strain over the past 2 years. Like all of our healthcare and emergency response systems, COVID-19 has placed a greater burden on EMS than ever before. But Maine's EMS system has been increasingly strained for years, even before the pandemic. Lagging reimbursement rates, recruitment and retention challenges, training, an aging and rural population, and I might add an aging volunteer workforce, and other issues have made it more and more difficult for EMS providers to offer the services each and every one of our communities depend on. This bill is a recognition of how fundamentally important EMS is to our state. EMS is an important part of public safety, yes, but it is also an integral part of our healthcare delivery system. This bill is also an affirmation. I want to say to EMS, we hear you. As I worked with stakeholders to develop this proposal, I heard again and again and again the sense of frustration that our EMS workers have told us that we are on an unsustainable path, but that policymakers have not acted. I believe it is time we hear them and act. LD 1988 has two parts. The first would codify in statute that emergency medical services are essential services, just like those services provided by our fire departments and law enforcement. I hope we can all agree that there is no question that this is true. I am offering a minor amendment today, which is attached to this testimony, to remove the bill's reference to federal funding, as I've come to understand that it is not necessary. Second part, LD 188, establishes the Blue Ribbon Commission to study emergency medical services in the state. This bipartisan commission would be charged with examining and making recommendations on the support of and delivery of EMS, and is empowered to include all aspects of EMS, including workforce development and training, compensation, retention, cost, reimbursement rates, organization, and local and state support. One thing I want to make clear about what LD 1988 does not do is provide a mandate to communities across the state to have an EMS service. This is not a bill or a mandate. The membership of the Blue Ribbon Commission, however, would include 6 legislators, including 4 from the House and 2 from the Senate, 2 members who are either employed or volunteer in the field of EMS, one being from a larger community and the other from a smaller community, 1 representative of a tribal EMS, 1 representative of volunteer EMS, 1 representative of a private for-profit ambulance service, a representative of the Department of Public Safety, and the Commissioner of Health and Human Services, or a designee. This commission would be required to report back to this committee with its findings, recommendations, and suggested legislation no later than December 7th, 2022, allowing us the opportunity to continue our work in the first session of the 131st legislature. Forming a bipartisan Blue Ribbon Commission charged with reporting back to the legislature signals to so many how critically important this system is to all Mainers. I also want to be clear that this process would not be competitive or compete with any strategic planning process that is currently underway by Maine EMS, but one that would amplify these issues at the policy level and allow for the greatest opportunity for this work to move forward. I am deeply grateful to a number of folks, but to the stakeholders who work closely with me to develop this proposal. In particular, I want to thank Representative Sue Salisbury. I want to thank the Chief Operating Officer of Northeast Mobile Health Services, Rick Petrie, the Paramedic Chief Miles Villalobos of Pleasant Point EMS, Director Jay Bradshaw of the Maine Ambulance Association, and Director Sam Hurley of the Maine EMS for all of their input and their tireless commitment to strengthening and securing Maine's emergency medical services for years to come. I would be remiss if I did not mention and give honor to all of the folks, both volunteered and paid in this state, who work every single solitary day to respond to emergency crisis, some of the worst times in any of our lives. These are folks who are right there. They're first responders for each and every one of us, and they do a very, very, very good job. They deserve for this bill to pass. Let's make EMS an essential service in the state of Maine and give it its rightful place alongside our law enforcement and fire services. Thank you so very much, and I'll be glad to take any questions.
Representative Talbot Ross, I did read somewhere, and it may have been an email, and you made reference to it, to remove federal funding or apply for it, I guess. in the original bill I can't seem to find it, or where was that stated?
So the original bill is actually part one of the original bill. If you look, Senator, after the emergency preamble, because this bill does have an emergency preamble on it, we're hoping that it can gain and garner the support of a bipartisan support. But if you look at the original bill after the emergency preamble, section 1 reads, for purposes of eligibility for federal funding.
Yep.
And the reason why I took that out through the amendment is I have come to understand that that is not a requirement, that just by connecting federal funding would not make it an essential service. That's not a criteria. And so I amended the bill so it didn't falsify that was a proxy.
Good, thank you. Skip right over it. Anyone have any questions to Rachel Talbot North? I don't see any. Thank you.
Thank you.
Anyone, any legislator wish to speak? I don't see any, but I see Mr. Hurley here, so I will ask those who wish to speak in support, please raise your hand and I'll let you in. And okay, I'd like to begin with Jay Bradshaw, since he's very much involved in this, and followed by Rick Petrie, and then Suzanne Salisbury. Oh, Suzanne, you're a legislator, right? So we'll let you go first. I apologize.
No problem. Thank you so much. I appreciate the opportunity for being able to speak. Senator DeChambeau and Representative Warren and colleagues of the Joint City Commission on Criminal Justice and Public Safety, you've all had a very long day, so I'll make this brief. I do represent House District 35, which is part of Westbrook. I am also the chair of the newly formed Legislative Caucus on Emergency Medical Services. I am speaking to you today in support of LD 1988, an act to establish the provision of emergency medical services by an ambulance service as an essential service. Right now, most people in Maine feel that if they have a medical emergency and call 911, an ambulance is going to come and help. The current EMS workforce shortage is testing that theory. In Maine, according to Maine EMS and Maine Ambulance Association, there are approximately 6,000 licensed providers that respond to about 279,000 calls a year. These providers work for transporting and non-transporting services and in non-ambulance settings. Many work more than 60 to 70 hours a week. Over the past few months, through hours of meetings and in-depth discussions with various stakeholders and those working in the field, it has become abundantly clear to me that the EMS workforce shortage in Maine is at a crisis level. Starting pay for an EMT is $15 an hour. For a paramedic, it's $18 to $20 an hour. These positions do not result in a living wage because insurance is not paying the full cost to transport patients, and reimbursement rates don't adequately cover the cost of providing services. These low wages and the workforce crisis is also creating an issue where hospitals are having a hard time finding ambulances to provide interfacility transportation, which is hindering their ability to open beds up for new patients. Our EMS personnel are struggling and it's impacting all of us. While I'm extremely grateful for the EMS workers who have given their time to educate myself and my colleagues on the issues facing EMS providers in Maine, our conversations are anecdotal and do not constitute hard data. The Blue Ribbon Commission and report back proposed by LD 1988 is critical to understanding the scope of the problem, obtaining the necessary hard data, and codifying recommendations that we as legislators can then act upon to approve this essential service. The bill before you importantly acknowledges how integral emergency medical services are to the functioning of any society. If I've learned anything over the past several months, it's that it's time we address these unacceptable realities and show this industry and the hardworking men and women that sacrifice so much to save Mainers' lives that we see them and we value them and their contribution to our state. This legislation takes this charge seriously, and I believe is the critical first step in addressing this issue. Thanks so much for your time, and I'm happy to take any questions you might have.
Thank you, Representative Salisbury. That was well stated. Thank you. Anyone else wish to ask a question of Representative Salisbury? Seeing none, thank you again, Ms. Salisbury. I now will recognize Jay Bradshaw.
Yes. Good afternoon, Senator DeChambeau, Representative Warren, and members of the Joint Standing Committee on Criminal Justice and Public Safety. My name is Jay Bradshaw. I live in Belgrade and serve as the Executive Director of the Maine Ambulance Association. My comments today represent the discussions of our legislative committee in support of this bill and with suggestions for additional amendments. I'd like to begin by thanking the sponsor and co-sponsors for their interest and support for EMS. We also appreciate the amendment presented by the sponsor attempting to clarify the wording of EMS as an essential service. We're very familiar with the range of ways essential has been defined as it pertains to EMS in other states, but are unclear on the net impact of this language in Maine. If we did a person on the street interview, I think that nearly everyone would say that EMS is essential. But when words go from casual conversation to law, they need to be defined. Saying that one area of EMS, one area of public safety, EMS, is similar to other areas, such as fire and law enforcement, without further statutory definition, may create confusion about responsibilities and false expectations. We submit that the issue of EMS being designated as essential in law should be carefully vetted and be included in future policy recommendations presented to the legislature. We also support the need for a review of the statewide EMS system and are pleased that Maine EMS has contracted with a national EMS consulting firm that will work with the Board of EMS and interested stakeholders on a strategic plan that will include recommendations requiring legislative action. One of the challenges in any strategic planning process is to collect information from those involved with the system at many levels and from the public. To then come up with action items requires the ability to distill that information with a high level of EMS expertise and make meaningful recommendations in a timely manner. We agree it is important that the EMS planning process is integrated with legislative efforts. We also believe the EMS planning process needs to finish its work before the Commission can then work on policy recommendations. As the main EMS work is expected to conclude in December, the Commission would then begin its work in January at the earliest. As such, we suggest that 4 legislators be identified to be involved with the main EMS project. That group should also receive the final report no later than December 31st and present recommendations to the appropriate Joint Standing Committee no later than January 31st of 2023, with authorization to then introduce legislation for consideration in the first regular session of the 131st legislature. I'd also like to comment on an important point just raised by Representative Salisbury. We strongly agree that EMS wages need to be increased. However, EMS revenue comes primarily from responding to calls and transporting patients, and reimbursement continues to fall well below costs. Legislation passed by the legislature in the first regular session of the 130th required private insurance carriers to implement a standard offer for ambulance services and for main care to pay the same reimbursement rates as Medicare. Those bills went into effect on October 21st, 2021. Yet as of today, we are still struggling to get private insurance contracts and main care reimbursement at the legislatively described levels. Thank you for your ongoing interest and support for the women and men who respond to calls for emergency medical help every hour of every day and in every part of our state. And I'm very happy to help with any questions.
Thank you, Mr. Bradshaw. I have Representative Pickett has a question.
Yes, thank you, Madam Chair. Thank you, Mr. Bradshaw, for being here. The question I have is, you're very familiar with, I'm sure, because you were here and testified, and also, I believe, was at the work session on Senator Curry's bill. And tell me what the major differences are between those two bills.
Senator Curry's bill establishes a fund to support municipalities who are evaluating their own local needs. So that this bill expands it to, this is taking a statewide look at the system.
And wouldn't, Madam Chair, so the bill that Senator Curry came in with, wouldn't it be good to get some information input back from what takes place with that, to give some idea for this commission that's coming in, to be able to have that information, to be able to, is that why you're suggesting the timeframes you are?
Well, I feel like, the guy on the Ed Sullivan Show with the dishes on the sticks going, but I think we can do this in a parallel process. Senator Curry's bill establishes the funding so that municipalities who are concerned, struggling, or perhaps approaching a crisis can make some educated decisions about what their options are, whether they should start an ambulance service, whether they should join a regional function or things like that. That can happen in parallel with what's happening with the Maine EMS strategic planning process. I think that the Maine EMS strategic planning process may, and I'm just hypothesizing here, may take and embed that not just as a pilot project, which Senator Curry's bill does, but make that an ongoing part of new ambulance services, so that they're, when services start up, they're doing so with a better understanding of what they're getting into.
Okay. All right. That and the reason why I asked that, because I personally myself, I'm not real big into studies and this kind of stuff, because oftentimes what we see, studies come up and we can bring legislation back and whatever, and somewhere along the line those fizzle, we never see nothing from it, and it ends up being an exercise in futility. When I see something like this, I want to know that there is buy-in to it, and then if we're going to do it, it's going to get done, because we really don't have time to be messing with the exercises in futility. At least I don't think so as a legislator. Thank you,
completely agree. And we don't have time. We don't have that luxury as an EMS system either. We need to do something now. But I will share with you that EMS has been active in the state of Maine for about 40 years. And for about half that time, I was the state EMS director. In 2004, we conducted a smaller scale of what's being proposed now for Maine EMS. That resulted in about 59 or 60 recommendations. We worked very closely with the Committee on Criminal Justice and Public Safety, and that provided the roadmap under which we operated for several legislative sessions. So, when you get 60 recommendations, not all of them were prioritized, but those that were prioritized as high or medium were then used to establish the policy going forward for several years.
Yeah, and I appreciate that, and I appreciate EMS. They certainly are essential. I worked with people from EMS for 40 years, so I know how essential they are. But I just wanted you to know that that's why when something like this comes up, I like to vet it and make sure that we're going to be getting something out of it. And it's not just going to be another one of those things that kind of lays on the table and drifts away.
Understood. Thank you for your question and support.
Yep.
Thank you. I don't see any other hands. And thank you for your testimony, Mr. Bradshaw.
Thank you, Senator.
Rick Petrie, welcome.
Thank you very much. Good afternoon, Senator DeChambeau, Representative Warren, and members of the Criminal Justice and Public Safety Committee. My name is Rick Petrie. I'm a paramedic who has worked in the Maine EMS system for 41 years. I'm currently serving as the Chief Operations Officer for Northeast Mobile Health. I'm here today to offer testimony in support of LD 1988. As you're hearing and as you've heard before, the delivery of EMS is very complex, and it's made more so by the fact that we're a very rural state. We have approximately 5,000 EMS providers working for more than 200 licensed services, responding on close to 300,000 calls a year. And these people every day are doing everything they can to help the citizens and visitors to Maine. But now we desperately need your help. This legislation is critically important to us. It's critically important that we move forward now because, as Jay has said, we can't afford to wait. We are currently underfunded, understaffed, under-resourced, and overextended. You've heard about the issues that we have with low wages and a declining work environment, and our providers are burning out and leaving the field quicker than we can replace them. Acknowledging that EMS is an essential service will not only provide a much needed psychological boost to an exhausted and overtaxed workforce, but will also reinforce that there must be a plan in place for the delivery of EMS in every corner of the state. In addition, as you've heard, the Maine EMS Board is starting a long delayed strategic planning process, and their work will be critical moving forward. But they don't have the ability to make the substantive changes that we need to ensure an effective, reliable EMS system for the generations to come. For that, we need you. And the situation is so dire that we cannot afford to wait until the Maine EMS Board finishes the strategic planning process in December for this committee to start. We need for the committee to start now and to work collaboratively with the Maine EMS Board in their strategic planning process so the legislature can come up to speed on what the obstacles are and the issues that are driving this program into the ground. I'm grateful for the work that has been done by Representative Talbot Ross and Representative Salisbury, as well as the support that we've received from many representatives and senators. And I strongly encourage you to improve this legislation. Thank you, and I'm happy to answer any questions you may have.
Thank you. Is there anyone that may have questions for Mr. Petrie? Seeing none, thank you again.
Thank
I
you.
now will bring in Miles Villalobos. We met with him this morning. Can you come in, Miles? Where are you?
I apologize. I'm here.
There you are. Welcome back.
Thank you, Senator DeChambeau. I appreciate that. I apologize first and foremost. I don't have prepared testimony, and I'm not well versed in the legislative etiquette, so I do apologize. Thank you, everybody, for your time. I am working on written testimony as requested. That'll be much different than this testimony now. Representative Talbot Ross, thank her tremendously for her efforts, and Representative Salisbury and everybody else, and all of the other efforts outside of this particular committee, Senator Curry and so on. Representative Talbot Ross explained very well what the bill is. Jay and Rick, essentially what EMS is and what the problems are. So what I'd like to focus on is the impact that this bill would have on EMS, on us as EMS providers in the communities that we serve. So there's those two aspects. The components of the bill is one, making EMS and recognizing EMS officially as an essential service, and then two, the Blue Ribbon Commission. First, I just want to speak to the bigger issue. The bigger problem here is the fact that really not many people outside of EMS understand what EMS is. And we don't have time to explain it any further than Rick and Jay already have. And that's hence the need for the Blue Ribbon Commission and the strategic planning and all of the other conversations that we're having at multiple levels, that nobody recognizes what EMS is to begin with. Never mind how bad the situation is, nor how at risk their communities may be, and many are. So going through this process, actually it stemmed from a very random conversation. And here we are actually finally having this discussion of things that we've been saying within EMS and certain agencies, organizations like Maine Ambulance Association have been advocating for increased reimbursement services and so on. The essential services has been one of the core, the root of our problems is the fact that there are 39 states that do not recognize officially EMS as an essential service, and that impacts us in a whole variety of ways, as Representative Talbot Ross explained. That lack of understanding of who we are and what we do prevents us from being what we can be, doing what we can do. So this is just one very, very small step, but I am certain it will have a very long-standing impact on all of Maine's communities, rural Maine, et cetera, if everybody else were on board. What I want to talk about as far as the essential services and hearing Rachel speak, the one statement, I quite literally wept, and that's why this is so important, because it's basically a sentence, one statement, that we see you, we hear you, we recognize you as essential, and we're behind you, we're in support of you, we are trying to figure out, we are aware that there are problems, we're trying to figure it out. But that simple statement, you have no idea how much that means to hear from a state legislature, never mind anybody in the public, that we hear you, we recognize you, and we appreciate you. It doesn't come often. This is a thankless job, grueling hours, very difficult situations that we have to deal with, and we do not have the support that we need. Hence why we need to be recognized as an essential service. I do agree with the amendment of taking out the federal funding statement. It's not entirely true, but it's also not wrong. Doing this, being recognized as essential, does open up funding pathways at the local, county, state, federal level. They just don't necessarily exist. That's why there's nothing concrete to point to. With regards to the Blue Ribbon Commission, to focus heavily on that, because I do believe that there is some resistance. One is Jay Bradshaw, some concern rather, that these would be competing efforts. And I am speaking from the ground. We need everybody talking about this, and we are. So to Representative Pickett, there is buy-in. We are having these conversations at every level. We've been meeting here in Washington County on a monthly basis, more than that. We'll be meeting with the county commissioners next week. There are conversations happening at every level, and we need them to. So Maine EMS must do their strategic plan. We as the providers need to be involved in that process, but we need the state legislature to be having this conversation as well, and to be involved in that strategic planning process. And I do believe that we can manage to do this parallel process of both.
Ms. Miles, could you wrap it up now? Thank you.
I can. The commission, it needs to happen. Again, the conversation has to happen at all levels, and the diverse representation that the commission brings to the table, I think, is important. One last thing I would suggest, sorry to put Representative Salisbury on the spot, but there may be an opportunity for the legislative caucus that she represents to be what Jay had suggested, of having some representation during the strategic planning process. Thank you for your time.
Thank you, Mr. Villalobos. Anybody else have a comment or a question? Representative Warren?
Thank you, Madam Chair. Thank you, Miles, so much for being here today. I know there's a lot to share here. So I also have known Jay and Rick for a long time working on this committee, and I know that they aren't prone to histrionics. So when they say we can't wait, I believe them. So tell me, Miles, because you didn't really get a chance to get to it, the thing that keeps you up at night, and that should keep us all up at night about what's happening in communities with EMS. Could you just give us that, the top of that?
Thank you very much, Representative Warren. That is one of the most important things. And you're right, there's so much to talk about, and we're so overwhelmed individually at the service level, our organizations, Maine EMS, that, so I apologize for that. So how bad is the situation? It is very bad. It is much worse than you can possibly imagine. And quite literally, people are dying. Now, that being said, the outcomes may be the same. We can only do so much. Harsh reality, death comes for us all. And I, as a paramedic, can only do so much. However, what I am certain of, and I have seen it, and there may be no official statewide data to back up what I'm telling you, but I am telling you from the front lines that people are dying without receiving the proper level of care or intervention that they deserve. Case in point, right now, there is not a single paramedic on duty between Calais and Machias here in Washington County, not a single paramedic. And that's, in the vast majority of cases, not necessarily a problem. A basic EMT the vast majority of our calls can be handled by an EMT. However, if you need a paramedic, you need a paramedic, and minutes matter. We have delayed response times out here, 15, 20 minutes on a good day. If you cannot breathe, you're going to die. If you have an allergic reaction or an overdose or a heart attack, you're going to die because it's going to take us too long to get you. We in EMS, we will figure it out. Somebody will get to you, but it may take some time, and in this, minutes matter. There have been a number of instances. It's just progressively getting worse. We were in dire straits before. There were articles out before the pandemic back in January, NBC and everywhere, talking about what happens if you don't call 911 or you call 911 and nobody answers. So we were in crisis mode before the pandemic, obviously worsened and exacerbated by the pandemic. We've been struggling to survive since. And just constantly being assaulted. And honestly, the vaccine mandate and that whole process and everything that's come from it, case in point, we in EMS were ignored, neglected, just not even talked about when it came to any of the impacts of decisions that were made as far as pandemic response, but the funding. We were left out of that funding. And this is one of the reasons is that it's an assumption, and it is a wrong assumption, that we are officially recognized as essential. I'm sorry, I could go on. Obviously, I can't give specifics,
That
but
was perfect.
communities are at risk, and it is going.
Sorry, you did a nice job of answering my question, and I appreciate that.
Thank you.
Seeing no other hands up, I would also like to echo that you did a great job. Great job. Thank you. It's we hear the passion in your voice, and that is so appreciative.
Thank you.
It comes from a good place. Thank you. All right. Anyone else wishes to testify in support of LD 1988? Seeing, I don't believe there's anyone, no. So anyone in opposition of 1988? I have Sam Hurley. Mr. Hurley, you can come on in. Hello, Mr. Hurley. Nice to see you again.
It's a pleasure as always, Senator DeChambeau.
Okay, go right ahead. We'll listen to your testimony.
Senator DeChambeau, Representative Warren, and honorable members of the Joint Standing Committee on Criminal Justice and Public Safety. My name is Sam Hurley, and I'm the Director of Maine EMS within the Department of Public Safety. I am testifying in opposition to the current language in this bill. Maine EMS would begin and would like to be very explicit to make it clear that we are strongly supportive of the principles that are listed in this bill, making EMS an essential service and establishing formal legislative support to bring about necessary changes in the state of Maine. Our opposition originates from our concerns regarding the implementation of these two items as described in this current legislative language. I would imagine that if you ask any of your constituents in every single one of your districts, they will tell you that they believe EMS is an essential service. Maine residents and visitors have the expectation when they activate the 911 system, an EMS crew will come to their aid. Their expectation is that this service is ubiquitous, and no matter where you are within our borders, an ambulance will come. That said, there is currently no law or provision that requires any level of government to provide this service. While our dispatch centers have worked to ensure that every inch of Maine activates at least one EMS agency, they may not be close, or they may not respond because that is not their primary jurisdiction. The revised language of this proposal says that emergency medical services provided by an ambulance service are essential services and as essential as services provided by a fire department or law enforcement agency. The EMS board recently passed a resolution in support of this declaration, but urges further conversations about what it means for the provision of services. The board's resolution reflects their view that counties are best positioned to ensure that this declaration moves beyond words to actions. This is a critical conversation that the board is undertaking by investing in the strategic planning process. Maine EMS would strongly encourage the committee to consider modifying this language into a resolution directing the Board of EMS to present a report to the 131st legislature on what essential services should look like in the state of Maine. Maine EMS has invested over $126,000 to bring a seasoned consulting firm to assist with strategic planning for the board. The board is seeking to develop a clear vision for the future of EMS over the next 2 decades and provide a comprehensive roadmap for getting there. We believe that the conversation about making EMS an essential service should happen as part of this process, and the strategic plan is targeted for completion in November of 2022. This leads me to the second section of the bill, the Blue Ribbon Commission. As I just stated, Maine EMS has already committed time and funding to develop strategic planning for moving forward with EMS in the state of Maine. The proposed Blue Ribbon Commission is duplicative and cumbersome because it will establish 2 processes that are occurring simultaneously. Maine EMS wholly believes that legislative action will be required as a result of our strategic planning process. However, we believe the board's process should play out before convening another commission. We believe it would be a better approach for the legislature to build upon and strengthen the board's current effort by directing the board to report back to the legislature on strategic planning and support a statewide EMS system that delivers this essential service. Maine EMS would recommend, as part of this resolve, that interested legislators be included in the strategic planning process. Maine EMS's strategic planning contract explicitly lists legislators as a key stakeholder. Proceeding this way avoids multiple issues. It relies on subject matter experts that are on the EMS board to develop a pathway forward for EMS in Maine, a responsibility that has been entrusted into them by their appointment by present and past governors. It avoids situations where the board's strategic plan and the legislative commission are not in alignment, thereby saving time on implementing the solutions to help our systems, our neighbor, and our EMS clinicians that we so greatly respect. It reduces duplicity and is fiscally responsible, and it is a collaborative approach between the regulators and the lawmakers, a public policy approach that is likely to be more inclusive and effective. Again, Maine EMS is fiercely supportive of the ideas that are discussed in this legislation and have been part of the conversation as they've been developed. However, our concerns regarding the process remain present despite raising them during the development of this bill. We ask you consider modifying this language into a resolve, directing the board to submit a report to the 131st legislature, making EMS an essential service in the state of Maine, and delay any Blue Ribbon Commission until the board's strategic planning process is completed, which is set to be November 2022. I'm more than happy to answer any questions you may have.
Thank you. I have Representative Warren has a question.
Thank you, Director Hurley. Thank you for being here. When are you guys going to be able to be out on the ground fixing the situation that exists in Maine, out on the ground, fixing it? What's your date?
So we have to go through the strategic planning process. So we're talking probably next year, but those fixes are going to come from you all. Like, we're going to have support
Clearly
from the legislature, but we need to come up with what are the fixes. I think we all have ideas of what we need to fix. We need to fix this, or we need to fix that, or we need to raise wages for staff members. But a lot of those are symptoms of an underlying problem. And the underlying problem may be that the system's not supported on a foundational level, and that we have an over-reliance on volunteers, which we love volunteers, but we don't expect your doctor at the local emergency room to volunteer their time to provide medical care. And so it may be more of a foundational issue. So we have to go through this analysis process before we just start doing. And that's our worry, is that we just start doing, then we're going to put Band-Aids on the problem and not fix the underlying foundational issues. And that's why we want to go through the strategic planning. We want to figure out those foundational issues. We want to include members of the legislature. So then when we finish this report in November, we can hit the ground running with the 131st legislature with bills that will start fixing this problem. Because, it's going to require legislative support, and unfortunately it's going to likely require fiscal notes to make sure that we can fix these issues. We're not trying to delay anything, but we also don't want to start just doing to do.
You may not be trying to delay, and I'm sure you're not, because I've come to work with you for quite a while, and I know I feel like I have a pretty good sense where your heart is. I've also been involved as a government official. This is year 21 for me. And I know that the speed of government is ice glacier. That's when we get stuff done. That is the truth. We move at the speed of an ice glacier. The fact that people in Maine could die from a heart attack because entire counties do not have paramedics. We should not be worried about turf and blue ribbon commissions or strategic plans. We should let the people who are out on the ground saving lives actually do the work. I just need to tell you that what I continually hear from this administration is, wait, we're working on fixing it. Wait, we're working on fixing it. People are dying while we're waiting. So I've registered my opinion of this bill. I think we should let the people out there doing the work fix the situation. Please consider that before the work session. Thank you.
Anyone else have any questions? None? Thank you. Thank you, Mr. Hurley. We'll get back to you, and I presume you will join us for the work session. Thank you. Anyone else in opposition? Seeing none. Anyone wish to testify neither for nor against? Seeing none, I will close the public hearing on 1988.
Madam Chair, Rebecca Graham raised her hand.
Rebecca Graham, where? I didn't see you, Ms. Graham. I apologize. Are you speaking in opposition?
No, Senator DeChambeau, I was neither for nor against.
Okay, thank you. You may go ahead.
Okay, thank you so much. Oh, sorry. Representative Warren, Senator DeChambeau, and members of Maine's Criminal Justice Committee. My name is Rebecca Graham, and I'm providing some testimony neither for nor against as a placeholder because we didn't have the opportunity to put this before the new language before our Legislative Policy Committee. So they haven't been able to review that. However, this does play into a theme that we have talked about before this committee before. With regard to the crisis that we're feeling at the municipal level with a number of our public safety services. Unlike law enforcement, however, there is a market force within ambulance service delivery, and there isn't a state alternative. So the state police have authority to respond if there isn't a law enforcement entity, there isn't a state ambulance service. And there are often private companies involved in that. So we are really glad that this committee is deciding, and as well as Maine EMS is deciding to dig into this issue and look at it in a systems way. And also under LD 1859, Senator Curry's bill, how that is going to allow there to be a lot more local voices in those conversations so that those individuals can actually decide what level of service it is that they need. That said, these services also reside within fire departments in many municipalities, and it would be really beneficial to have some of the folks who are paying for those services as well as those licenses that may need to be utilized in different ways within those communities to be part of those conversations. I've heard a lot of anecdotal information from the municipal end that folks have been moving from what are extremely understressed, very busy services into rural areas because folks are upping the pay for those individuals. So it is allowing them to receive the same amount of pay in a more rural service while not having to deal with the same pressures under a service that is under fire. So there definitely does need to be a system view, but we would like to see perhaps if the Blue Ribbon Commission does go ahead in whatever form in parallel to that, that there are actually municipal payer voices on that. Officials and administrators, that they could also be included. And we are grateful to Representative Talbot Ross that she has clarified the essential services, because that was also really concerning for us in terms of having a struggle to find people to fill these roles currently across the state. And with that, I'd be happy to bring back any official position that our Legislative Policy Committee does take if it happens before the work session as well.
Thank you. I have Representative Morales followed by Senator Searway.
Thank you, Madam Chair. Hello, Ms. Graham. I was wondering if you heard, I believe it was Representative Salisbury who gave us some data on the number of calls to EMS and the number of providers. So 6,000 providers and then 279,000 approximately calls. And I was wondering if you could bring some data back to us that you have with your members, if you have that at the work session.
Thank you, Representative Morales. I'll see what I can find. I believe that there's been a lot of work that's been done with Maine EMS and the Maine Ambulance Service. They may have more up-to-date data, but there are a number of services in which some of these services are couched in fire departments, and some of them exist on their own, and then there's privatized service. So I'll see if I can at least try to landscape view of how those municipal impacts where they occur.
Thank you.
Senator Searway.
Thank you, Madam Chair. Rebecca Graham, I just wanted to know how this and Senator Curry's bill, if they crisscross at all on one another. And also I wanted to just see if there's a way of taking what Senator Curry's got, and if there's a way of this kind of going hand in hand together and trying to accomplish. I just think sometimes we get so many bills, one's doing one thing, another, and then they're doing the same thing, but it sounds like they're very similar, but they get a little difference. So I don't know if we can figure that out. I guess that's what my question is.
Thank you, Senator Searway. No, I think it's a really good question because it does seem to be trying to attack the same problem from a couple of different ways. I believe Senator Curry's bill is allowing or at least creating grants so that regions that maybe share a same hospital or share the same service catchment area can actually cooperate with each other, understand the landscape of the services that are available in those communities, and decide what level it is that they are willing to prepare to pay for, and also be informed. Like, you might think that you're getting an ALS service, but you're actually getting a BLS service, and this is how much more it would cost. So right. Senator Curry's bill dives into the local level and allows those folks in the community to understand those services and be willing to put that money in. I think where the Blue Ribbon Commission can focus on are the things that level can't deal with, things like insurance reimbursements and any other state statutes that need to be implemented to deal with the market forces that are also in there, or address, whether or not certain areas, or maybe even define what essential service is essential service BLS, essential service ALS. I think that there's a lot of things that can happen at that higher level and maybe be viewed through the Blue Ribbon Commission that can't necessarily happen at the local level. And part of that may be EMS training in general, how it gets funded, how it gets paid for, and where it might need to be rolled out differently.
Thank you.
I don't see any other hands. Again, thank you, Ms. Graham. You do a great job. I always enjoy listening to you. Thank you. I was up to in opposition, neither for nor against. Anyone else? Seeing none, I will bring LD 1988 to a close, and we will be having a work session next week, most probably. We are going to LD 1999. And let me see. This is Rachel Talbot Ross's, Representative Rachel Talbot Ross's bill, an act to require civil rights officers at law enforcement agencies. Okay, there she is. Representative Talbot Ross.
Well, thank you, Senator. Senator DeChambeau and Representative Warren and the distinguished members of the Joint Standing Committee on Criminal Justice and Public Safety. My name again is Rachel Talbot Ross, and I represent House District 40, which is part of Portland. Thank you for this opportunity to present LD 1999, an act to require civil rights officers at law enforcement agencies. I am going to be speaking to the proposed amendment, which is attached to this testimony for your convenience. As amended, LD 1999, which would now be called an act regarding civil rights, will meaningfully build on the work over the past several sessions to end bias-based profiling in Maine. Part A, if you've got the amendment, will codify in state policies currently found in Policy 6 of the Maine Criminal Justice Academy Board of Trustees minimum standards. It requires law enforcement agencies to designate and train a civil rights officer. The name and contact information of each agency's CRO must be provided to the Attorney General, who shall make the information available to the public through the Attorney General's website. This provision is so important to ensure that violations of Mainers' civil rights are prevented, and also that there is recourse available when such violations do occur. That is why it is simply not enough to have a policy in place. We must codify it in Maine law. Part B of the bill expressly defines and prohibits bias-based profiling. During the 129th legislature, we actually passed LD 1475 into law, which required profiling policies and training along with a formal complaint process. It did not, however, place the express prohibition of profiling in statute. So Part B of LD 1999 rectifies that by putting a clear definition and prohibition in statute where it belongs. Part C of this bill would provide $149,000 in funding to carry out work that this legislature has already directed law enforcement agencies to do. Members of this committee may recall LD 132, which became law last year in July. Now Title V, Chapter 337D, it requires law enforcement agencies to collect certain data beginning on July 1st, 2023, in order to give us objective information on the subject of profiling. Originally, LD 132 included the funding necessary to allow Maine State Police to update its technology in order to meet those data collection requirements. However, the funding in the bill was reduced when it was passed off the special appropriations table. I believe Maine State Police Lieutenant Bruce Scott will be here to speak in more detail to the need for this funding. The work of eliminating bias-based profiling is near and dear to my heart, and I know this committee has spent countless hours tirelessly looking at this issue. Beginning in 2009, I was so fortunate to be able to co-chair the advisory committee on bias-based profiling by law enforcement officers and law enforcement agencies, along with then Department of Public Safety Commissioner John Morris. We've been involved in this work for several decades, and I am proud of the important progress we have made in the last several years. I wanted to speak a tiny bit to how this bill came to be. I was approached by Rebecca Graham from the Maine Municipal Association, who we just heard from, early last summer, to consider putting this bill in that would fund the software and the technology piece for the Maine State Police in order to adhere to the law that requires, current law that requires data collection. Rebecca Graham brought law enforcement agencies together. We included civil liberties organizations. We created a team of folks who were looking at this issue. We believed at that time that there was an express prohibition against racial profiling in law. What you have in law is a complaint process, you have data collection, you have training of officers, you have a standard operating policy. All of these things are now codified in law. They're already law around bias-based profiling. The only thing that's not in law is the prohibition for bias-based profiling. This bill puts that prohibition in Title V, Chapter 12, under human rights, and allows for all of those other policies to now be attached to an express prohibition. The other thing that this bill does is there's been a long-standing practice in the state of Maine, for law enforcement agencies to assign a member of that agency as a civil rights officer. This is not new. Long practice to do that. Those CROs who are designated by law enforcement agencies receive additional training on the Maine Civil Rights Act and bias-based and hate profiling, bias-based profiling and hate crimes. They receive additional training. Those CROs in our law enforcement agencies are resources both to the department and to the public. These are extraordinary officers who go above and beyond the call of duty to serve in these roles. What this bill does is recognizes them and places them and their service squarely in the Civil Rights Act, in the statute of the Civil Rights Act in Title V. And so I just wanted to give you that landscape. The bill was brought to me by Maine Municipal Association. We've worked since early summer on this bill. We're proud of this bill. You may hear from some of those folks, but I bring this bill to you not as an individual legislator, but as a member of a group of people who are concerned about bias-based profiling in the state and have done a lot to move it forward, but we now need to make these last two steps. And I hope that you will join me in that process. I'll be glad to answer any questions that you have.
Yes, I have. Representative Pickett has a question.
Yes, thank you, Madam Chair. Thank you, Representative Talbot Ross. Really, the real crux of this bill, as I see it, is the funding. The funding, because we talk about racial-based profiling and these things, and we talk about it, I believe, we talk about it on a national level and bring Maine into it. And so probably your idea on racial-based profiling and mine might be a little different, although we both agree it is a problem. Okay, so I guess what I'm saying is, in order for us to really know just how much of a problem it is here in Maine, we have to have the data. I think we'd all agree on that. And so the data is going to be gotten by the funding of the program to make that data start coming in so we can actually realize what's going on here. So I disagree with you in the fact that I think the other things that you're trying to accomplish in the bill, I think are already there. I think racial-based profiling is against the law. It's not, it has been, it was back when I was on still a police chief 8 years ago. Training is out there in the Maine Criminal Justice Academy, has been since I was a police chief back 8 years ago. But I think we can all agree that the real crux of this bill is the funding. So I would just make a friendly suggestion to you to consider, and that is just taking and amending the bill and putting it as the funding. Let's get the funding out there, find out the real facts of what's going on so that we can really make a decision just how much of a problem it is here in Maine. Just a suggestion to you.
Thank you, Representative. I'm grateful for the suggestion. I will agree with you that you and I disagree on this fact. I believe that people need to see things in law to make them real. And this is not in law. It is not in law that the mandate for law enforcement agencies to have civil rights officers connected to the Civil Rights Act is not there. And it is not there about the express prohibition. Maine Criminal Justice Academy has not been doing training on racial profiling. They've been doing training on hate and bias crime, but they have not been doing specific training on racial profiling until a couple of years ago, when we made sure that it was part of a continuing education component. It's not part of the mandatory training on profiling. It was part of a continuing education component. What we were able to get done a couple of years ago was standard operating policies. They need to be expressly in the law, in Maine's law. There are people who look like me all over the state who depend on seeing that in state law. I don't feel comfortable without knowing it's in state law. You're right. You and I have very, very different experiences. I've been stopped by state police and the first question at the stop on I-295 coming out of Portland on my way to Augusta to serve the people of this state, the first question I was asked by that state trooper was, how long have you been here? Of which I politely said 9 generations. 9 generations. So unless you have anything more, I need to get to Augusta to go serve the people of the state of Maine. I need to see this in law, Representative. You may not. I need to see this expressly placed in law.
And I would not disagree with you that it needs to be in law, but I believe it is in law right now. And so that's where we differ. But I will tell you this much: for the work session, I am going to dig into this very deeply, and I will have information on the work session myself, and hopefully we'll get a resolve on that part, and hopefully we'll get to the real nuts and bolts of the issue. And that is let's find out what's really going on and get the funding in and find out what's really going on in our state in regards to this issue. And I'm all in on that. I have no problem with that whatsoever. Thank you very much.
Representative. I appreciate that. And if you could, for the work session, if you could show me where it's expressly placed in law that there is a prohibition against racial profiling, I'd appreciate seeing that as well. Thank you.
I will certainly try to have that for you.
Senator Seaway.
Thank you, Madam Chair. I just was asking Representative Talbot Ross. I just was wondering, are you looking for the funding to do just what you really want to accomplish? I guess that's the key, because I think we really do need the funding to do what you're asking.
Thank you for the question, Senator. I am very much committed to trying to get this funding. I would agree with Representative Pickett. We don't know what we don't know. And I believe that law enforcement in this state are committed to ending racial profiling. And I believe that you will hear from them that they do need this funding in order to have the software that would allow them to collect the data that tells the story. They see it as a resource. I do too. But I also think that you're going to hear from law enforcement that there is nothing wrong with this bill, that they support making sure that it is an express prohibition in the state of Maine for racial profiling to be prohibited. I think you will hear from the good men and women of law enforcement in the state that they agree that this needs to be codified as well.
Well, I have to agree with you. I think that there's nothing wrong with this bill because it already exists, but this is putting it into the verbiage, which I don't have a problem with that. I think that I just want to make sure that we have the funding to get the data.
I promise you, Senator, I will fight very hard for that funding. Thank you.
I know that this question, Representative, is semantics, but that means something to me. You said state operating procedures in the law. Is that what you said, or policy? Because I can understand a policy statement, but I don't know if you misspoke. on that one?
It is a standard policy. It's
standard
it's
policy.
actually
Okay,
what is in, it's mandatory policy.
Okay, thank you.
Thank you.
Are we all set with that? Okay. I will now go to any legislators wishing to testify on LD 1999. I have, well, is Nathan Kempthorne? Oh,
Doesn't look like there's any legislators, Madam
no, I
Chair.
don't believe so. So now I will ask anyone speaking in favor, and that is Nathan Kempthorne, followed by Rebecca Graham, Michael Cabetta, and there are others, and we'll take these three. Nathan, please, we'll let you in.
Madam Chair, and if I could just remind our members who have done a very good job so far today, we are at about 3:45. We have probably 16 people have signed up to speak. So let's try to hold our debate on the bill for the work session. Let's hear from the people today. Once this bill is over, we have 2 more work sessions to do. So I'd love it if we'd stay right in public hearing and get through this bill and get to the work sessions. Thank you.
We broke that rule a couple of hours ago, but go ahead. I shall.
Let's try not to break it again. Thank you, Madam Chair.
I will refrain. Not myself, but I will refrain from making a comment further. So, Nathan Kempthorne, go right ahead. Welcome.
Thank you. Can you hear me? Can you hear me?
You
I'm
are
sorry.
speaking. Okay.
Yes, we can hear you.
Go ahead.
Good afternoon. Thank you for the opportunity to speak with you today. My name is Nathan Kempthorne, and I would like to provide the following testimony in support of LD 1999, an act to require civil rights officers at law enforcement agencies. I believe this bill is an important first step toward creating an intake pathway for civil rights complaints to be submitted at the local level. I also submit that civil rights officers and law enforcement agencies throughout Maine should be vocal about their role in the community, and there should be public outreach to marginalized communities throughout the state to make sure they understand their rights and how to submit a complaint. Why am I here? I'm a veteran of the United States Navy and the U.S. Air Force and a former member of federal law enforcement. My wife, who is a naturalized immigrant from Mexico, was an MDOE certified educator, and my Latina daughters experienced extreme racial discrimination in Washington County, Maine. When your government did nothing to ensure our safety, we ultimately left your state. I've submitted multiple internal emails collected via FOA from the Office of the Attorney General into testimony, and those emails demonstrate the OAG was aware the Washington County Sheriff's Office and the Machias Police Department did not have trained civil rights officers on staff when my family needed them. Additionally, the OAG emails indicate this was quote unquote, essentially a violation of state law, end quote, and infer this was an issue throughout the state. The fact the OAG did not even know there was no law is even more proof this was never a priority. The intake process of a trained civil rights officer is just the first step in a process that should be reviewed and reformed. The second step, the Maine Human Rights Commission, is where civil rights officer will refer the case for investigation. The MHRC currently operates as a state-funded catch and kill operation that forces survivors to be silent with non-disclosure agreements during investigations that can last up to 2 years and publicly encourages monetary settlements that permanently silences survivors. The government leadership structure that is responsible for enforcing civil rights law should also be reformed. And it should be noted that since 2019, ensuring law enforcement agencies have trained civil rights officers has been the responsibility of Chief Law Enforcement Officer, Attorney General Aaron Fry, and for the prior 11 years, the former Attorney General Janet Mills. For 21 years, since 2001, this has also been the direct responsibility of the current Chief of Financial Crimes and Civil Rights, Assistant Attorney General Leanne Robin. I urge each of you to read her internal emails to her staff that I relayed in written testimony and determine if this committee feels she or her staff are the right people for this important job. As for the folks on this committee who believe this isn't an issue, please note that the law enforcement officers in Washington County publicly supported Paul LePage, who referred to Hispanic people as quote unquote the enemy and urged people to shoot the enemy. He was speaking about my family. My American family. And his law enforcement officers agreed with him. And that terrified my American family. Bottom line, this bill ought to pass. $159,000 is pennies. And this committee needs to understand that this will just fix the intake process for survivors of civil rights violations to engage in a very, very broken process. I again appreciate the opportunity to provide this testimony to your committee, and I urge you to pass this bill.
Thank you, Mr. Kempthorne. Like hearing from the public and your experiences, that's very helpful to know. Anyone have any questions of Mr. Kempthorne? Seeing none, again, thank you for your testimony. I missed that. You did submit written testimony, right?
At the top of your inbox.
Okay, thank you.
Those are just a few of many, many emails that you can see if you'd like to see them. And I would say that the folks that need to enforce this law are not currently in place.
Thank you.
Thank you.
Now I think it was Rebecca Graham, followed by Michael Cabetta.
Thank you, Senator DeChambeau, Representative Warren, and distinguished members of the Criminal Justice and Public Safety Committee. My name is Rebecca Graham, and I'm here testifying in support of LD 1999, as well as hopeful and really appreciative of Representative Talbot Ross' help and assistance with fixing something that we feel left a really big gap in allowing law enforcement to be able to reach some of their needs by this data collection, but also create a system that would allow them to apply for funding and effectively do this in a meaningful way. Rolling forward. So as you've already heard, we gathered a large group of stakeholders that included the Attorney General's Office, the Department of Public Safety, the Maine Sheriff's Association, Maine Chiefs of Police Association, American Civil Liberties Union, some university professors, and MMA. And we've been meeting constantly since September until January and working on multiple drafts of this legislation to try to fix a problem that was created by kind of an eviscerating of the fiscal note that was attached to LD 132 last year. All of the law enforcement professionals that were involved in that process really wanted to make sure that they were not only meeting their obligations, but actually collecting data in a meaningful way that would allow there to be a very clear picture that would be presented from that work, but also reduce the burden on a vast majority of which are local police departments. And the way that we see that happening is through a centralized state system that mirrors something very similar in the crash reporting data system that already resides at the state level. And that's called the e-citation and e-warning module. The creation of this, or the way in which this functions, I believe the Department of Public Safety can go into in more detail, but there are key pieces to this that will also help law enforcement that participate in this. One is that it provides a public safety nexus so that they can actually apply for federal funding for the pieces that are necessary to interact with this at the state level. But it also reduces some of the data entry for names and automatic transmission to the courts. So it reduces the time on the side of the road for that individual. And then it allows one single point of data entry that can capture the data requested in 132 in real time. And automatically it creates a presumption that they actually meet the mandates of that. But then that is going to be continued to be able to be viewed and disaggregated from the identifying data as necessary from that centralized system. So it really is a whole package system that is necessary in order for this to be a meaningful and actually valuable tool, and rather than getting multiple different 24 different ways in which this data could be captured. It really centralizes that. So we worked really hard on this. While the Legislative Policy Committee didn't see this new language because it just got in, so I don't have an official position. Functionally, this changes nothing for law enforcement because they do act as though the academy policy to them is in statute. So it doesn't change anything, and we wouldn't have no objections to that being put into statute and being explicit and being used as a tool, I believe, to also indicate what is already happening and that shift, the paradigm shift that's happening within the Criminal Justice Academy. And I've submitted testimony to that. I'd be happy to bring back any more detailed information about that engagement process for the work session. But again, just like to thank Representative Talbot Ross for helping us try to find this solution.
Thank you, Ms. Graham. The question I have, not I have, but Senator Seaway, please.
Thank you, Madam Chair. Rebecca Graham, I just got a question. You say nothing changes, and this actually helps, and it also helps getting the funding and that sort of thing, and I think that's great. I just have a question about your understanding about adding prohibition in this, if that's included or what, or how that works and what it means.
With regard to placing that in Title V and that section under the civil rights, I believe Lieutenant Scott could actually speak to the functionality of that, but I believe that they operate under that presumption already. And knowing how brilliant he is, he'll probably be able to rattle off the exact pieces of law in which they use to develop that policy. So he's definitely going to be more versed to that. But I know that functionally, from the folks that I've spoken to, they don't believe that this prevents any or creates any sort of problem, because this is already a violation of law in their opinion. So putting it in statute won't change that, and it may actually make that more explicit and clear. And at least, as Representative Talbot Ross had mentioned, it may make individuals that don't know or don't see that policy or that operational policy feel more confident that they can look it up within our state statutes as well.
Thank you.
Thank you. I don't see any other hands up. Okay, thank you again, Ms. Graham. I now will recognize Michael Cabetta. And let me bring in Joanne Batista, Larry Denzinger, and Lieutenant Scott. Thank you. So, Mr. Cabetta, go right ahead.
Thank you very much, Senator DeChambeau, Representative Warren, and distinguished members of the committee. Good afternoon. I'm Michael Cabetta, Policy Counsel for the ACLU of Maine. We are an organization guaranteed to committing to defending the civil rights and liberties guaranteed by our state and federal constitutions. And on behalf of our members, we urge you to support this bill as amended. If passed, this legislation would add a specific prohibition on racial profiling and other forms of profiling to the Maine Human Rights Act. It would require enforcement agencies, law enforcement agencies, to select, assign, and train civil rights officers and provide the names of those officers to the Office of the Attorney General. And it would provide funding for programming and licensing of software required to collect data related to traffic stops initiated by police. Racial profiling and other forms of profiling based on immutable characteristics violates the US Constitution by betraying the fundamental American promise of equal protection under the law and infringing on the Fourth Amendment guarantee that all people be free from unreasonable searches and seizures. It has led to countless people to live in fear, casting entire communities as suspects simply because of what they look like, where they come from, or what religion they adhere to. Racial profiling is not in keeping with Maine's values, and it's not right that we don't say so explicitly in our laws. Because it is a civil rights violation, it's appropriate that the place where it is prohibited is the Maine Civil Rights Act. This bill would also allow the Attorney General or the victim of racial profiling to pursue a declaratory action or injunction in court without monetary compensation. If enacted, this bill would fund necessary software for collecting data on traffic stops by police. We can only manage what we can measure. Currently, law enforcement do not have a way to measure who they stop for alleged traffic violations. Though a law passed last year under which they must do so beginning no later than July 1st of next year. To the extent that software is necessary for police to uniformly collect race and gender data on who's stopped by police, we support the provision of that funding. This law would put Maine's anti-discrimination values into state statute and provide a way to measure the enforcement of those values. We ask you to vote to pass as amended, and I'm happy to try to answer questions.
Thank you, Mr. Cabetta. Any questions for Mr. Cabetta? Thank you very much. I now will recognize Joanne Batista. Okay, go ahead.
All right, good afternoon. Senator DeChambeau, Representative Warren, and members of the Joint Standing Committee on Criminal Justice and Public Safety. My name is Joanne Bautista, and I'm the Deputy Secretary of State Policy Advisor and a resident of Portland. I'm speaking today on behalf of the department in support of LD 1999. And I would like to thank Representative Talbot Ross for bringing this important bill forward. Under the Bureau of Motor Vehicles, we have the Division of Enforcement, Anti-Theft and Regulations, which has 26 total staff, of which 14 are law enforcement officers. The law enforcement portion of this division provides law enforcement functions for the department. The responsibilities include licensing, regulation, and enforcement of laws concerning various types of vehicle dealers, title fraud, odometer fraud, auto theft investigations, registration evasions, insurance fraud, driver license and state identification card fraud, and consumer complaints. I am proud to report the Bureau of Motor Vehicles undertakes the practices laid out in LD 1999, such as having a robust written policy in place strictly prohibiting bias-based profiling and or any other discriminatory practice by members of the law enforcement division, and another policy that mandates having a civil rights officer. The Bureau has 3 civil rights officers who are registered with the Office of the Attorney General. And this isn't in my written testimony, but I do want to raise one point about the most recent amendment. So our officers in the Bureau would actually fall outside of the definition of law enforcement agency as defined in the current amendment, since they are not Maine State Police, they're not part of a sheriff's department or a municipal police department. Instead, they're part of a regulatory agency, which is the Bureau of Motor Vehicles, that happens to have a division of law enforcement agency. However, our officers do get the same training as any other law enforcement officer through the Maine Criminal Justice Academy, and they are certified officers with the same authority as any law enforcement in the state. So if the intent isn't to include all law enforcement officers, the current definition may need to be tweaked a little bit. And I'm happy to work with Representative Talbot Ross to change that. But ultimately, we agree the prohibition on bias-based profiling should be codified. And we support the sponsor's initiative to ensure all state agencies with law enforcement have the proper training to safeguard the state and federal rights of all individuals in our state without regard to race, ethnicity, gender, sexual orientation, gender identity, religion, socioeconomic status, age, national origin, or ancestry. This concludes my testimony. Happy to answer any questions or get any information ahead of the work session.
Thank you, Ms. Batista. Any questions? Seeing none. Thank you again.
Thank you.
I thought I had called, oh, I'm missing Larry Desinger. Go right ahead, Mr. Desinger.
Hello, my name is Larry Dansinger. I live in Bangor. Members of the Criminal Justice and Public Safety Committee. I've submitted written testimony, which is much longer than I could say now, so I won't even attempt to say that. But I do want to emphasize one item in there particularly, which is my hope that disability could be added to the list of categories of individuals that could be covered under this bill. And I noticed in the amended version that sexual orientation was taken out, and both disability and sexual orientation, I hope would continue to be included. My focus in my testimony was on the question of a lack of trust between the public and law enforcement. And I personally do not feel I can trust law enforcement given the many situations that are publicized these days. And I think there are many, many others who also share that feeling, a lack of trust, things that whatever the actual situation, what we read about, what we see in newspapers and TV and accounts of situations, several of which have taken place this week, make me, and I think many others, feel uncomfortable, in some cases fearful of law enforcement. I think that's something we don't want to accept, and to try and take actions where we can to change that. I'm concerned that if the bill is passed, well, I want to make sure that if this bill is passed, that law enforcement will cooperate with it. I'm hopeful that that will happen, but I'm concerned and want to make sure that that does happen, because if it's not going to happen, or if this bill is not passed, that there will be less of a commitment by the state and through our laws to build that trust that I think is necessary between the public and individuals. So just to sum up, I think law enforcement and civil rights must go together. I think trust in police must exist if we're to feel confident that the police are there to protect and serve and not to be a threat to our safety. So we do not have enough of that right now. I think that's something we need to strive for, and that could be done in part through this legislation. So I would urge people to support LD 1999 on that basis. Thanks.
Thank you, Mr. Desinger. I didn't see him. Did you state that you said that sexual orientation was removed from the bill?
I think so, from the amended version, yes.
That's it. I will turn to Representative Talbot Ross to answer that. Thank you.
Thank you so very much, Senator. What's apparent in law is in Title 25, which contains the Maine Criminal Justice Academy statutes, under hate and bias crime, subsection 2803B, letter E, under hate and bias crime, it lists those, all of the various protected classes. And in that piece of statute, Mr. Danziger is right. It lists sexual orientation and disability. And I might add, it also lists age. But when you look under Title V, the administrative procedures, and you go to Chapter 12, which is human rights. If you look on subchapter 337 B, which is the Maine Civil Rights Act, it does not list sexual, those other categories. It's missing age, for example. And so those two statutes, Title 25 and Title 5, where it looks at hate and bias crime, and the Civil Rights Act, the categories of protected classes are different. And Mr. Danziger, you picked up on something that I've been troubled by for a long time, is that these two statutes are not in compliance with one another. And so this is exactly why we need to make sure that this is codified. is because that we've got very different understandings of how this is applied, how profiling is applied, how the Maine Civil Rights Act is applied. It all depends on the statute that you're looking at in this particular case, because then you can go look in Title V at the Maine Human Rights Act, and that will have something different. And so you are right to pick up on that, Mr. Danziger, and Madam Chair. I just wanted to give the very specific places in which they are not consistent.
But you said that the one being taught at the academy lists that under the hate crime and sexual orientation is on that one, right?
Yeah, so my point in pointing out the inconsistencies in the title, there's 2 points. One is, Mr. Danziger, we did not purposely leave those categories out in the amendment. They're left out by nature of the statute. The statute leads them out. So once we moved the civil rights officers out of Title 25 in the Maine Criminal Justice Academy and we placed it in Title 5, that's what the amendment does under the Maine Civil Rights Act, you lose the consistency in those protected classes. So you're right, the amendment leaves it off just because we've moved it into a different part of the law. That's one point. The second point, Senator, is the Maine Criminal Justice Academy, I just want to say this, does an excellent job. And I've been able to work with them under the previous director, John Roberts. And there is sufficient amount of training that is going on at the Maine Criminal Justice Academy. I don't want anyone to misunderstand my remarks. What I was trying to get across, Senator, is that we have been doing years and years and years of training, mandatory training on hate and bias crime and civil rights. What we have just recently adopted within the last 10 years, 8 to 10 years, is training on profiling. And so that's, it may feel a little nuanced to you, but it's very, very, very specific training that we're talking about. And that training is already embedded in law, Senator. So no part of this bill is around training. It's already there. It's already there.
Thank you, Mr. Fedinger, also for bringing that subject up. So I appreciate that.
Could I speak quickly on that? Just for consistency?
Just to respond to Ms. Talbot Ross's or Representative Talbot Ross's comment. Very briefly, please.
Yeah, I would just want to speak for consistency. If I'm a gay man, for example, and I'm covered by some anti-discrimination laws and not by others, that makes me confused and less excited about state statutes. I want to know that I'm covered no matter what the situation. And certainly I would be covered under age because I'm an old fart and some people don't like those. So, you know, I would want that kind of consistency.
All right. Thank you. I think we picked up on something. Thank you. And I'm impressed that Representative Talbot Ross is so well versed in that. Thank you. Let me see. I think next is Lieutenant Scott, right? Welcome, Lieutenant Scott.
Thank you, Senator DeChambeau and Representative Warren, distinguished members of the Joint Standing Committee on Criminal Justice and Public Safety. My name is Lieutenant Bruce Scott, and I am here today testifying on behalf of the Department of Public Safety and the Maine State Police in support of LD 1999. We have reviewed the language of this bill, and we believe that Section 1, which is now Part A of the bill, does not change the current practice in Maine, as the Maine Criminal Justice Academy already requires that each law enforcement agency have a civil rights officer. Our primary interest with this bill is in the now Part C, which seeks to provide the necessary funding to create an e-warning module that can be used in concert with the current e-citation module to provide our agency and many others the necessary tools to meet the requirements of last year's data collection bill, LD 132. It's now law under Title V, Section 337D. It's called profiling data collection. The Maine State Police are currently using an e-citation module to issue traffic summonses. This module, with additional programming, can be used to call out all of the necessary data elements required by Title V and 337D as it pertains to traffic stops that results with summons enforcement. It would also allow for the creation of a new e-warning module that will do the same for all of the traffic stops that don't result in summons enforcement. Currently, there's no way to collect information about a stop that only results in a traffic warning. The data collected with these two modules can be used to create and submit an annual report to the AG's office that meets all the requirements of Title V, Section 337D. Without this funding, we fear that we may not be able to easily, accurately, or succinctly collect and report the necessary information to the AG's office as required by this new law. In addition to the ability to seamlessly collect information about traffic stops conducted by the Maine State Police, this system can do the same for all agencies in Maine once it's created. This will help remove the obstacles and barriers that other agencies are experiencing in meeting the new requirements of this law. Approximately 35 of these agencies are also using the e-citation software and could seamlessly collect and report the same information as the Maine State Police. For the other 110 agencies, this may require them to manually collect and report the data to the Attorney General's office. Last year, we supported LD 132 with the understanding that the software and 2 positions in the Department of Public Safety would be required to carry out the new duties. However, when LD 132 was passed off the special appropriations table, the positions were stripped and only a portion of the cost of the new software was funded. This bill seeks to add the necessary funding to pay for the programming and reprogramming, but does not address the staffing issues that we will face trying to implement this program for all of the agencies that do choose to participate. These employees are an important part of ensuring that we can collect meaningful data in an organized way that will support the spirit of LD 132. In addition to working with other agencies to install this electronic solution, the e-citations and e-warning program, we also need to train each officer on how to use the system. We will need to maintain the server, troubleshoot issues as they arrive, update the system as needed, tabulate, and report to the AG's office at least annually. We'll also need to answer the many FOIA requests that will result with the expansion of this program. The Department of Public Safety and the Maine State Police are working at full capacity and do not have the ability to meet the shared goals of LD 132 without these additional specialized staff members. We believe that the only thing worse than no data is bad data. The Governor's Office, the Department of Public Safety, and the Maine State Police share the vision of fair, equitable, and impartial and professional policing in the state of Maine. And to that end, we hope this committee considers the additional funding required to staff our agency properly so that we can collect, analyze, and report this much needed data in a reliable and meaningful way. For these reasons, we urge you to vote in favor of LD 1999 and support fulfilling the funding efforts. On behalf of the Department of Public Safety and the Maine State Police, I thank you for your time, and I would be happy to try to answer any questions that you may have.
Any questions of Lieutenant? Representative Pickett.
Yes, thank you, Madam Chair. Thank you, Lieutenant, for being here and testifying. And so if I'm understanding you right, the real crux of this bill that really is of importance to making this do what we want it, what all of us want it to do, is the funding mechanism. Is that correct?
Representative Pickett, that is the most important and key piece of this bill on behalf of the Maine State Police and Department of Public Safety, is we believe that if we can properly fund our agency and this program, that we'll be able to collect the data that is absolutely necessary and essential to make sure that we provide fair, accurate, and reasonable data in a timely fashion back to the Attorney General's office. But we also believe in the mission and the goal of this bill. And we believe that the current ask that has been added to the bill is really something that's already being done. We believe that it's required as a Maine Criminal Justice Academy standard, and we believe those standards are enforceable. But they're enforceable in a different way than perhaps what Representative Talbot Ross would like to see, in the sense that compliance is guaranteed through Title 25, section 2806A, which basically is the place that we would go to decertify a police officer, to file a complaint against an officer or an agency if they don't meet any of the standards. So that's how we see this as already being enforceable, is if you don't meet the standard, and there's a complaint that's brought forward, there's a full board that works for the Maine Criminal Justice Academy, and they have the authority and the power to decertify law enforcement for noncompliance. So in practice, we don't believe that this is going to create a difference, but it does firm things up. It makes it very clear that there is a definition and a violation of law rather than a violation of a policy. So we do understand the goal and the mission. That was very recently added. I did get permission to say that we support the general concept of it, but that we didn't have time to fully vet the entire bill after it was written and received last night.
Okay, follow up, Madam Chair.
Yes, go right ahead.
Just have a couple of questions for you then, just to ease my mind that I am thinking properly, because if I'm not, then I stand to be corrected. Maybe this is the place to get me corrected. And that is, at the present time, all law enforcement agencies in the state of Maine have to have a civil rights officer on board, correct?
That's correct, Representative Pickett.
And secondly, in the state of Maine right now, is profiling on the books, and is it prohibited?
Profiling is prohibited because we're trained not to profile, and we have bias-based training. And so if you were to be accused of, and it was founded that a police officer was using bias-based profiling, then they would be decertified from the academy. But there isn't a specific statute that I'm aware of that spells that out.
And so the ultimate goal is, if we do have somebody profiling in this state and there's charges brought against them and they are found guilty of those charges, the academy has the right to take and decertify them, correct?
Yes, that is correct, sir.
Okay, thank you very much, sir.
You're welcome.
I will recognize next Representative Costain, Representative Morales, Representative Warren.
Thank you, Madam Chair. Lieutenant Scott, thank you for being here today. My question was, I wanted to back on, I think you said there was 110 agencies in the state that's not using the electronic ticketing system. Is that correct?
Yes, sir, that's correct.
So if we're looking for accurate information in reporting, do you feel that these 110 agencies need to come online with the same system to get accurate training, accurate reporting?
Representative Costain, we believe that if we build this system, we will encourage and entice far more agencies to join. But we don't believe that it's necessary that they all take this route. I think if they have a sufficient process in place where they're able to track this data and report it annually and not use this e-citation and e-warning module that we're going to use, we think that that's okay. We don't believe you have to force any agency to opt into it. However, of the agencies that we have right now participating, it equals about 1,000 police officers. And where there's only 2,500 in Maine, you're starting to capture a large number of the current police officers that are already using the e-citation system. If we build the e-warning module, we enhance it, and we use technology to leverage it enough to pull and call out this data that's required under LD 132 and report that annually, we think that it's going to create a simplified process for other agencies that right now aren't sure how they're going to accomplish this requirement. And they can opt on, and it would be free to them to use the system. There are some costs that we know that they have to absorb by way of hardware, but the software would be free, the certifications would be free, and we would essentially forge the way so that the other agencies that decided to opt on would be able to do so in a very easy, professional manner and collect the same data in the same way with the same training and resources that we have.
Great. Thank you, sir.
You're welcome, Representative Costain.
Representative Morales.
Thank you, Madam Chair. I just want to say before I address Lieutenant Scott that Representative Costain, I think you have the best background. I love it. It's beautiful. Lieutenant Scott, I just wanted to clarify about the profiling laws, because what I heard you say was that it's in policy and therefore law enforcement if they are found by the Criminal Justice Academy to have profiled, they could lose their certification. However, there's no remedy for a person who has been profiled. Is that accurate to say?
No, I don't believe that that's accurate. I don't think I spoke on that. The Maine Attorney General's office is responsible to review and receive any complaints for civil rights violations, and that would clearly be a civil rights violation. So I'm not an expert in how they would investigate that, but when a police officer, when a police officer believes there's a civil rights violation, they have somebody that works within their department that serves as a civil rights officer, report that information to the AG's office, and the AG's office is then responsible for the prosecution of that as a hate or bias crime. So there is a remedy for the individual as well.
But that wouldn't be under state statute because we don't have a specific state statute that says that profiling is prohibited.
So
is what I heard you say.
Yeah, and there isn't a specific statute that I'm aware of that makes it unlawful to profile. It's the policy at the academy that we're required to follow, and if we don't follow, can be decertified. So yeah, hopefully that's clear enough.
Right, and so you wouldn't oppose putting it in statute to make it clear, as far as how I'm understanding your testimony. Is that right?
Yeah, Representative Morales, while we didn't get a chance to fully vet it, we did discuss it. I pushed it up my chain last night as far as to the commissioner's office, and we felt comfortable with the new language of this bill and didn't take an issue with it because we do believe that it is current practice, and we don't think that it's going to require any additional lift on us, but it certainly would clarify things in statute for anybody who wasn't 100% sure that it exists through that policy rule process.
Oh, that's great. Thank you so much.
You're welcome.
Representative Warren, in 1 second, let me bring in Whitney Parrish, Mary Bernardo, and Jan Collins, please. Go right ahead, Representative Warren.
Thank you, Madam Chair. Thank you, Lieutenant Scott, for being here. I'm not going to ask you anything about kites or Timothy McVeigh today, I promise. But what I do want to ask you is, how do you know who the civil rights officers are in the individual departments?
Representative Warren, that's a great question. We have been told, and I believe that the Attorney General's office maintains a list of all of the civil rights officers for each agency, but I would prefer that question be asked to them, where I believe they're the ones that actually maintain it.
Thank you. And just a quick follow-up, what I heard you say was that you all, it sounds like you're in support of the whole bill. I understand you have the chain, you have to run it up the chain. I heard all of that.
Correct.
But it sounds like you, as much as you guys have vetted the bill, you're in support of the bill.
We are. We agree with the philosophy and we support the intent behind it.
Thank you very much, Lieutenant. Thanks for being here.
You're welcome.
Senator DeChambeau, I just wanted to let you know that Senator Hickman has also joined us.
Yes, I know. He was next. I just want to ask a question of Representative Talbot Ross. I thought I saw you somewhat shake your head when the question was asked of Lieutenant Scott, or I think it was Representative Pickett asked the question, if every agency or department has one or is required. Did you want to?
Madam Chair, could we do that? Could we do that at the work session? Because now you're asking the representative to speak for the 4th time. Maybe we could do that at the work session.
Well, I'd like to know the answer.
Okay, sure.
Thank you, Senator.
If it's a long one, it's a yes or no answer, really. That's.
Thank you, Senator. I have always heard and understood that there are designated civil rights officers in our law enforcement agencies in the state. Yet I dare anyone to find a list that's available to the public so that they know who to go to file this complaint. And I dare say that no member of the public knows how to file the complaint. So if they exist, show me the list, because it's not on the Attorney General's website or any of the law enforcement websites currently up and running. You can't find out who the civil rights officer is without doing a pretty deep dive.
I think we settled that the last discussion, and I'm glad you answered that. I would have forgotten at the work session, so thank you. All right, so yes, I saw Senator Hickman. welcome. My neighbor across the hall, go ahead.
Thank you, Senator DeShambo. I appreciate the opportunity to provide brief testimony. I wasn't intending to testify, but I did want to provide some information in response to the Office of the Secretary of State's testimony and also to what I just heard from Lieutenant Scott. My name is Craig Hickman. I represent Senate District 14, 11 towns in Southern Kennebec County. Senator DeShambo, Representative Warren, and distinguished members of the Joint Standing Committee on Criminal Justice and Public Safety. A few terms ago, I introduced LD 1475 to the Judiciary Committee that contained some of the provisions of this bill in front of you. And so I am testifying in favor of this bill as amended because it takes that work and moves it forward. The definition of law enforcement officer in the original bill reads as follows, and I would humbly suggest that you consider using this definition in place of the one in the amendment because it addresses the Office of the Secretary of State's concerns. In the original bill, law enforcement officer is defined, means a state, county, or municipal official, or an official of an Indian tribe responsible for enforcing criminal immigration or custom laws, including but not limited to a law enforcement officer who possesses a current and valid certificate issued by the Board of Trustees of the Maine Criminal Justice Academy pursuant to Title 25, Section 2803A. That's the most comprehensive definition of law enforcement officer proposed for state statute. On the question of why this needs to be put into this part of statute, which was the original proposal, is precisely because what Representative Morales alluded to or even said explicitly, and that is by placing a definition of profiling in the statute governed by the Maine Human Rights Act, you define profiling to mean the discriminatory practice of a law enforcement officer or agency relying to any degree on actual or perceived race, gender, ethnicity, religion, social and economic status, ancestry, or national origin, and it goes on as in the amendment. And what that means is you're placing it in the part of law that protects human rights. And when you prohibit it there, you strengthen the part of law that protects human rights. I don't believe that anyone in this committee would oppose strengthening a part of law that protects human rights. And so I urge the committee to understand that there is a distinction with a really big difference here. A law enforcement officer, as the lieutenant has testified, can be decertified. But now, under state law, the Office of the Attorney General has more tools to provide relief to an individual whose life has been ruined because their human rights have been violated. And that is my testimony, Madam Chair, and I'm willing to answer any questions if you have them.
Thank you. I have Senator Sarway with his hand up. He may have a question.
Thank you, Madam Chair. Senator Hickman, thank you for bringing that up because I kind of wondered why this got changed. So I think that you're right. I think that should be the way it is because right now it's being practiced that way. So why wouldn't we want to have it the way it is in statute? So I agree with you 100%, but I don't know why it got changed. I don't know. What's your thoughts on that?
It didn't really get changed. And thank you, Senator Stillway, for the question and for stating out loud that you fundamentally believe we should do all that we can to protect human rights in statute and make it clear as possible so there is no confusion. It didn't really get changed in so much as it didn't get passed. And so what got passed instead was exactly what is currently in Title 25, which is the policy for training against hate and bias crimes including training around what profiling is and how it should not be done, is what got passed. And so, as I said earlier, this just moves that work forward. And in some sense, we're going back in order to go forward, because now it becomes clear, and even clearer to the department, that it's time to put this part into statute and pass it. And we just weren't ready to do that last time. And that's okay, because the arc of the moral universe is long, but it bends toward justice.
Yeah, and I think that it just, if it matches what's already in there, that's the key. And I think that way it helps our funding as well. So thanks.
The funding is absolutely required. So Senator Silway, I appreciate the fact that we can agree on this publicly. Thank you, sir.
That will last a day and a half. Okay.
Bit of time. We do carry on in the Senate. Yes, we do.
I sit between you guys. So Whitney Parrish, if we're all done with Senator Hickman, I presume. Okay.
Thank you for
Madam
allowing
Chair.
me the opportunity to testify today. Thank you.
Excuse me, Madam Chair.
Yes.
Michael Cabetta has been waiting. He's been in the room for a
Did
while.
I? Probably okay, Michael. Sorry, Whitney. Let's not. Mr. Cabetta,
He testified.
don't leave me, Mr. Cabetta. Come back here. I did call for Mary Bonato and she's still in the attendee.
I've
Madam
tried to
Chair,
bring
if-
her
if-
over. She may have stepped away from her desk.
Okay.
Madam Chair, if I will, I think Michael Cabetta did testify, because I thought I heard him testify. He didn't
Yes.
testify on this bill? He
It
did
was
testify.
another bill, I thought.
No, it was this
Well,
one.
he's been with us a couple of times, so,
He
all
testified on
right.
this bill.
He knows how much, okay.
Anyway, thank you.
He did testify, you're right. I remember his testimony. Okay, Whitney. You know, come on, guys, it's
been a long day.
4:35. We've got more. We're just a little punchy. So Whitney, go ahead.
Thank you, Madam Chair, Senator DeChambeau, Representative Warren, and honorable members of the Joint Standing Committee on Criminal Justice and Public Safety. My name is Whitney Parrish. I live in Augusta, and I'm the Acting Executive Director of the Permanent Commission on the Status of Racial, Indigenous, and Tribal Populations. It is our deep honor to deliver testimony in support of the amended version of LD 1999. And we do extend deep gratitude to Representative Rachel Talbot Ross for introducing this bill and her lifelong dedication to this issue. Most of us, no matter our color or who we are, want this to be a place where freedom and safety are for everyone. Maine people deserve true justice, a government that cares for us, funds our futures, and realizes our dream of a place where freedom and safety is for all, no exceptions. As you've heard, it is past time to define and prohibit racial and other bias-based profiling in Maine, which LD 1999 would accomplish. To that end, we believe the community, your constituents, must inform the steps we take toward equitable practices that keep all of us safe. It is of utmost importance for communities we belong to and represent, and our experiences to inform the work we do. While quantitative data is of utmost importance when we examine these issues, we know qualitative data must be centered as well. From the Permanent Commission's first annual public hearing in December, one comment in particular illustrates the impact of racial profiling in Maine. We've de-identified this individual, though they live in Saginaw County. Quote, racial profiling continues to be a concern, especially for me as a mother of 4 young men. It is sad that it is my job as a mother to teach my boys how to de-escalate a police officer because I want them to come home safely. Several times my sons have been pulled over or selected from a crowd because of their car or appearance. One son was asked what drugs he sold because his car was too clean, and my other son was slammed to the ground because the officer assumed he was part of a bar fight, even though he was standing on the outskirts of the crowd. My last example, my son was approached because he was sitting too long in a gas station parking lot, end quote. We know incidents like this are not isolated, and no parent, no child, no Mainer
should live in fear of their safety because of the color of their skin or what someone suspects they may do because of it. We must uphold our values as a welcoming, safe state for all. And to this end, we consider the provisions within LD 1999 that require law enforcement agencies to designate and train civil rights officers critical as well. As the sponsor states, it is not enough to just have a policy. We must codify protections and recourse for civil rights violations in Maine law. As well, the Permanent Commission is charged with examining racial disparities in Maine. Hold on, honey. Disparities that ultimately hurt each one of us. The absence of critical quantitative data on arrests and other interactions with law enforcement, especially as the data relate to race and gender, and I see my time is up, is a barrier to this work and the work of ensuring public safety generally. We encourage this committee to invest in the tools needed to gain a complete view of the scope of this issue. As you've heard, we cannot manage what we do not measure. So we respectfully urge you to support and pass LD 1999 as amended. We have the power to rewrite the rules to make a place where all of our children have the chance to grow up and all of our people have the chance to grow old. Thank you for your time and consideration.
Thank you. Any questions, Ms. Parrish? Seeing none, thank you.
Thank you.
Mary Bernardo?
Good afternoon, Senator Deschambault, Representative Warren, and distinguished members of the committee. Mary Bernardo, attorney at GLBTQ Legal Advocates and Defenders, and I'm here on behalf of Maine Equal Justice, Maine People's Alliance, Quality Maine, and my own organization. I really deeply appreciate Rachel Talbot Ross and her long leadership, including on this bill. I've submitted written testimony. It's very brief, but I definitely have some things to add based on the comments that I've heard so far. Just first and fundamentally, you know, we all come before our government as equals, no matter who we are, and no one wants to be targeted by law enforcement or anyone else because of who they are, what they look like, the signals of their faith, their means or lack thereof. So that's all common sense. I do want to say with respect to the enumeration provision in the bill, that includes gender. I would like to follow up in writing about this if it would be permissible with the committee to explain that there is a Supreme Court decision that makes it very clear that sex is inclusive of sexual orientation and gender identity. Having said that, and gender is included in the bill, but having said that, if there were a way to find a way to be explicit, because this whole bill is about being explicit, about not allowing profiling, that would be very agreeable and something that I would be willing to assist on. I also want to say, like, I am incredibly gratified and support and appreciative of law enforcement who for years have been saying that they support this bill and that they are here to support it today along with the funding. And of course, there are many reasons to do so, including the fact that it helps to really increase, when there isn't profiling, it helps to increase the perception of respect and legitimacy and support for law enforcement and supports public safety. The other thing that I just wanted to say in my brief time is that there are a whole set of constitutional provisions that apply here, particularly around selective enforcement. So the idea that you have a facial law, but it's being applied differently to different people. There are many courts out there that have been describing this situation nationally as toxic. And I've provided a site in that about all of that. And more courts are looking to ways to allow people to challenge evidence gained because they have been profiled. So that to me is another whole reason why this bill is helpful, prophylactic, put it down in writing so that everybody's expectations are really clear and this just doesn't become a matter of discipline at the discipline or decertification at the academy. Clearly, the Maine Civil Rights Act is a perfect vehicle for doing this, for defining, prohibiting profiling. This is a defining civil rights issue of our times, and certainly will help increase public safety and make sense for all of us. Thank you very much.
Thank you, Ms. O'Donnell. Any questions? No hands raised. Thank you again. And now I'll recognize Jan Collins.
Greetings, Senator DeChambeau, Representative Warren, and honorable members of the Criminal Justice and Public Safety. And my thanks to Representative Talbot Ross for presenting this bill. My name is Jan Collins. I am Assistant Director of Maine Prisoner Advocacy Coalition, and I'm here to support LD 1999. MPAC's mission is to support Maine's incarcerated citizens, their families, and friends, and our purpose is to reduce Maine's use of incarceration by creating a criminal justice system that is ethical, humane, and restorative in nature. A few years back, I met a friend, a nurse with a master's degree, at an art museum in Portland to spend the afternoon in the big city getting some culture. In the gallery, we moved from room to room, sometimes halting to look more closely or comment on a particularly striking piece. At one point, a guard asked us to step back from a painting as he felt we were too close. We apologized and moved on. As we entered the next room, the guard also appeared in that room. I thought perhaps he was giving the guard in that room a break, but when we moved to the next room, he appeared there as well, and the same in each subsequent room. It became obvious that we were being watched. When we exited the building, I turned to my friend and commented that I felt like we were being followed. That had never happened to me before. Had it happened to him? His answer was striking. Yes, it happens all the time. That was my first experience with profiling. I've been in many museums since then and have even been admonished not to stand too close to a painting, but I never again had a guard follow me from room to room. My experience was unpleasant. It was uncomfortable, but it had no lasting consequence. We know, however, that this is not true for people of color. This bill is important because it explicitly prohibits racial profiling and requires law enforcement agencies to select, assign, and secure training for a civil rights officer. The first step in ending bias is to recognize that it exists. The Maine Statistical Center released reports on juvenile disproportionate minority contact in the first, through 2010 through 2015. I believe it was a federal grant that supported that. The data shows that at every step of the criminal justice system, policing, arrests, detentions, and commitments, minorities are disproportionately affected. And I do have links to that data in my written report, along with a graph that shows the disproportionate breakdown of residents in Maine's correctional system. Although the adult system in Maine has not been studied with the same detail, it would seem likely that the results can be extrapolated because of what we see in the graph, indicating the racial disparities in Maine's two largest prisons as compared to the state's general population. Even within prisons and jails in Maine, there's a disparity in the percentages of minorities who experience its harshest practices. Having a
Could we
designated—
start wrapping it up, Ms. Collins?
One more sentence, thank you. Having a designated and trained civil rights officer in each law enforcement agency is an indication of our commitment to equality under the law and the US and Maine constitutions. Please vote ought to pass for LD 1999, and I thank you for your time and commitment and being here so late. Thank you.
Thank you. Any questions of Ms. Collins? Seeing none, again, thank you for coming.
Thank you.
Will bring Quinn Gormley in. Thank you. Hello, Quinn.
Good afternoon, Madam Chair. Are we good to go?
Yes, you could go.
Wonderful. Sorry. Senator Deschambault, Representative Warren, and honorable members of the Criminal Justice and Public Safety Committee. My name is Quinn Gormley, and I'm here on behalf of the Maine Transgender Network to testify in favor of the amended version of LD 1999, an act to require civil rights officers at law enforcement agencies. We would like to extend our gratitude to Representative Talbot Ross for bringing this important bill to the attention of the legislature. Mainers pride ourselves in fairness and treating people as individuals. We don't believe in prejudging people based on arbitrary attributes of who they are. The use of race or gender to profile a person by law enforcement runs counter to these values. Our law should reflect our values as Maine people. Mainers don't believe in discrimination. Our law shouldn't either. Transgender and gender diverse Mainers already face a variety of barriers in accessing the support of law enforcement, and often report being afraid of interacting with law enforcement due to a fear of discrimination and bias. This fear is well-founded. According to data from the 2021 Maine Transgender Community Survey, 22% of transgender Mainers who have had interactions with law enforcement have experienced discrimination or harassment during the interaction. Additionally, transgender people nationally, particularly transgender women of color, experience frequent profiling from law enforcement that assumes they are participants in sex trades, especially street work, that reflects stereotypes about this population created by popular mass media that is often the only reference point that law enforcement may have for our community. Profiling based on real or perceived parts of an individual's identity is inefficient. It makes us all unsafe. Focusing on an individual's skin color and gender expression, for example, but not on their behavior, can leave the use of law enforcement's already limited resources open to misuse based on the bias of individual officers. We encourage you to pass this bill as amended, and thank you very much.
Thank you, Quinn. Any questions of Quinn? Thank you for coming today. Thank you.
Thank you.
That was in support of LD 1999. I'll ask if there's anyone who wishes to speak in opposition to this bill. See no hands up. Anyone wishing to testify neither for nor against? No hands, therefore I will close LD 1999. We will now change gears a little. We will enter work sessions. And again, work sessions is not for testimony unless you are asked to come in and provide some information. And so let me see. I'm wrong. I think I'm correct. We are into 1552, an act to provide re-entry services to persons re-entering the community after incarceration. The sponsor is Representative Rachel Talbot Boss, and I will recognize our policy analysts. And is it Miss Overton or Dan? Dan.
This one's me.
Okay. So Dan Tadikoff, our analyst, will give us a review of what we heard in the public hearing. Thank you. Go ahead.
So LD 1552 is Representative Talbot Ross's bill that was originally titled about reentry services. At the hearing, the sponsor presented an amendment that replaces the bill with a slightly different proposal. The amendment dated 2/17 changes the title of the bill to an act concerning violations of conditions of release under the Maine Bail Code and replaces the bill. Under the current Maine Bail Code, a defendant who has been granted pre-conviction or post-conviction bail and who violates any condition of release is guilty of the Class E crime of violation of a condition of release, I'll call VCR. The sponsor's amendment provides that such a defendant is guilty of the Class E crime of VCR only if the condition of release violated required the defendant to either avoid all contact with the victim of the alleged crime, a potential witness regarding the alleged crime, or with any other family or household members of the victim or the defendant, or to contact those individuals only at certain times or under certain conditions, to refrain from possessing a firearm or other dangerous weapon, to enter and remain in a long-term residential facility for the treatment of substance use disorder, or to return to custody for specified hours following release for employment, schooling, or other limited purposes. I have noted in the analysis those that testified on the bill, and I've tried to note it where testimony was submitted on the original bill versus on the amendment. A couple notes here. For testimony received by the committee, only a few states, it was noted, NCSL indicated there are 7 total states, including Maine, that designate a VCR as a separate crime aside from the underlying crime for which a person is on bail. Per testimony received by the committee, VCR is not uncommonly charged as a crime in Maine on persons who violate a condition of release. The sponsor provided information from the Council of State Governments showing that from FY 2016 to 2019, there were on average more than 3,000 VCR case filings in Maine each year. From information provided at the hearing by Maine Pretrial Services, in 2020, they served a little over 3,000 individuals on pre and post conviction release. They observed or had probable cause to believe that violations of release conditions occurred, resulting in a return to custody for 337 of those individuals, or about 11%. And I've noted here that there were 2 related bills considered by the Judiciary Committee last year that included changes to the Maine Bail Code, and just noted that they may be of interest as the committee considers the proposed amendment to this bill. And I did send out a packet that included the original bills and majority reports, and in the case of LD 1134, a veto letter from the governor. The LD 844, the majority report deleted from the Maine Bail Code a number of specific conditions of release that may be imposed by a judicial officer. That is currently on the table. LD 1134, the majority report amended the crime VCR to remove the Class C elevated VCR and also amended the conditions that constitute a Class E VCR. And it also enacted a new crime VCR for certain crimes, a Class E crime, under circumstances where a defendant charged with certain specified crimes while on pre-conviction bail violated a condition of release. I'm happy to go into more detail on any of that. And I also sent out again a copy of the sponsor's amendment.
Mr. Tadikoff, what you just listed, I read that, and that was included where, if I may ask, the CLAC or the bills, I should say. Was that attached to an amendment?
The 2 other bills from Judiciary from last session?
Yes.
Is that what you're asking?
Yeah.
Yeah, I sent out here.
To his analysis.
It was a separate attachment.
Thank you. Any questions of Mr. Tadikoff? Of clarification, Representative Warren?
Thank you, Madam Chair. I make a motion ought to pass as amended.
I second.
It's been moved by Representative Warren, seconded by Representative Morales. Discussion on the motion? And I see Senator Seaway.
Thank you, Madam Chair. This is a new amendment. And the Maine Sheriff's Association would like to speak on this amendment before we go and pass it. Could we have Sheriff Kane come on?
Excuse me, Senator, this amendment was given to us at the public hearing, and the sheriffs did testify at the public hearing.
Right.
So this is not a new amendment.
Could we have him come on because he'd like to speak on it?
I was advised that Sheriff Kane wanted to speak because he didn't see the last amendment.
Right.
This is the amendment from February 17th.
I'm just checking with if that's what Sheriff Kane was saying. So, and I forgive me, I have to defer to all of you, any of you. Representative Warren said that the Maine Sheriff's Association did testify. You have that, Mr. Tadikoff, that they did testify? I'm just double checking.
They've testified on most bills, but I didn't, unless I can check again, I did not see testimony from them on this bill.
Senator Senator Searway asked Scott Nichols to come in during the first work session that we had, and we had a conversation on VCR that day. So if you want to bring in folks and we'll do another public hearing, why not?
This is just clarification. I'm a little
okay. I'm
That's all I wanted.
suggesting that we vote the bill. I know Senator Searway would like to bring in the sheriffs, and there's probably some other folks he'd like to bring in. I would like us to vote the bill, but you're chairing, and I guess that's your decision.
I would just say that we have had in other hearings, in other work sessions, we've had people brought in from different people.
Sure, let's bring them
both
in.
the aisle. So why don't we just show the same courtesy to both sides?
I do see Sheriff Kane. Sheriff Kane, if you wish to make a statement, comment, or questions, please, we'll let you in. Do you have your hand raised? I see your name if you're here, because we're not waiting too much longer. I believe he's coming in. Sheriff Kane, are you familiar with this bill and the latest amendment? Is that something you wanted to mention?
With all due respect, Senator Seaway, I don't remember asking to come in on this, but thank you for the opportunity. I know Sheriff Nichols did testify this for MSA, and I'm really not as prepared as I would be to follow up on what he said. But changing bail conditions, which is to ensure people will show up in court and abide by the rules and regulations and the laws that we have out there. So by the way I am reading this, and again, there was what I struggle with is we get an initial bill with a title, and then all of a sudden it's completely changed, all new verbiage, all new, in many situations, intentions, and trying to sort out where it is. So I think that bail is very important. For example, let's look at a drug case. Someone is arrested for trafficking in drugs. They're released on bail, and one of their bail conditions is they not possess, use, traffic drugs. So the way I read this bill, it would not be possible to do a bail check on that person. So that person would have carte blanche to continue the operation of selling drugs. So to take that away from, law enforcement is very, very difficult.
Thank you.
Madam Chair, excuse me for a second. Senator Searway, I want to be very clear, and I don't want to embarrass anyone. Do not, again, please tell us that somebody is in the waiting room and wants to come in when they have not said that they want to come in. This is not the first time it's happened. He has not even read the bill because he wasn't planning to be here. Excuse me, Senator DeChambeau. Excuse me, Senator DeChambeau. I am a co-chair of yours.
I know.
It's unfair.
You may.
When you're ready, this is unfair to, Madam Chair, I will say one more thing. I am your co-chair and I will speak.
And you are putting down a colleague on mic. You can continue your conversation.
We can do this for like 3 hours because I will keep, I have a right to apologize to Sheriff Kane for being brought in. It's not fair when you are here to do a job. Excuse me, Senator DeChambeau.
Mr. Tadikoff, you had your hand up after Sheriff Kane spoke. To clarify something, I believe.
Do you want me to speak now?
Yes, please.
So, well, I think this came up during the hearing as well, and the DA weighed in on this, that this is the crime of a violation of condition of release. So it allows for a new crime to be charged upon a violation of a condition of release. It doesn't change the ability for bail to be revoked or for a person to be arrested on the commission of new criminal conduct. This just limits the number of violations that are, the number of conditions of releases that can constitute a new crime of violation of a condition of release. I don't know if that helps.
All right, there is a motion on the floor. It's been, I have Representative Renecki. You have a comment, please?
Yes, ma'am. Thank you. I just want to say that this has been the norm. It seems like this year that we are getting bills and then they're being changed after the fact, and their titles are being changed. Everything's happening after the fact, and this has become the norm. And so I'm voting against this bill based on that reasoning.
Okay.
This amendment is from February 17th. This amendment is the one from February 17th. And I would like to say again, let's not call people in when they haven't had a chance to read the bill. It's embarrassing for them. And I would prefer that we didn't do that in the future. I would be mortified if I was called in and I hadn't had a chance to read a bill. It's embarrassing. But this is an amendment from February 17th. Thank you.
It's been moved.
Madam Chair,
You,
I call for a 5-minute break. Shelley, you want to send me a link, please?
we all back? Right? Good. So where is Representative Pickett? Representative Pickett, you're all set. We have a motion on the floor. If no one has any questions about the motion, we can proceed with a vote. Representative Pickett, you have a question?
Yes, I do. I'm looking at the bill and the way it's written, and I just wondered if our analyst can fill in the blanks. Maybe you can, maybe you can't, but it looks as though the bill is on, as we realize the bill is on the current Maine bail code and about a violation of condition of releases. And it names specifically those 4 bills, but does anyone know what the other, where it says, if the condition of release violated requires the defendant to, so that tells me there must be some other conditions that they could be violated of that we're not addressing here, because up top, it says the way the sentence reads, it says under the current Maine bail code, a defendant who has been granted pre-conviction or post-conviction bail and who violates any, the key word being any condition of release is guilty of the Class E crime of violation of a condition of release. The sponsor's amendment provides that such a defendant is guilty of the Class E crime of violation of condition of release only if the condition of release violated required the defendant to, and it lists those 4. So saying any and then saying only tells me there are some eliminated there. Do we know what those other conditions are that are being removed from that would no longer be a violation? If the analyst knows that.
Sure. So that none of the conditions that are allowable under the existing law are being eliminated. That is a proposal that is in 844 that I referenced, that's on the table right now, that would actually eliminate some allowable conditions. But you're correct, it references only 4 conditions out of a number of conditions that can be imposed. So
what class would they be then? What would be, if we're only saying these 4 are Class E crime? So what would be the if we're not eliminating the others, then what would be the class of the crime that those are?
A violation of those conditions of release could not constitute the basis for charging a Class E VCR. They could constitute the basis. Sorry,
unless
they
it was
could.
Those 4, correct?
Yes, and so here, real quickly, this is Section 1026, standards for release for crime bailable as of right pre-conviction. Oops, I'm one past it. Release on conditions. Down here, there are all of these subparagraphs that allow a judicial officer or a bail officer to impose a number of conditions. So, for example, a condition of maintaining or commencing an educational program. Under the current law, if that was a condition of release and you did not maintain or commence an educational program, you could be charged with a Class E crime, violation of condition of release, for violating that condition. Under the amendment, that's removed. So if you violated that condition of release, you could not be charged with a new crime. You could, however, have your bail revoked, be returned to custody, you could be arrested, you could have to forfeit any sort of bail bond that you put up to obtain your release. So that's the distinction there. It's a pretty long list of conditions that can be placed. They don't have to all be placed. That's up to the discretion of the judicial officer.
Okay, thank you very much, Dan. Appreciate it.
Yep.
All right. So the motion is ought to pass, and we will have a roll call vote.
The motion ought to pass as amended. Motion by Representative Warren, second by Representative Morales. Representative Warren.
Yes.
Representative Warren votes yes. Representative Morales.
Yes.
Representative Morales votes yes. Representative Rackett is Representative Rackett, there you are.
Representative, you're on mute.
I just need to look quickly. So circle back to me if you would.
Certainly. Representative Sharp is absent. Representative Lookner.
Yes.
Representative Lookner votes yes. Representative Pickett.
No.
Representative Pickett votes no. Representative Costain.
No.
Representative Costain votes no. Representative Rudnicki.
No.
Representative Rudnicki votes no. Representative Newman.
No.
Representative Newman votes no. Representative Pluker.
Yes.
Representative Pluker votes yes. Senator Lawrence is absent. Senator Searway.
No.
Senator Searway votes no. Senator DeChambeau.
No.
Senator DeChambeau votes no. And I'll circle back to Representative Rackett.
Yes.
Representative Rackett votes yes. That's 5 yes and 6 no, and 2 absent.
Absent is who, Lawrence?
Representative Sharp and Senator Lawrence are absent.
Is Representative Sharp still a member of this committee officially? I don't know. I'll have to ask. Okay, thank you.
Senator,
Yes?
he was temporarily replaced with Representative Talbot Ross for 1 day. The appointment
So that
letter
was it?
rescinded it at the end of the day. Yeah, so he's been back on since then.
All right, thank you. I have just one thing. All right. Representative Rudnicki, you have your hand up.
Yes, thank you, Madam Chair. I would like to just do a point of clarification if I could. I actually received a text message from Mary Ann Lamar, and I'd like to just kind of read a couple of this text message so that the committee knows. She said, "We did not get the amendment on 217. It was presented 2.5 hours before the hearing. We didn't testify. We were hoping to express concerns in work session since we were unable to do so in the public hearing. The amendment was dated 217. It was not posted until 2.5 hours prior to the public hearing. The original bill was about reentry. This bill changes bail conditions, 2 different topics.
Okay, Representative Rudnicki, that's something we could, you know.
This is unbelievable.
Thank you.
That's unbelievable behavior by the Sheriff's Association. The sheriff came on the screen and said, "I did not ask to speak." So could we please, it's an unfortunate instance, could we put it behind us and move on? This is not 7th grade. This is the legislature.
Wait a minute,
I know you're
thank
going to
you.
take offense, but I get to talk.
No.
Because I'm also a co-chair.
Yes.
Why don't we move on to our final bill of the day? And we did hear the text message from Mary Ann Lamar. Thank you, Representative Rudnicki, for sharing that text message. Could we move on to the next bill? It's now 5:30 on Friday. Thank you.
Okay. I know people are very emotional about that, and then, for us, worst word to use. Yes, let's move on, please. I know we want to have last words. And we have now a very important bill. They all are. 1862, and this is a work session, so I will turn it over to Dan Tadikoff, our policy. No, is it you, Jane? Or...
It's me.
Oh, wow, welcome. All right.
Thank you. Is the sponsor here on this bill? This is Senator Maxman's bill.
Yes.
Amending the Good
Would
Samaritan
you bring
law.
her in, of course?
Yes, one moment.
Yeah.
All set?
Yeah.
Okay. This is LD 1862. It amends the current Good Samaritan law. And you worked this in mid-February. And Senator Maxman requested some time to work on some changes in the amendment. I know she has been working with people. I would just bring to your attention, there were sort of maybe 3 real issues on this bill. The question of who is protected by the Good Samaritan law, the question of what they are protected from, and the process for protection. So I think I'll stop there and let Senator Maxman take you through her amendment.
Thank you so much, Jane, and good evening, everyone. I know you've had a really long day.
May I ask you, Senator, are we talking amendment that's dated 2/15 or one later than that?
It's February 25th. Jane sent it out this week.
Jane, are you going to be able to screen share that for members?
I think Deb has it all ready for us.
Great, thank you.
Great, good idea. Thank you. Yeah, I'm sorry I interrupted Ms. Maxim. Go right ahead. Well, if you want to wait till it's up there or make a comment or a statement, go right ahead.
Just a sec, I just found it.
Ms. Maxim, you can decide, do you want to speak and wait till it's up there or either way?
I can speak.
There you go.
Perfect. Thank you, Madam Chair. A little bit of context, after the last work session, I did go back and review amendments from the Commissioner and the Attorney General, and I also talked with all of the advocates and organizations with direct on-the-ground experience, and there was a very clear call to go forward with this amendment that I'm presenting you today, which makes it as clear as possible who is included and who is excluded. Just reiterating some of my points from before, that a lot of the confusion and the reason why the current law isn't working is because people don't know what crimes are included and what crimes are excluded. So we can add in rendering aid, and that's important, but not really getting to the heart of why the current law isn't working. So what this amendment does is it's kind of cleaning up a few points. There was some unintentional omissions in my previous amendment around, for example, endangering the welfare of a child was not included in the exclusions, and that was not intended. So I've worked with Jane and Clack to really make sure that all violent crimes, all crimes against children, all sexual crimes, all attempts at those crimes, and solicitation and anything related to those crimes are excluded from protection. So that's what you'll see in section 1A is all of the excluded crimes. The rest of the bill is essentially the same, saying that if you are not in an excluded crime, then you are protected when for the duration that from the time we call 911 to the time that medical services leave when there is an overdose. So it's a protected amount of time. I can stop there. I don't know if folks have read it or not, but it's pretty clear after that.
Anybody have any questions of the sponsor? Seeing none. Oh, Representative Pickett.
Thank you, Madam Chair. No, I don't have any questions of the sponsor, but I would like to call in the Commissioner Sawchuk to give his thoughts on the sponsor's amendment, and if he has anything to add to what he would like to see happen with the bill.
Yes, I see him. Commissioner Sawchuk. Good
Good evening,
afternoon.
Madam Chair.
Good evening. Oh, good evening. Yeah, good evening, not good afternoon.
Yes, good evening. Don't want to depress anybody by using evening instead of afternoon, but it is good to see everybody. I know it's been a crazy day for everybody. I would just say that I appreciated Senator Maxim taking a 6 p.m. phone call after a long day in session to discuss her amendments and mine. And I think at the end of that, I think from Maine chiefs, Maine sheriffs, Maine prosecutors, and the Department of Public Safety, we're comfortable with the amendment that we had proposed. We do appreciate everybody's conversation and their lived experience. When we looked at, I think Jane did a great job, the who, the from, and the process. After the initial public hearing, we expanded that who out to include rendering aid. And we thought that was a good idea. We thought that definitely strengthens the statute. We're still concerned with the everybody at the location language. And then the from component, I'm not able to go out beyond the crimes that were currently listed in the current statute. And then the process is very similar in the sense that we wanted to add in that affirmative defense language. So we did provide movement on 2 of those 3 primary issues or concerns because we listened in that initial public hearing and we appreciate everybody's feedback. So I stand by our initial amendment and appreciate everybody's time and energy.
Okay. That answer your question, Representative Pickett? You have a follow-up? A question of him?
No, I'm all set with the commissioner.
Okay.
I have a question.
Yes, I just wanted to finish to make sure, so you're all set.
Yep.
Representative Warren, you had your hand up, you brought it down. Okay. So Representative Morales?
Thank you, Madam Chair. Thank you, Commissioner. I looked at your amendment, Commissioner, and I'm reviewing it with the amendment brought by the sponsor. And the piece that really concerns me, because I know we all know that with this legislation, we are focusing on saving lives and we're taking a public health approach while also balancing public safety and making sure that those who are a threat to public safety are not covered here. And I think I really commend the sponsor for doing that work to be so clear. And the problem that I have with your amendment is that with this affirmative defense piece, I don't think people will make that phone call because what we know about our criminal legal system in the defense of indigent criminals, which I think we can assume that everyone who would be potentially thinking about making a phone call in these situations are indigent, would be indigent. That to have to then go through the process of being prosecuted, going into court, and making that defense, I don't think we would arrive at the place that we want to be at to save the 2 people a day who are dying from overdose. So I did like the idea about rendering aid. And so I'm just wondering, Commissioner, if you would be willing, just having heard me say that, and I know this is probably something you've thought about as well, would you consider supporting the bill as the sponsor has brought forward, potentially talking about adding that rendering aid piece, but taking out that affirmative defense piece, knowing what we know about our criminal legal system right now?
I'm a little confused, Representative. So there's, in Senator Maxim's bill, there is an affirmative defense component. And then in the amendment that I proposed, there's an affirmative defense proponent, or a component rather, and it's a pre-trial hearing. It's not you go to jail and then, or you go to jail and then you wait for that. It's pre-trial that you have an opportunity to bring that up. That's how it's been explained to me by attorneys that helped draft this. Hopefully I don't have that wrong in my mind. And you say supporting, there's 3 different legs to this. There's like a great expansion of the number of crimes that were also under that immunity umbrella. So I don't think this language and this language alone would solve that problem in my mind. So I apologize.
Well, maybe I'm confused about that. I'd like to ask the sponsor then, and thank you for that, Commissioner, about the affirmative defense piece. Is that a part of the amendment that we're looking at right now?
Not in so many words. We have the motion to determine immunity so that it is pretrial, so that if someone is arrested, that they don't have to go through a whole trial to see if they should have been arrested or not, but it's determined at the beginning. But I don't know if Jane might be able to better answer that question for you, Representative.
Well, in the amendment proposed by the Department of Public Safety, in that pretrial motion, the burden is on the defendant to prove that they are immune, that they qualify for immunity. In Senator Maxman's draft, the defendant makes a motion to bring up that issue, and then it is the responsibility of the prosecutor to prove that the defendant does not qualify. So on the burden is different in the two different proposals.
I see.
Senator Maxman's burden is on the prosecution, and the Department of Public Safety's version, the burden is on the defendant.
Thank you. That is much clearer. I don't support affirmative defense on any of these, so that makes it a little bit difficult for me, knowing how difficult that will be in either scenario. But thank you for clarifying that.
You're all done, Representative Morales?
Yes.
Okay, thank you. I have Representative Pickett, I believe, followed by Representative Beckett.
Thank you, Madam Chair. I will, at this time, I'll make a motion not to pass.
Second.
It's been,
Madam Chair.
yes,
Madam Chair.
yes.
I would, if the person who seconded that would rescind their second, my motion is ought not to pass. I got a little ahead of myself.
Yeah, me too. I'll go with I'll rescind.
All right.
Okay, so my motion is ought to pass amended with the Department of Public Safety, the amendment that the commissioner put in. I think it strengthens the bill. So that's my motion, ought to pass amended with the Department of Public Safety's amendment.
And I'll second that.
Okay, it's been moved and seconded. A discussion on that? Any clarification? Yes, Representative Beckett.
Thank you. Thank you. I think it's I need a clarification, and I'm not sure where it is, but let me tell you what I need to understand. I'm in agreement with the commissioners and Senator Maxim's shift to a rendering aid standard wording. I'm very confused about the real life difference between someone who says pre-trial that they have immunity and they have to defend that they have that immunity. Doesn't seem wicked different to me from the prosecutor having to prove that they don't have immunity. I mean, I'm just not getting the difference between those two things. I know part of it's because I'm not a lawyer, but part of it is I just can't figure out what the difference is between those two. I mean, both of them are happening prior to the trial. Is that correct? Somebody tell me. I
Yes.
just don't understand. They both happened before the trial?
Yes, the
Yes, one or
question
the
is, who has the burden of proving that they qualify or they don't qualify? Do you want that burden to be on the prosecution? Or do you want that burden to be on the defendant?
So were I to want that burden to be on the prosecutors, how would I then vote on this motion? Theoretically.
Senator Maxman's version of the pretrial motion has the burden on the prosecutor.
Okay. And the
But-
motion that's on the floor is the opposite. Right?
Correct. But I think I heard you say that Senator Maxman's version incorporates only the rendering aid expansion. And maybe you didn't say that, but if you did, that is not what her amendment does. Her amendment expands the people to anyone present.
Oh,
And I don't want to make things confusing, but there are some other things in Senator Maxman's bill, her latest amendment, that Commissioner Sawchuk might like, such as the list of excluded crimes that do not qualify for protection in definitions, subsection 1 in paragraph A. And the people who made the motion might like those also.
Senator Maxim's also includes the law, the anybody in the room piece. Is that in the?
Correct.
Okay.
Her expansion covers anyone at the location. I don't want to speak for her.
Thank you, Jane. Yes, it does include everybody at the location from the time that 911 is called until the time that medical services leave. And it does not include anyone in the excluded lists of crimes.
Right.
Where my name, as I'm the person that made the motion in response to Jane, I was aware of that list of exclusions and stuff, but I stand by the motion I made with the amendment I made.
Thank you.
Representative Rickett, you also understand the commissioner's one is limited to those rendering aid. The current law is only the person making the call.
Yeah, that part of it I'm clear about.
Yeah.
It's the are you all as people also saying that the long list of people who have immunity or can't have immunity because of the crimes they had committed at some point is in both of these? No, it's not in yours, Representative Pickett, but it is in Senator Maxim's. Is that what you're saying? Okay, thank you. I think I understand.
All right, and I will recognize Representative Warren.
Senator Maxman, could you share with us, I just want to be clear for the folks that are here today, that the way that you've worked this bill has been a very, as I think you described at the beginning, that you're bringing the voices of the people out on the ground, doing the work, the folks with lived experience, et cetera, that this has not just been a conversation between a legislator and the commissioner or a legislator and other legislators. So could you sort of paint the picture of what your conversations have been and why you have stood firm with the amendment that we are looking at that's your amendment?
Thank you, Representative. My computer cut out after you said paint the picture.
Oh, well, that was the most important part.
Okay.
I think, sometimes we're doing this work and it's legislators talking to legislators, talking to legislators, and the commissioner talks to a legislator. And I want you to really paint a picture of, you did take this amendment from the commissioner. You talked to him, you went to the affected community, you talked to the community, you have talked to the Republican sponsors on the bill, you have talked to Republican senators, you have talked to a large group of people that are your allies, that they made a decision that they'd like you to stay where you are. That's an example. Could you just have a chance to weigh in on why are you at the place that you are with your amendment, as opposed to with Commissioner Sawchuk's amendment? I think that's what everybody's trying to get to.
Thank you, Representative, for the opportunity. I appreciate it. I have been talking with a lot of folks, both on the inside of our system and in the community. And I think the thing that's most important to me is creating policy that's actually going to try and address the problem that we're hearing on the ground. So the problem that we're hearing on the ground is, yes, only the person who calls 911 is covered, but people are not calling 911, period. I mentioned that report from Washington County in our last work session that 90% of people are not calling 911 when there's an overdose because of fear of arrest. And that fear comes from the ambiguity around, am I covered under the current law or not? So increasing that ambiguity or not addressing that actually isn't really helping all the folks who are experiencing these awful tragedies every single day. And so that's why I'm sticking with this bill. I did review Commissioner Sawchuk's amendment very thoroughly, as did I review Attorney General Fry's amendments and suggestions very thoroughly. I don't disagree with what they're saying, but I think it's just part of the problem. And so I did bring those amendments back to all of the advocates working on all of this, the experts, and the message was really clear that they don't address the problem. I just got a text from someone else who's watching right now who says that she heard again today that someone did not call 911 because they were so afraid of getting arrested, and someone had to literally beg them to call. This bill is trying, I can't express enough like how much work we've put into really trying to make sure that it addresses the problem. And I just really hope that all of you can hear that. I know that it's different, but it's one of those rare cases where we actually are trying to fix it and where we actually can fix it. I just also wanted to add that there is substantial bipartisan support behind this bill. Senator Pouliot and Senator Moore are very strong supporters. There are other folks, who I'm not going to name publicly, but this is not about Democrats or Republicans. It's about many legislators recognizing that this law needs to change substantially, and they are behind the amendment that I have proposed today.
Is that okay? All right. I will, Representative Recchi, you still have your hand up. Are you?
Oh, sorry, no.
Okay, thank you. Representative Costain?
Thank you, Madam Chair. As I sit here and think, I'm very much for the fact of helping people and the fact of basically doing what we can. And I like the bill. The only part of the bill that I can't support is the fact that we're giving everybody in the house a free pass. So what that does, in my opinion, okay, that invites people to this house. So you may have 50 people there, okay, and basically it's a drug house and they can do what they want to do, and it's a free pass for them. And I can't support that.
Okay. Representative, are you asking a specific question, Representative Costain, or is that how you wanted to express your feeling on that?
No, I'm saying I can't support it with
Okay.
the fact that everybody in the house is going to get a free pass.
So
And
we're speaking on this amendment, on this, excuse me, motion, right?
Right.
I'm sorry if I cut you off. I didn't mean to. Representative Pickett?
Yes, thank you. Thank you, Madam Chair. When I work a bill, regardless of whether it's my bill or not, I don't base my opinions on just talking to the commissioner of some department or other representatives. They're all part of the mix, but I do due diligence in what I'm supposed to do to try to determine as to what is the best course of action to take on a bill. And so that's how I vote on these different bills. And quite frankly, the bill that we passed before the Good Samaritan Act was a good bill, and we worked hard to get that passed. And I think in the amendment we have before me, which came from the Department of Public Safety, I think it has also enhanced that bill from before and made it a better bill, but at the same time has kept it in a context where I can get behind it. And the reason being is, if I am at a place and I am in something and somebody has an overdose, I'd like to think, first of all, regardless of whether I'm at a place and I've been taking drugs or not, I'd like to think that nothing would cause me from not picking up the phone and calling 911 and saying, I've got somebody dying here and I need somebody here. Even if I had to run out of the building afterwards. I mean, I have a real problem with that. I really, truly do. Okay. But my thing is, if I'm there right now and I am rendering aid at the time, or I make the phone call to this person and I'm doing something to assist in saving that life, I'm protected. That's what this amendment says. I'm protected. But that doesn't mean that everybody in a big room are there. If they're there and they're doing nothing wrong, so be it. They could stay. If they're concerned about the person that is overdosing, that they won't pass or something like that, I have no problem with that. But if they're there and they have some kind of restriction on them or something like that, and they choose to stay, that's on them. That's on them to do it. Okay. So I spent 40 years of my life putting on a badge and going out and protecting and serving and trying to protect people and save people's lives. And I also want to save people's lives with this bill. And I commend the good senator for bringing this bill forward. I really, truly do. I just can't get around all of the stuff you've added into it, Senator. That's the reason why I want to do something to make the bill better. And I believe that the amendment that the commissioner has brought forward from the Department of Public Safety does that, and does it in a way that other people that have boots on the ground, the people that go and answer those calls and stuff, because those people I talk with as well, and ask their concerns on whether or not we're doing the right thing by doing this bill. So I've asked a lot of different people as well, and I do a lot of research as well when I'm trying to make a decision on doing something. So I don't make this motion just for the sake of making it. I make it because I believe it's the right thing to do, and it's going to save lives. And if we get the message out, which is all part of this, if we get the message out, it's going to make a difference. And so that's why I will be supporting my motion and voting ought to pass as amended.
Representative Warren.
Thank you, Madam Chair. I just want to remind us that the Maine Medical Association, the American Medical Association, the Public Health Association in Maine, Maine Access Points, which is harm reduction, multiple recovery organizations, professors. These are the folks that are out in the field dealing every day with the devastation that happens when people die. You guys have heard me talk about it. I lost 2 of my cousins. I lost one of my best friends. 2 people a day in Maine are dying of drug overdoses. What Senator Maxman has brought forward is what the doctors and the nurses and the recovery advocates and the public health advocates, the folks who are out there are asking us. They came to us and they said, right now, people don't call 911. Professor Sorg is a professor that does a lot of work with Gordon Smith and the administration. She came and gave a presentation here about overdoses in Maine. She shared with us less than 50% of the people on scene when an overdose happened call 911. Less than 50%. We may not like it. I don't like it either. I wish they would. But the truth is, they're not. And they came and they said, please help us save lives. Please let us educate people that first responders have the Narcan. Please call. What I hear is still conversation about a free pass, a drug house. People, 2 Mainers a day are dying. Less than 50% of people at the site call 911. This bill is aimed completely at, we want people to call for help. When someone is dying, if they get Narcan, the person will live. That's what this bill is about. I'm asking that you make a decision to try something new that the doctors have come and asked us to do. I know it goes against 40 years of experience, but the folks who are out there are saying, we're trying hard and we can't get people to call. For me, this bill is about saving lives.
Representative Pickett?
I believe Representative Newman had his hand up a while ago before me. I don't know if he took it down.
Oh, I'm sorry. Okay.
Yes, he took it down. Well, since I've been invoked again with my 40 years, because everybody knows that I did 40 years in law enforcement. And we talk about the medical people and stuff. Well, I presented a bill. A bill on if somebody in school or somebody under the age of 18 got injured and they went to a doctor's office and they were going to be put on an opioid to take for pain, some kind of that to take for pain, that all they would have to do in that bill was to just have the doctor have a conversation with the parent and the person underage to explain to them the concern about getting hooked on that kind of medication. Because I was concerned about, because I know a lot of people get hooked on prescription drugs and they get hooked on painkillers and stuff, and they get addicted by it. And I had people from the Maine Medical Association got up and testified against the bill. And the bill didn't make it out of committee. And I was trying to save lives with that bill. So I think I do care about people's lives. And I do care very much about people's lives. But I also realize that if people are at a place, whether it's 3 people, 5 people, 10 people, I don't care how many people are there, and they realize that their friend, their acquaintance or something is suffering from an overdose, their last thing in their mind ought to be, what is it going to cost me if I pick up the phone? What I ought to be doing is picking up the phone and dialing 911 and saying, I need help and I need it now. That's what I'm saying. And that's why I say this amendment says exactly that, and it says that gives that person the opportunity to do that and to help render aid, and they're all set. And yes, I am passionate about this because I do, and I have worked hard to save people's lives. And that bill was telling to me. So when somebody tells me about them, I ought to be listening to the Maine Medical Association and stuff. When that happened with me and that bill, I'm sorry. I'm not real keen on listening to them after hearing them in complete disgust, just turn around and testify against it and try to get it shot down, which it was in committee. So, thank you.
Representative Warren?
Representative Pickett, I wasn't talking to you at all. The war on drugs has been 40 years.
Well, I took it that way. Sorry about that. I apologize.
When I ever am referencing you, I'm a very clear communicator. So you don't ever have to doubt. I don't mince words at all, and I'm not passive aggressive at all. So I really was speaking about the war on drugs.
Okay. Thank you for that explanation. I appreciate it.
You're welcome.
Well, I guess I should weigh in on this, and probably many of you suspect how I feel. I struggle with this, but I have to cut it down, compartmentalize it one at a time. The original bill, about 3 years ago that passed, all it said is you call to save lives. Please call 911 and you will be immune. It's difficult for me to understand why people who use drugs, are addicted to drugs, probably have had themselves an overdose, that they may call, but they're still in the room, or they may not call because they don't know the law. They're afraid to be, it's a simple law. Call, you're immune. Now we're expanding it to call, and there's two ways of doing it. Senator Maxon's bill says everybody in the room, could be 5 people, could be 7, are immune. The commissioner had one step further, because I think I heard him say, you're on dispatch, someone's on the phone, and dispatch says if you have Narcan, use it. If you don't, CPR right now, and this is how you do it. So someone's on the phone, someone's doing CPR. They might say, lift their head. Is he coughing? So his is just the people who rendered assistance. It could include the person who ran outside the apartment to show the EMTs where the person was. Now we're saying everybody in the room is immune. What disturbs me is, number one, the substance they are using is unlawful. They're addicted to it, but it is unlawful. Some may be furnishing that drug. That's doubly unlawful. Someone might be trafficking in those drugs. That's still unlawful. By immune, and I think it's location, the fact that they're there, they're immune, it doesn't sit well. We are enabling people. The thinking is, nothing will happen to me. I will not be arrested. And that is enabling an addiction, even more so. I truly respect, we got to look at what the Samaritan law is. And by expanding it to that length of everybody, we're not saving lives. That first bill that passed on, please, the phone call, that was to save that life. Now, I know I'm giving people heartburn because they're holding their head, but that's truly where I am. It is difficult. It probably has nothing to do. I left corrections before there was this big thing about drugs. That is not my forte. That's not the thing I understand well. but I just cannot agree with everybody in the room being immune to any offense that they may have caused or created. So I'm being honest. I'm not taking a side. This comes from my heart. So that's it. I have hands up. I will go. We don't normally, I'd have to ask the committee. Ms. Maxim, you are the sponsor of the bill. But if you wish to, let me go to the member, Representative Costain, and then Representative Luckner.
Thank you, Madam Chair. I'd like to ask the commissioner a question.
He is here, you may.
Commissioner, I'd like to have you respond to the fact of when we're talking about the first responders and the boots on the ground. Could you explain that a little bit about how they feel about this situation?
Yeah, absolutely, Representative. I do appreciate that. I'm just going to lead by saying we have the utmost respect for our recovery partners and advocates and the organizations that we work with every day. But I would be remiss if I didn't say that Dr. Sword, who puts together all this data, has also told us that law enforcement officers deployed Narcan, naloxone 337 times in 2021. 337 times law enforcement officers are at the scene, boots on the ground, attempting to save lives with Narcan. And the number of officers that are out there on a regular basis performing CPR and attempting to save lives. That's what they signed up to do. That's what they're proud to do. They're sad to do that. And they're sad to be in that situation, to have to work with folks that are in the middle of that crisis. But when we have these conversations, when I say that I've talked to Maine chiefs as an association, Maine sheriffs as an association, Maine prosecutors as an association, we can disagree about the outcome of one amendment versus the other. But to think that our folks aren't out there fighting to save lives every day, it's just not accurate. And I want to show the respect to the recovery advocates in the community because I know that they're out there fighting hard. I completely get it. But I also just want to make sure that our first responders are represented in that conversation. Just because there are those associations doesn't mean that we're not doing our homework and talking to people that are actually in these apartments, at these scenes, trying to save lives. And no matter what happens at the end of the day, whatever the vote is, I just want to make sure that I'm saying that. We can disagree on an amendment. We can disagree on language. I don't think that necessarily puts us on the different sides of history in this scenario. We are working hard to save people in our communities, period. And I appreciate the opportunity to mention that, Representative Costain.
Thank you.
Representative Luckner.
Thank you, Madam Chair. I want to say before I was looking down at my phone, I wasn't hanging my head. So there was just to clear it there. I want to say, you know, my background, I've got a little bit of background working with folks in recovery, and my understanding, and I don't know that this is, you know, the clinical or definitive definition, but it's my understanding that addiction and substance use disorder is a disease. People are sick. They have a condition that causes them to seek drugs, to use drugs, to act in ways that this committee has a role in criminalizing and stigmatizing. And what that does is, so they act in ways oftentimes that, you know, we've designated this as outside the realm of a law. And I don't disagree. I know everybody here is trying to approach this situation through their own lens, through you know, whether it's law enforcement out there saving lives and protecting people and protecting property, or it's advocates out there working with folks, trying to get them to, you know, find recovery, you know, but where I'm coming from and what I've seen working with folks is that it is a disease, and they oftentimes, you know, we give them the chance to change, they will change. If they overdose, if they die, they will not get that chance, you know? So that's why I'm on board with giving folks that chance to make the right decision, because they're going to act in ways that we don't like, right? That maybe they are, you know, they're scared of law enforcement. They're scared of the repercussions. They're using drugs. That's their main goal. It's not that they don't want to save the person that just overdosed in the room, but, you know, they have other sometimes things in mind. And that's, you know, part of addiction. We want to give them the opportunity to find recovery. So, you know, that's why I'm on board with this bill, with giving people a chance. I think there's a lot of hyperbole about, you know, if we loosen things, if we give people that chance, that it's going to result in some kind of, you know, public safety crisis. I disagree. So that's why I'll be voting for this bill.
Yes, and I'm sorry, I may have made a mistake on that. It's not, I'm sorry, I keep
It's
looking
okay,
at your
Senator.
first
No.
name. Ms. Maxim, to make a comment or a statement, please. I'm sorry if my mind is mush right now. Go right ahead.
Thank you, Madam Chair. I totally understand that. It's okay. I just wanted to clarify one thing and then add a quick comment. I just wanted to draw people's attention to the second line of the bill, which says the following provisions apply to any person who in good faith has sought assistance. So it's not applying to someone just standing around who's not being helpful. That was really clear language that I added into the bill. So I hope that clarifies things. I also just wanted to say that to Representative Pickett's point that, you know, I really do agree with what you're saying, and that these are not choices that we should have to be making in our society about whether we have to protect ourselves or protect someone that we know and love. And that's why I don't think that this bill is idealistic at all. I don't think that this bill is hopeful. I think this bill is a real reaction to the reality of the ground, which is people are facing these decisions every day. And so can we make it a little bit easier so that people do feel a little bit safer to call 911? It's not trying to create the world that we want. It's trying to adapt to the world that we have. And that's not usually how I operate as a person, but that's the reality of what this bill is doing. We want to, you know, when we walk into a room, we want to say, what's the priority here? It's saving a life. And I know that we are all united on that front, and don't think anyone in here doesn't want to save a life at all. And we might have different ways of getting there. But I just really wanted to reiterate that because I really appreciate all of the comments that have been made. But, you know, this bill is about trying to meet our communities where they're at. Maybe one day, instead of changing this law incrementally, we can go the opposite way. We can expand it and then we can refine it, because I don't think the other way will work.
I'll just respond to thanking you, first of all, you pointed out in good faith. For me, good faith is not an action word. I don't know how I could interpret a room with some people in it and one person on the floor needing aid and decide who in good faith had sought assistance when the other amendment says rendering aid. That's an action one, taking action, not in good faith. So, but I'm glad you brought that up. I will mull that over. But that was my first reaction. I got Representative Morales or Jane, Representative Morales, maybe we find out what Jane wants, then maybe that could help. Jane, do you have a question? Or?
Yeah, I'm very sorry to bring this up, but on line 3 and 4, maybe Deb could screen share again. In Senator Maxman's amendment, Deb.
I put it in the trash already. Now I have to find it.
Well, I can tell you what it says. It says the following provisions apply to any person who in good faith has sought assistance and any other person present at the location when the medical professional or law enforcement officer arrives to provide assistance. So it's right there in the beginning of the section. Any person who in good faith has sought assistance and any other person present at the location. So please don't think I'm taking sides, but there was some question about what the actual language was. I wanted to make sure you could see it. Thank you.
Representative Morales.
Yes, thank you, Madam Chair. And I've now taken a look at the bill and really understand that sort of burden shifting piece of it. So I really appreciate the sponsor and her approach to this because I think it is putting first and foremost front and center the crisis and how to respond to that. And I do think that the way that the sponsor is approaching it, that people will call for assistance under this approach because it is a fairly high burden, clear and convincing evidence. And so I can get behind 100% supporting that version. I do think that the commissioner's version will not result in people calling for help. And that is the desired result, to save lives. So I just wanted to put that on the record. Thank you.
He's going to call for a vote. Representative Warren.
I would like to call for a break, please.
Okay. 10-minute break or what?
Sure.
10-minute break? Okay.
I sent the link to everyone.
All right. We shall return.
Kelly, if you're still there, send the link, please.
Mm.
Are the others coming? Did you- okay.
We're back.
Okay, we're waiting for Senator Stairway. I believe Representative Branicki has family around the house, but she'll vote.
Yeah, she's listening. She's entertaining some guests there and stuff, but she's listening. And when it comes
Okay.
time to vote, she'll come on for the vote.
Thank you. Representative Puka.
I just want to make a comment before we get a chance to vote here. You know, the title of this bill involves the title Good Samaritan. We're talking about the nature of faith. And I understand that when it comes to a legal conversation, it's difficult to define faith. But I think living faith is something, you know it when you see it. And this is a chance for me to kind of speak to the folks in the committee here before we take this vote, that Jesus was teaching compassion in that story of the Good Samaritan, right? There was the Samaritan man, the Samaritan, he was a war refugee. He had been beaten out of his land by the Judeans. The Judean was lying in the ditch. Other Judeans, people who had money, walked by and didn't offer any aid. And the Samaritan came along and offered aid. He offered compassion. Now, the man was lying in the ditch because he was robbed, he was mugged, right? But Jesus didn't tell a story where the Samaritan came along and ran to go find the burglars and leave the man in the ditch. That wasn't the story. The story is you bend down to the man in the ditch. That's the most important fact of the story. And you live that, and that's living in faith. And you know, the teachings, from my understanding, are clear. We look out for the poor, we look out for the sick, and we look out for the prisoners. And in this bill speaks to each of those people clearly. And I think we don't have systems in the state that are based upon compassion. We have systems in the state which are based upon vengeance. But I think in this moment, on this vote, we have a choice of where we're going with our vote. And that's where I'm thinking. Thank you.
Thank you. Senator Seaway?
Thank you, Madam Chair, and I appreciate Representative Pluker's thought about faith, and I'm a strong religious man as well, and I would put all things aside for somebody's life. I don't care what it is, and that's my faith, and that's why I'm voting the way I am with Commissioner Shostak's thing. I think it does reach that. So I thank you.
Okay, we ready for a vote? We have a motion on the floor, ought to pass as amended, and the amendment is, how did we phrase that? Department of Public Safety's amendment, or the one that says, do we need, oh, well, we'll let Jane, it's the wording about rendering aid, correct?
I think it came from the Department of Public Safety, and it is, yes, that's it. And it extends the protection to people rendering aid, and it, on the procedure part, makes the procedure the same pretrial procedure, but puts the burden on the defendant through an affirmative defense process.
Correct.
It also removes 1111 and changes it to 11. It's 107A, 1108, and 1111A. Removes the 1111 from the where it says would otherwise constitute a violation of section. It removes the 1111 out of there.
Thank you. I'm sorry I missed that.
All right, Ms. Fahey?
We're voting on 1862. Excuse me. Representative Warren?
No.
Representative Warren votes no. Representative Morales?
No.
Representative Morales votes no. Representative Reckitt? Representative Reckitt?
No.
Representative Reckitt votes no. Representative Sharp is absent. Representative Lookner?
No.
Representative Lookner votes no. Representative Pickett?
Yes.
Representative Pickett votes yes. Representative Costain?
Yes.
Representative Costain votes yes. Representative Rudnicki?
Yes.
Representative Rudnicki votes yes. Representative Newman?
Yes.
Representative Newman votes yes. Representative Pluker?
No.
Representative Pluker votes no. Senator Lawrence is absent. Senator Seaway?
Yes.
Senator Seaway votes yes. Senator DeChambeau?
Yes.
Senator DeChambeau votes yes. That's 6 yes and 5 no votes and 2 absent.
Thank you.
I'm sorry, Madam Chair, I need to know what the people who voted no, what do they want?
Where would the sponsors amendment?
Ought to pass amended. Okay. Thank you. And Dan forgot to ask on the prior bill LD 1552, the motion was ought to pass as amended. And Deb, can you just pull that vote for us?
Yes, we had 1, 2, 3, 4, 5 people vote no, and we need to know what the no vote was.
Was the no vote on LD 1552 an ought not to pass, or an ought to pass in a different form?
You're talking on 1552?
Yes.
Yeah, the no vote on that is just ought not to pass. I believe that, ought not to pass.
And Deb, was that 6 or 5?
We had 6 no's.
Okay, okay. Thank you.
Sorry, for 1552, it was, oh, wait a second. I think I put someone in the wrong. Yes, that's right. It's 6 no and 5 yes.
Okay.
Folks, it's, we all know what time it is. We have bills on Monday and stigmatizing language, I believe, and 2 work sessions, and the budget session is at 1 o'clock on Monday. Session is on Wednesday, and next Friday will be what we heard this morning, and I think one other bill. Yes, 1953 plus the 4 we heard this morning, work session.
Madam Chair.
Yes.
Madam Chair, because in light of the change in the mask situation, are we going to be able to be in committee on when we work next week?
Are we going to be, I missed that.
Are we going to be able to be in committee? They've lifted the mask mandate.
Oh,
correct?
you know, when I read the memo, I was wondering if it said, like, how about the people, the public? It didn't mention the public, did it?
I don't know, but I think where we're not going to be having masks and stuff, I would think we ought to be able to be in committee so we can be there working together like we're supposed to be.
Did it mention still maintaining some distance or not?
I didn't see
Okay.
that.
Well,
Can somebody
hopefully-
check on that though? And maybe, so, I mean, I don't know, maybe we'll get something over the weekend or something. I don't know, but it'd be, you know, if they are removing the mandate and we're getting rid of the mask, then let's get back to work like we normally do and be able to
Well,
talk
you
face to
all have
face.
that chance to
be a
come
part of
in.
it.
Yeah, okay. All right, thank you.
Okay, have a good weekend, folks.
Madam
Yeah.
Chair.
Thank you.
I just want to throw out that there's a chance that we'll be doing the work session on concealed weapons on Monday. And Representative Pickett, I was out of action earlier this week, but if you want a chance to connect this weekend, we could try to get
Right, Dave,
that off of our docket.
I'm glad you brought that up. Dave Trahan wants you to get a hold of him because he wants to work with you on that bill before the work session.
Great. Thank you very much.
Okay.
Okay, thank you. Bye-bye.